Respected dignitaries, chief guest, guest of honors, special guests, awardees, friends, family, and dear audience. On this beautiful note of Sarve Bhavantu Sukhina, Sarve Santu Niramaya, I, Rajeshri Gadkar, founder of RSG Nutrition Healthcare and TRUWELLTH Integrative Healthcare, welcome you all to our annual Founders Day celebration of the life of our founder and mentor, my father, R.S. Gadkar, his 78th birth anniversary. This year, with the 8th RSG Wisdom and Excellence Awards ceremony, we also launched the first Integrative Nutrition and Health Summit 2024. R.S. Gadkar revolutionized the Indian pharmaceutical and healthcare with purpose, passion, science, compassion on one hand, and business, marketing, commerce on the other. Through his 5 decades of long journey, which started right from penicillin to building endless number of top brands like Monocev, Plexon, Glycomet, Ecosprin, Gemcal, Micacin, Ondem, Doxivan, R.S. Gadkar pioneered continuing medical education in the country and empowered and supported various conferences and associations like API, IMA, MAP, ICC, CSI, RSSTI, ASI, TOA, IOA, TraumaCon, VIROC, and health practitioners in bringing about a paradigm shift in academics. Fostering relations with love and care, he earned the most precious wealth of friends, colleagues, and extended family like you from all over the world. So let's watch a short video on his life journey. With this profound vision and our strong purpose of developing effective nutrition and nutraceutical therapies to reduce disease burden for generations to come, I take his legacy forward with TRUWELLTH Integrative Healthcare, RSG Nutrition and Healthcare, and MediNext. TRUWELLTH Integrative Health Centers were established with the mission of Sarve Bhavantu Sukhino, Sarve Santu Niramaya, meaning true wealth of holistic health and happiness for all, to control, reverse, and prevent diseases and augment health by integrating all appropriate scientific, evidence based personalized nutrition and fitness therapies, functional medicine, and advanced surgical treatments with a holistic wellness approach. This coincides with Prime Minister Narendra Modi's vision of the flagship Ayushman Bharat Health and Wellness Centers initiative. Integrative healthcare does not mean alternative medicine. At TRUWELLTH, eminent medical doctors, surgeons, personalized nutrition, and fitness experts focus on the patient as a whole person to identify and address the root cause and bring about true relief from diseases by combining ancient wisdom with modern science and bringing about a deep collaboration among health practitioners from multiple disciplines to create a comprehensive health ecosystem to help patients meet all their health needs, including physical, emotional, and social. With this purpose, we launched the first Integrative Nutrition and Health Summit 2024 for healthier and happier global ecosystem. We express our deep gratitude towards our associates who supported this first Integrative Nutrition and Health Summit, the World Congress on Cardiometabolic Medicine, WCCMM, International Metabolic Physician Association, IMPA, Kaushalya Medical Foundation Trust Hospital, Thane Vaibhav, newspaper and channel for being our media partner, and our nutrition partner, of course, Energy and Nutrition. We express our deep thanks towards healthcare stalwarts and leading experts, doctors, researchers, and industry professionals for joining us today to share their knowledge and deep insights in leveraging nutrition and nutraceuticals in medical and surgical practice to cure, control, and prevent various diseases, as well as to deliberate on the recently published ICMR Dietary Guidelines. Let food be thy medicine. Nutraceuticals are nutrients derived from vegetarian, non-vegetarian, and herbal foods, having potential role in both preventing and treating diseases. They can enhance overall health, improve quality of life, and extend life expectancy in both healthy individuals and critically ill patients. Being natural, they can be wisely used to accomplish therapeutic results with minimal side effects. For this reason, I was deeply fascinated by nutraceuticals when one of the first Indian nutraceutical visionaries, that is my father, introduced me to them in as early as 1990s. R.S. Gadgil was really working on many formulations in the 1990s. Eventually, I completely got gripped with nutraceuticals while I began studying them whilst being in New York City which was almost 2 decades ago. At that time, presence of nutraceuticals in India was very basic, and many international supplements in the Indian market, even today, are not specifically formulated as per Indian consumers' health and body composition. Besides, nutraceuticals are often confused with dietary supplements and functional foods. Dietary supplements and functional foods are available over the counter because they contain complementary or low doses of nutrients, which may not be adequate to provide therapeutic benefits. This is why, though the market is full of nutrition supplements, there is need for effective and safe formulations, which can greatly help treat various lifestyle and autoimmune diseases. With 20 years of global experience, having helped many various many first their diseases and various ailments like diabetes, PCOS, weight loss, and more. I firmly believe that nutraceuticals and nutrition supplements can be modern day's most effective and safe therapy in managing lifestyle, autoimmune, and infectious diseases, which is why RSG Nutrition and Healthcare Private Limited was established with a strong purpose of developing effective nutrition therapies to reduce disease burden. RSG's scientific research-based nutraceutical and nutrition supplements under the flagship brand Energia are meticulously formulated with international quality standards from modern research, with ingredients from modern research and ancient insights to manage various health conditions like diabetes, arthritis, IBS, and many more. Today, Energia products have happy consumers all across India, but also all across the US, and will soon be available in Canada, South America, and Europe. To bust some myths today, let's understand that just as medicines have short and long-term side effects, and many a times its dose keeps on increasing, inappropriate use of nutraceutical supplements could also cause side effects. However, with right advice from your doctor and or nutritionist, it can prove to be an effective therapy. That is why we have such an eminent faculty joining us today for the first panel discussion of the first Integrative Nutrition and Health Summit 2024. And the topic is integrative role of nutraceuticals in lifestyle disease reversal. And evidently so, the first faculty that I would like to take the proud privilege to introduce is Dr. Nitin Patankar, who is MBBS, MD, General Medicine and Community Medicine, 32 years of experience in this field, post-graduation from Bombay University, especially in lifestyle disease management, also from the Johns Hopkins University, Baltimore, and the Duke's University, Durham. He's, of course, the director of Wisdom, Diabetes and Yoga Clinic, and is consultant at the Jupiter Hospital, and as well as consultant metabolic physician at the Hiranandani Hospital in Mumbai. Followed by Dr. Vimal Pahuja, who is also greatly experienced in this field. He's consultant and in charge at the metabolic department at the Hiranandani Hospital in Mumbai. His key areas of interest include obesity management by multidisciplinary approach in patients, diabetes management, remission technology in obesity, and he's member of the Obesity Task Force Maharashtra State. And I'm sure we're going to gain a lot of inputs from these two speakers, because they're also the founder members of the International Metabolic Physicians Association, which has supported today's event here. In addition to, of course, understand more on the women diseases front as well, we have Dr. Alpana Soni. She's MBBS from Somaya Medical College and has a diploma in diabetology. She practices as a consultant with the SL Raheja Hospital, as well as her own clinic in Vile. She is passionate about reducing the burden of diabetes in the society. With that, I would really welcome the three panelists here, and I'd request them to be on the stage. So, a warm welcome to all of you. Happy to have you here. Dr. Nitin Patankar and Dr. Pahuja, thank you so much for supporting this event here today. Would you like to say anything before we start this panel discussion? Okay.
Congratulations, Rajeshri, for your first integrative nutritional health, and a very good warm welcome and good afternoon to Dr. Nathan Patankar and Dr. Paucha as well.
Sure. So,
yeah, so, thank you for inviting. First of all, it is a great pleasure to be here on this dais, and thank you, Dr. Alpana, for being the panelist. Thank you for inviting, and this congratulations on this Founders Day. And I think we'll take a lot of positives from this meeting today. Thank you.
Great. So, globally, as we know, Dr. Pahuja, that obesity numbers are like 650 million, and they contribute significantly to the burden of cardiovascular and metabolic diseases. In India, the prevalence of diabetes and heart disease is alarmingly high, with over 77 million people affected by diabetes alone, despite so many medicines and supplements that are available. So in converting India, which is the diabetes capital of India, in converting it to the diabetes treatment capital of the world, what really needs to be done is what really we would like to elicit out of this panel discussion here. My first question really goes to Dr. Soni. What are the primary nutrition and nutraceuticals that you recommend for diabetes management, and are there nutraceuticals that help improve the insulin sensitivity and glucose metabolism at a cellular level, really?
So thank you, Rajesh, for that question. As we are starting in terms of diabetes and not only obesity, we know it's a lifestyle disease. And when we talk about management of a lifestyle disease, it has to start with lifestyle. And there definitely our nutritional intake as well as nutraceuticals, all of them have an important role to play. Whether it's vitamin D, vitamin D in fact has been shown and proved to have not only effects on the bone metabolism, but it definitely has been proved to show that there is, because of its antioxidative effect and also the effect on, as you know, it improves the insulin sensitivity. It's basically from the factors of, I come from Raheja Hospital and we worked with Dr. Raheja for the longest time. And he has never stopped expressing how important it was to rule out the oxidative stress load which occurs because of these diseases. So definitely nutraceuticals have a role to play, whether it's vitamin D, whether it's the chromium, the glucose tolerance factor, whether it's calcium. A lot of them are there. In fact, even things like alpha lipoic acid and all, they do play a role in management of the disease and prevention of complications.
And mute myself, Dr. Patankar. Having said what Dr. Soni mentioned, is there also overlap between the digestive diseases and diabetes? At least I see that in my practice. How does one really take care of that one organ which plays two critical roles of insulin secretion as well as secreting the digestive enzymes? Could you throw light on this subject?
Definitely. Thank you, first of all, and congratulations for this mega event. What you said is right. We talk of only endocrine pancreas, and a lot of research has gone into that, but even the pancreas per se as an organ undergoes inflammation. And with inflammation, we have got a deficiency of exocrine pancreas also. So these two things are related, and once the exocrine pancreas is affected, the enzymes secreted, basically proteases, lipases, and amylases or glucosidases, they are also affected. So that if you can reduce inflammation and support with enzymes, then the diabetes management becomes much better. But the catch is in diabetes and obesity as a combined disease, we want to prevent lipases from acting vigorously, glucosidases from acting vigorously. So we want to block the absorption of these two elements, or at least retards the speed of absorption. And at the same time, we want to maintain proteases so that the protein intake is maintained. So we definitely need a exocrine pancreatic support. Like we have got a lot of enzyme preparations which are available. You have also that pancreas, which is an excellent drug. And secondly, as Somni mentioned, alpha-lipoic acid has got a great role in improving the inflammation in pancreas, along with curcumin and resveratrol. These are the two elements. There are small studies, but there are a lot of studies which have shown that by helping exocrine pancreatic function, the control of sugar or even endocrine pancreatic function also improves.
So it was good that you also added on the inflammation part of it, and I'm going to, of course, ask a bit more in depth about it later. But sticking to diabetes again, severe diabetes, Dr. Soni, you especially being at such a large center being attached to a large center like Vijay in Mumbai, you see severe diabetes cases, and they lead to kidney disease, diabetic foot, and these are more life-threatening or disabling. So, there, do you really use any nutraceutical support, or how is what is your nutrition guideline normally out there to you, so that the overall outcome improves, because these patients are also a bit more reluctant, and it's a bit more difficult for them to follow any regimens.
That's truly said, Rajshi, that these problems do occur. Going back to the root of the disease is better management of diabetes, where nutrition will play an important role. We have to make sure that the foods, see, a lot of time, by the time kidney disease kicks in, the patients are not very happy eating. There's a loss of appetite. There are so many restrictions. So sometimes fortified foods with multi-nutrients, with the said amount of proteins, with a good amount of fiber, all of these help in, these fortified foods. Also in patients with diabetic foot, wherever we are giving nutraceuticals in the form of, it could be methicobal, it could be alpha-lipoic acid. In fact, even these pre-digested proteins in the form of, the arginine, they do help in improving blood supply to the feet. So we always have to look at the whole picture. For each ailment, giving one particular treatment becomes difficult. I think improving overall nutrition and fortifying it with the nutraceuticals is always going to go a long way in better outcomes with the patients.
So, with diabetes, a lot of times we have, say, divest, and weight loss is really everyone's favorite, isn't it, Dr. Pauja? I mean, it's the most Googled word, and everyone has some sort of a gyan to be given when it comes to it. And then there are, of course, questions about meal replacement formulas. Do they help in weight management? I mean, do you sort of really see a benefit out of them, or are there any other nutrients that you look at when you're treating your patients?
So first of all, I would like to come to the statement of weight loss. At what expense and what benefits? That's very important, because extend the statement. That weight loss statement only is creating a lot of problem and quackery. So clearly the statement has been made by all the world obesity bodies that we should look at obesity care and not the weight loss. And obesity care does not equate to weight loss. So I think that is the first and foremost responsibility as a practitioner, as a clinician, as a researchers, to percolate not only in the scientific forums, but not only on the social media forums, that this word weight loss has to be kept at the back of the care. The obesity care has to come first. Then only we will be able to percolate the right science to our patients and our family members. In fact, so many things, myths keep circulating because of weight loss. So that is the first thing I wanted to address, that weight loss is not obesity care, and that's why weight loss could be looking good, but obesity care, we are trying to make you healthy by right advice, and that's very important. Second thing is coming to weight, the formulations which you're talking about, meal replacements. Yes, there is definitely a role of formulations in our obesity care, because the staging of obesity, which is very important now, we see patients going to stage 2, stage 3 obesity. There probably we have to use them when we want a little more weight loss, because they have in the state where you want to avoid complications. They already had organ damages occurred, and we want that weight loss to happen to save the organs. So definitely we are going to use it there. We want to use diabetes, want to have diabetes reversal, and you see Dr. Roy Taylor has clearly used those meal replacements to tune of 800 calories to reverse diabetes, and there we want to give a shock to the liver, reduce the calories, and many more situations where you cannot actually address you can procure the right kind of a food. You're procuring the right kind of nutrition also challenge nowadays. Taking right kind of a diet is also not challenge, because you cannot procure right kind of a diet. If I want to do some diet today, also I have to think 10 times from where I'll get this thing stuff. So that's very important. There, people who cannot use this traveling, they can use those meal replacement formula, which have a right balance of calories, proteins, nutrients, vitamins, and right serving size is them. So it gives you right kind of portion size also, and that case kind of gives a biofeedback that you have to in future also they start eating in the right portion. So that also kind of changes the behavior of the patient. So there are a lot of advantages, but it should be used in a specific situations for specific people and not for all. That is a word of caution and under the medical supervision.
Absolutely bang on. I mean, I think this is what we all really need to understand, and this is really the purpose of this meeting out here today, because the ICMR guidelines have come out and which throw light on protein consumption. But of course, we have Dr. Sesikeran later in the program today, and he did clarify also that this has to be, of course, used with caution, but also the current guidelines are more pertinent to the regular individuals who are not suffering from any diseases. When we are looking at organ failures, or when we are looking at protecting the organs, I think what you said as I hope viewers take that home as a message. With that, I think there are one more myth which I would really want you to clarify, because there are, I personally think it's a myth. I don't know if it is, but there are a lot of products which are there over the counter, and they sort of make promises that they can alter the metabolic rate, they can actually influence the fat oxidation and appetite regulation. How much of that is really a truth, and are these supplements really safe?
So the interesting point here is that these products which you're talking about are in vogue, and people are used to take them, and they are really fascinated by these products. The way you present them and the way you market them, the way you make their benefits and appealing, makes them very kind of a lucrative thing, and people start. It's an easy way out for these people, and point is that they don't underscore the importance of lifestyle management, the diet and exercise, which is the crux of the entire thing. So people start thinking this is the only thing, this is a magic pill. If I take this, I'm going to lose weight, which is not the right thing to do. So the clear advice to you is it should be under discretion of medical professionals. And if you look at the fat burners also, many are there in the market, which you see some people stimulate appetite like green tea and coffee extracts. Then you have Garcinia, of course, they are appetite suppressants. Then you have a glucomannan as a fibers. So many are L-carnitine. I think Dr. Tirin Patan has used them, all of them, because I think when he started practicing obesity, obesity drugs were hardly anything. So he must have definitely used, or some of them which have some evidence, but we still don't know the true effect of these fat burners, how they actually work. The point in these challenges with these are that we don't know the true dose of this, so we don't have dose finding studies actually. We don't know the long-term side effects, and if you combine what is going to be interaction with other drugs in the prescription, and what are the side effects, and the organ function which can change because of these fat burners. So definitely there is some role somewhere, but it is not to the complete effect. We don't know the true effect. So definitely you have to focus on your lifestyle, diet and exercise. Maybe they can play an assistant role, a supplementary role, ancillary role in your management under the supervision, but they should not be taken without supervision, and they are not the wholesome thing to be bank on.
So like you said, magic wand, I think I will go to Dr. Kakatkar, because all this while, and I'm sure he's going to smile, because all this while he has been telling people that everything has to be a holistic approach. You have to be disciplined. You have to follow a lot of things, and I've known him for doing all this for a while. So I have some complicated questions, especially designed for him in this panel. But because he has in-depth studied oils and lipids for a while, and the supplements around it. So Dr. Kakatkar, dyslipidemia is something which we know as a scientific term, but how do normal people understand what exactly it is? Because it can be a cause, or it can also be a risk factor in lifestyle diseases. If you could explain it in a simpler way, which is really a forte, and how do we go about controlling them or managing them with nutraceuticals?
So basically, dyslipidemia is related to two kinds of fats. One is various kinds of cholesterols and triglycerides. Now, we basically need them to form various kinds of hormones, cellular membranes. So they are not toxins, or they are not the products which are to be avoided completely. So we need them. So from sunlight and cholesterol, liver produces a lot of these products. And simple terms, the process is something like one person or one car comes to take the child to the school. That is LDL cholesterol. And one person who takes the child from school to home. So that is a reverse process where it is brought back to liver to manage it. That is HDL cholesterol. That's why HDL cholesterol is called as good cholesterol, while LDL cholesterol is called as bad cholesterol. Now, these cholesterol molecules, basically cholesterol and triglyceride molecules, are encapsulated in various kinds of proteins. They are called as lipoproteins or apolipoproteins, and they are got the receptors where they can be picked up by the cells. Now, first, let me clear that there is a big study conducted which said that dietary cholesterol or dietary fats have got no role in blood cholesterol. And people started jumping A to B, B to C. And they started thinking that any kind of a diet and cholesterol has got no disease linked to heart disease. So that is untrue. Because whatever you eat, liver has got different enzymes to produce the quantity of cholesterol, but blood cholesterol has got definitive risk factor for heart disease. Now, that is the crux of the matter. These cholesterols keep on moving in blood, and they are picked up by various cells, and even endothelium. If there is a gap between endothelium, these oxidized lipid molecules can go and form plaques. Now, coming to this today's topic, that is nutraceuticals, the standard therapy is statins. So, if the cholesterol levels are high, statins have been proved to be really helpful. But if the cholesterol levels are low, and patient has got a definitive risk factor like family history of heart disease, or HSCRP is high, lipoprotein, small a particles are high, ApoA1B ratios are high. These are all various risk factors. Then we can always try to begin with some nutraceuticals, and there are various nutraceuticals have been shown to affect the cholesterol levels. One of them is omega-3 fatty acids. So right quantity of omega-3 fatty acids and not marketing dose. So usually you have got good amount of EPA, DHA, along with short chain fatty acids like we find in walnut or mustard oil. Combined together, they can lower the triglyceride levels as well as cholesterol levels and inflammation. Then we have got plant sterols and stenols, which has got an effect of lowering LDL. Then there are various studies have been conducted which show there is a beneficial effect of conducting or lowering the LDL cholesterol levels so that you can keep the statin dose minimum. So the complications of statins like starting new onset diabetes or muscle pains can be reduced, and they are like soluble fibers. Then there is a very potent product called as red rice yeast extracts. So these are available in market. Then we have got green tea, and garlic has been shown to be really an anti-cholesterol agent, but for which you have to eat around 6 to 8 garlic cloves morning and evening. Then berberine is another thing. Berberine extracts. They can reduce the total cholesterol levels. Coenzyme 10 is known. Then niacin, which can raise HDL cholesterol or good cholesterol levels. But along with walnuts, if I can, I usually advise my patient to take around 8 to 10 walnuts per day without niacin, because niacin can have got a lot of problems of flushing, and curcumin, curcumin is common to many lifestyle disorders because it is anti-inflammatory. So if these nutraceutical products are used judiciously, we can keep the cholesterol under bay, or we can keep the minimum dosage of anti-cholesterol medicines, protect your muscles, and still get the risk reduction regarding heart disease.
So I would just, since you mentioned about the doses, especially with the EPA DHA dose, another comment I would like to make out here is also it's very important to know which source it is coming from, which brand that is making it, because quality really really matters in these things, especially when we are dealing with oils. I think rancidity is the worst enemy of oil. So I think anything good, but if it goes rancid, can actually affect very badly. So these things also need to be kept in mind as just something I wanted to, knowing, having been into this profession, designing different products and making them. So where they're made and how they're made is really carries a lot of weightage. But you did mention about inflammation earlier. Inflammation and oxidative stress is again something which I know a lot of you physicians have been talking about, but I think COVID sort of made it more evident to all of us. Does that really exist? I mean, is there a chronic inflammation and oxidative stress? Because I firmly believe in it, but what is your thought, Dr. Kakatkar, on it? And are there any other are there any specific nutraceuticals or nutrition inputs that you have? Because you've already told us about so many of these different nutrients and supplements we can actually use.
No, definitely oxidative stress do exist, because the most common toxic substance in nature is food. So if you have excess food, the food enters into the cells, and where it has to be nullified, so body produces nascent oxygen, and to nullify these effects, the collateral damage is all other cellular organelles like Golgi complex or mitochondria. So we require both kind of antioxidants, and this oxidative damage can cause inflammation. So inflammation is like body stress, and mental stress is like emotional inflammation. So we can call it inflammation, or some kind of a combined word can be used for that. So that's why we have to take care of oxidative damage and inflammation. And definitely there are various food sources which are available to control this inflammation and oxidative damage. The curcumin, green tea, which are like known, again the doses are not known, because full dosages they can act, but nobody has conducted hard-end trials, because you can deprive someone of some substances and then conduct a trial. That's why there are small trials, but definitely there are indicators that they really work well. Then there is a substance called as quercetin, which is ubiquitously present, which is again have got good anti-inflammatory, antioxidant properties. Then vitamin C and E are very commonly known as antioxidants, but they are basically surface antioxidants. So they are extracellular antioxidants. But the main antioxidant requirements are inside the cell. And inside the cell, we can have something like glutathione and selenium. These are the two substances which are intracellularly acting as antioxidants, and astaxanthins, which is very good in anti-inflammatory substance. So if we can have these substances at our disposal, so they can be additional therapy to our main therapy or main prescription, and then we can control the disease process, and the remission or reversal is possible, or at least keeping the medicines at lowest levels and using these nutraceuticals. So they should go hand in hand.
So absolutely, and I think, like we say, seeing is believing. Some of these ingredients, with proper advice, like Dr. Pauja mentioned, if we sort of start trying them, we can feel the the difference ourselves. It's so much of, if you're experiencing brain fog, you try these kind of things, you will immediately feel the relief. So let the nutrients speak for themselves. So that's what, and not to lose belief in them, because as food causes inflammation, also there are good foods which can help reverse them. But another sticky issue in obesity and the metabolic syndrome is thyroid. So major contributor, Dr. Prahoja, to obesity. Many a times, especially when women have tough time because they, as it is, deal with hormones. But are there any supplements that we should recommend? Is there any very evident strong supplement or nutrient that has helped in this reversal? Because in my experience, of course, I know it's a very tough tightrope to be able to even control thyroid.
Yeah, actually, if you look at the obesity and thyroid, the relationship is like obesity can worsen your thyroid status, and actually there are a lot of people who have elevated TSH may not be having actually true the hypothyroidism, but it's just because of the obesity, the weight gain, the TSH is shifted up. So that also is very important that we do not start treating all the patients who have elevated TSH with obesity. Sometimes just losing weight will help to reduce the TSH level. That is very important, and that's been shown in a lot of studies. But having said so, there's a lot of issues offsetting the thyroid hormone and the obesity. There are a lot of challenges. You have to take hormones. Of course, it's altroxin. It's autoimmune disease. Finally, it's an immune disease. It's autoimmune disease. So, but there are certain nutraceuticals which you can definitely use. They're like selenium or iodine. It has been shown to, in some small studies, to downplay the what is called the anti-mitochondrial antibodies and anti-thyroid antiglobulin antibodies. So these can actually help to reduce the challenges, the inflammation or the autoimmune damage to the thyroid gland. Selenium in small studies. However, there's no large studies to document the true effect of selenium on hypothyroidism. And again, the same as iodine is very essential for the thyroid function. So that also is vital nutraceutical or vital nutrient for thyroid gland. But again, if you have the deficiency, you have to actually give the iodine externally. So that's by known facts which we know. But there are some things like ashwagandha has been tried and is shown to play with the hypothalamic pituitary axis, and it actually reduces the T4 TSS level, T3 levels. I have not personally used my clinical practice but there are some theoretical papers, small studies looking at the effect of ashwagandha and hypothyroidism. So there are things which you can use if patients are not able to control, not able to tolerate hormones, they're having side effects because of these thyroxine. You might try out to them and see what the effect is. But there are no clinically documented studies, very big studies to show that they will be useful as such.
So I think this is where we have the scope for becoming the diabetes treatment capital of the world. And I think more deeper research, and I'm sure with the association that you formed and the activities you're doing together, I'm sure we can tie up similar activities and sort of solidify the treatment approach in this in managing obesity, diabetes, and the metabolic syndrome at large. So, of course, thanks to you for having such an put together such an association together. And being women, I can't but not ask this question to Dr. Soni about basically weight loss is a more challenging issue in women, given we got the gift of hormones and psychological and social factors add on to it. So do these factors really sort of lower the basal metabolic rate, and do we have a different fat composition? So how do we women sort of get ahead with addressing any metabolic syndrome related or lifestyle diseases?
So Rajshri, it's like you like it or you lump it. We do have the hormones, we have to live with it. The problem which is more pertinent in women is there are too many phases of the hormonal challenges, whether it is puberty, whether it is gestation, whether it is the postmenopausal period. We have too many hormonal storms, I would like to call it as that. We do have a difference in metabolic rate as compared to men, definitely. Also, the coexistence of thyroid disease, the coexistence of PCOS, which we are seeing increasingly large numbers of currently in India. I think all of them are definitely contributing to, the greater amount of weight challenges for women. Also, I feel the pedestal women are put on, or possibly the women are putting themselves into, that you have to be looking up, a particular weight, and your weight has to be perfect. I don't think it is so much needed. But yes, during the postmenopausal phase, the hormones are creating havoc. It is a reality that the weight gain is much larger at that time. But I think that it is very doable with good nutrition, good exercise, managing the obesity. And I really like the statement which Dr. Pahuja made earlier, where he said it's not only about the weight. We have to treat the obesity. It's a disease. So I remember reading this statement which talked about the 3 M's. We need to treat the mental part, the mechanical problems, and the metabolic problems, all of them together. We seem to be only harping on about the metabolic problems, but obesity management is also taking care of the psychosocial impact of the disease. I think the weight shaming, which is there in the public, that needs to stop. And the mechanical defects. A lot of times people are told that why don't you exercise? But in grade 2, grade 3, obesity, especially in women, and with the decline in the menopausal time when estrogen is not there, your calcium, vitamin D metabolism is also affected, and where exercise becomes more and more difficult with the reduced metabolic rate. I think in addressing all these issues together, is definitely going to go a long way in helping the women improve their weight. Definitely. The woes of the weight, as I call it.
So with that, you really addressed my next question. And, this panel can go on for the entire day because there's so much that we can actually probe in and discuss and, educate people on. Like you said, there are different life stages that we go through. If you're aware about the issues that are going to come up, so much, we could be so much more well prepared for it and experience lesser issues. But having said that, I'm going to put the last question for this panel today, and with the promise that we all should get together again and have more extensive discussions on these lines as to how to manage obesity, because it's such an important factor in managing metabolic diseases. Having said that, what do you all feel? Is it instead of letting people follow these fad diets, is it a better idea to have a tailor-made, personalized plan in lifestyle diseases? And how much important is it really? Because I know Dr. Pahuja and all three of you rather, practice this an integrative treatment, or managing a comprehensive approach to having medical nutrition and behavioral strategies put together. If any of you would like to sort of summarize that for this panel discussion.
Well, I think this integrative approach is very, very important when we're talking about obesity care. So that's why when you talk about the obesity care and we're talking about integrative approach, the weight and weight loss things takes a backseat there itself. So that's why we have to actually keep talking about the integrative approach, because that will only enable the right kind of care to the people. Otherwise, everybody can give you a weight loss pill. That's not difficult. So that's very important to understand that what are the needs of the patient, what is patient currently preferring to eat and what he is supposed to eat, what are his cravings, what is his mindset about the food, eating history, everything has to be seen. It's very important to see the essential and these small elements which you can incorporate in your practice. That's very important. Behavioral change is very important. So we have to not looking at weight loss It's just not like coming in the hotel and eating food and paying bill and going away. No, we have to look at this, that this is a consolidated thing, that he comes to a hotel, eats food, comes again and again to do the same thing because he's your loyal customer. So he has to be attuned to the fact that he has to inculcate the behavioral changes in such a way that it has to be repeated daily so that he can maintain the weight. Anybody harps about the weight loss, nobody talks about weight maintenance. I don't see a weight maintenance clinic anywhere in the entire city. We all have to look at the weight loss clinics. So that's very important to underscore that a weight loss as with weight maintenance as equally important, and that can only come if you give a holistic care. Take about a diet, talk about exercise, talk about the mindset, behavior, sleep, stress management, so many things, and then only you will be successful in treating the patient as a whole and not just the weight.
Great. So
I can only add one point, sir, is that whatever we do, it has to be sustainable. It's very easy to do things for a small period of time. We need to make the patients understand that do whatever you can, that you can sustain it for a long time.
Absolutely correct. And I take that point. Sustainable, practical solutions have to be offered. Offer problem solving if they are not able to procure anything, what you should do. That's very important. Problem solving at each step of life event. When the life events are changed, what you should do. So events have to be understood, and then according to the solutions have to be offered, and that's very important.
Dr. Patankar, before we close, your one-line wisdom.
Basically, motivation has to come from within, and the weight loss and the fat loss, basically obesity control, give rise to joy, and it helps in achieving your larger goals of life. Then only the weight loss is sustainable. So the most important factor in obesity treatment panel is psychologist. So that is usually missing from all the setups. So we need a psychologist who can give purpose of life, where the weight loss and fat loss and obesity control becomes immensely important to achieve larger goals of life.
Great. Thank you very much for all of you, for joining in for this panel discussion. We will have to actually quickly move on because we are a little behind time. And so RSG, RSG always wanted to create a wisdom forum to be able to treasure the wisdom and best practices of healthcare stalwarts and experts around the world. To achieve the noble purpose, every year his birth anniversary is marked by presenting the RSG Wisdom and Excellence Award to healthcare stalwarts. The aim is to collect, decipher, and propagate the wisdom and excellence of legendary medical practitioners, leaders, and teachers from around the globe to enable the forthcoming generations to gain the in-depth expertise and experience to further excel and provide exclusive service to mankind in reducing disease burden and take the wisdom and excellence legacy forward. Let's look at the past awards presented and the purpose. The first award, first RSG Wisdom and Excellence Award on the occasion of late RS Gadgil's 78th birth anniversary goes to Dr. Vijay Kakatkar. You have to meet him to know what kind of a pleasing and deep orthopedic surgeon he is. He's first distinguished orthopedic surgeon with surgical excellence and comprehensive patient care. But let me take the privilege to introduce him. He's of course MBBS from Vijay Medical College. He's done his MS or D or from Pune as well. For 4 decades, he has been in practice, especially with general orthopedics, trauma, and spine surgery. He has been among the first orthopedicians in Nahsik to have a well-equipped orthopedic hospital since 1983. And of course, now they have a very much advanced new setup. He really got Nahsik the recognition in the field of orthopedics due to his extensive surgical work, research, and teachings. Chief of the unit and director of Ramakrishna Medical Research Center. He runs the D-Orth course there for more than 25 years and has trained more than 90 orthopedic surgeons who are practicing all over India. He conducts regular surgical and diagnostic camps in rural areas of Nahsik for arthritis, osteoporosis, etc. He has been chosen as the CCOT Traveling Fellow in 2001 and at an all India level to attend the American Academy of Orthopedic Surgeons in the USA. He's basically been faculty member for the AO International Trauma courses, and also he talks extensensively at many orthopedic conferences like MOACon, TraumaCon, VIROC, and many more. He's the founder and life member of the Maharashtra State Orthopedic Association and the past president of the same. He's also the past president of Nahsik Orthopedic Society, president of the Nahsik Education Society. He's member of several professional organizations like the AOS, of course, CCOT, Asia Pacific Orthopedic Association, Association of Spine Surgeons of India, Pediatric Orthopedic Society of India, Trauma Society of India, Indian Orthopedic Association, which is one of the largest. He has, of course, received numerous awards. The list is endless. The Economic Times Award for the Inspiring Surgeon in 2019, Icons of Nahsik by Lokmat, Dhanvantari Puraskar by IMA, Shiv Gaurav Puraskar by Nahsik Samachar, Nahsik Bhushan in 2012 by the Rotary Club. So you can see how recognized he is for the great work he has been doing and also a lot of social work that he has been contributing to. So with that, I really request Dr. Kakatkar to speak and tell us about his life journey, the difficult times, the great times, and the perseverance it has taken for you to get up till here. We would like to hear it also.
Hello. Can
Yes.
you listen to me?
Yes.
Yeah. Well, good afternoon, everyone. I'm very happy to see my friend Sanjay Agarwala. Hi. And I have listened to the first discussion that was going on the nutrition part. I think it's a very important part of everybody's life, and I think you people are covering it very well. Well, as far as my journey into this field of orthopedics goes, I think I will like to start right from my childhood days, where some of the basic principles of life were imbibed by the family. I was born in a very small place called Sangamner, which is in a Nagar district. It was a small taluka place, and I was born in 1950. on 3rd of October over there. My father was a school teacher and principal of one of the schools later on. That school was one of the very reputed schools in the Nagar district, and number of people who have reached various heights in various fields, they are the past students of that school. Coming from a teacher's family, I think the basic importance of education was imbibed on our mind right from the childhood. And that has helped us to go further in our life and to update ourselves all throughout. After completing my schooling till 8th standard in place like Sangamner, my father shifted to Pune, and we shifted from Sangamner to Pune. And then I had the privilege of taking my further education in one of the most reputed schools of Pune, that is Nutan Marathi, or it's very popularly known as NMV. And that was one of the schools which has again given stalwarts to the country in the last more than 125 years. After completing my 11th standard SSC, which was at that time, well, I took my further education in Pune in the Garware College for the first 2 pre-medical years. And then in 1968, I joined Vijay Medical College, Pune. That was one of the reputed medical colleges in the country, and I was lucky to have excellent teachers during my undergraduate career over there, who again imbibed a lot of values in our mind about what is the importance of education and updating in the medical science. So after completing my MBBS from BZ Medical College and doing my internship, when I was doing my internship of 1 year, I had occasion to work in the Nahsik Civil Hospital. And that time I realized that Nahsik had hardly 1 or 2 orthopedic surgeons, and a lot of orthopedic work had to be shifted from Nahsik to Mumbai JJ Hospital. Almost every alternate day, a big ambulance used to carry 4 or 5 patients from Nahsik to JJ Hospital. And that just gave me an idea that probably this is a place where there is a need of orthopedic surgeon. After completing my internship, when I went back to Pune, I had liking for orthopedics right from my undergraduate days. And I had some of my idols like Dr. Sancheti from Pune. And I was lucky enough, and the God was really kind enough that I got my registration under Dr. Sancheti and joined his unit in Sassoon as a resident. I had the privilege of working as his house surgeon and his registrar for 2.5 years, and the remaining 6 months of my residency, I had another great general surgeon with whom I worked, Dr. S.V. Bhave, another visionary who not only in the field of his own surgical work, but he stressed upon us the importance of having some other facets in life. He was an excellent pilot himself, and during those days in 74, 75, he used to own his own small plane, which he used to fly himself. And as a surgeon, he studied a lot of Sanskrit and went through a lot of different books of mythology. And as many of us know, he was the one who traveled from Sri Lanka to Ayodhya in his own plane doing photography excellent aerial photographer. He was an advisor to the Indian Air Force for aerial photography during those days. And he was the one who again insisted what is the importance of updating. So after working with these two great stalwarts in Pune, the luck was still in very strong favor with me. And after completing my MS from Pune, I got an opportunity to come into a big world of orthopedics, and that was KEM Hospital, Mumbai. And I was lucky to get a registrar's post with Dr. Arvind Bavdekar, AVB as we all students call him. And those 5.5 months that I spent with Dr. Bavdekar and in Mumbai in KEM, I think they have literally changed my life. I was thinking that I have done a lot of work in Pune as a resident. But then after coming to the city of Mumbai and especially the KEM Orthopedic Center, I realized that what I was doing in Pune was only a tip of the iceberg. The amount of work, the amount of variety of surgeries that I was exposed to, the amount of teaching that I was exposed to when I worked there, not only by Dr. Bavdekar, but the stalwart teachers like Ellen Bhora, M.N. Shane, then C.G. Pradhan, and then we used to go and attend clinics even outside. So Dr. J.C. Tarapurwala, some of them, the real hardcore teachers, and then they really taught what is orthopedic and what it is going to be in future. I think those 6 months were really a very, very important part of my life where I completely changed into a totally different person. And I started understanding, what is the importance of updating yourself. Because of family circumstances, though Dr. Bavdekar was very keen that I should continue working in Mumbai for some more time, I was forced to start practice. And then I started looking out for places. And the place of Nahsik came in my mind. I thought that about 3.5 years back when I was in Nahsik as an intern, there was a need of an orthopedic surgeon. And during those internship days, I had really liked the climate of Nahsik, which I still feel is one of the best climate city in the country today. And that's how I came back to Nahsik, though I had nobody over here. And now I have become a Nahsikite. I have spent 47 years of my practice in this city. And what Nahsik I saw when I came here and what Nahsik is today, I think there is a sea change. There is a world of difference. When I came to Nahsik, from all the specialties, we had about 50 consultants, all put together. And today, I think we have more than 2,000 consultants as members of our Nahsik Indian Medical Association. We have more than 200 orthopedic surgeons in this city. When I came in 1977 to city of Nahsik, we were only 4 orthopedic surgeons. And today we are more than 200. I remember the medical situation in Nahsik. Out of whatever 20, 25 hospitals, small setups which are there, not a single hospital had a monitor. Not a single hospital had anesthesia, Boyle's machine, or now what we are working with is all workstations in anesthesia. Leave aside anything, even oxygen cylinders were not there in majority of the hospitals. So that was the scenario in which I started working. I joined one general surgeon who was already working in Nahsik, and he had a small setup. And because I had no financial capacity to start my own, so I started sharing the beds from that hospital. And that's how my journey in Nahsik started. Within 4 or 5 years of time, my work started increasing. And during all these days, I used to be always in contact with Mumbai, with Dr. Bawdekar sir and Dr. Shahane sir. And I used to get advice from these stalwart teachers for any difficult situations. Number of times when I wanted to do some complicated surgery and I had no instruments, Dr. Bawdekar sir was kind enough that he would say that you come to Mumbai, take instruments from my hospital, and after your work is done, you can return it back. I think one requires a lot of luck to get seniors and teachers like this, you know. In my personal practice, I have tried to follow the same footsteps for my juniors when they are coming in Nahsik and they are starting their careers. The journey in Nahsik started with a very small setup with a general surgeon. But within 5 years, I realized that the space was not adequate, the facilities were not adequate. And I always wanted to have best of instruments, best of equipment to start doing further surgeries. And in 1982, I started my own 20-bed hospital. And then I never looked back. Within another 4 or 5 years, those beds were again inadequate. So I purchased a new plot just adjacent, for which I was very lucky. It was an empty plot which I purchased, planned another building, and we joined these two buildings. And in these two buildings, I practiced for 42 years. But the mind was not happy with what I was doing. So I used to be always in touch with Sancheti sir, Bawdekar sir. And I remember when I started practice, two very important advices which Dr. Bawdekar gave to me. He said, Vijay, remember two things. Number one, update yourself. Medical field is so dynamic that what you learn today, after a few months, you will realize that that has become obsolete. So if you don't update, after some time, you will become a quack. And I think it was such an important advice which I have been giving to all my juniors and the students who have passed out from our institute, that even today, my thirst for learning something new has not gone. I feel that I have still to learn a lot. And that is what has kept me going all these 47 years. After attending number of conferences, attending workshops, attending various international, national meetings and specialty meetings, well, I have been practicing so much of different variety of work that when I look back, I realize that what was taught to me as latest when I passed MS in 1976 and 77 when I was working in Mumbai, I think almost more than 80% of it has become obsolete. So you can imagine the kind of changing scenario in the field of orthopedics, which I'm sure is in many other branches of medicine also. The unfortunate part of orthopedic practice is that you are dependent on lot of instruments, and Nashik was a comparatively very small place where, like cities of Pune or Mumbai, the surgeon couldn't get anything at 11th hour if he wanted to do anything. So my initial earnings, I had to invest in buying my own instruments, many of them very expensive sets like AO sets at that time, which were pretty expensive for my income at that time. And lot of implants we had to stock because it was not possible to get implants very easily in Nashik. They had to be sent from Mumbai or Pune. And that's how my craze of updating myself on the instruments started, and then I think it has continued even today. When the SIAMs came, I realized that this is something which is going to change the field of orthopedic practice, mainly the trauma. And then I was the first person in the North Maharashtra, that is Nahsik, Dhule, Jalgaon, Nandurbar, all these couple of districts, to buy a SIAM. And many of my seniors also called me fool. They said, whether you are having too much of money that you are spending on a SIAM, we are doing all the work on the portable machines. But then after looking at the utility of that machine in different meetings, I thought that this is future. And after buying that machine, I think the quality of practice, the number of surgeries that I could do in the same time increased so much, the precision increased so much, that now today all of us realize that without a CM, orthopedic surgeon cannot practice. In my new setup, which I started in the January, and I was lucky enough to have one of our very senior teachers and mentors, Dr. Nandulad, to come and inaugurate that setup. We have 3 modular theaters and 1 emergency theater. And all the 4 theaters have the latest CIMs. All the 4 theaters have the best of anesthesia workstations and the high-end technology which is incorporated into all these modular OTs by a company called as Draeger, which all of us as surgeons, we know that this is one of the German companies who is very quality conscious, and they have done a fantastic job in our new hospital. So the thirst for having the latest equipment has something to do in the quality of results that you get. The best of working surroundings, if you have, I think your efficiency increases, your precision increases, and your ultimately your results of your work, they also definitely along with that. During this particular journey of 47 years, as I said, coming from a teacher's house, my interest in teaching was not allowing me to keep quiet. And then I was lucky enough to get Dr. D.S. Aher, who was the health minister, and he belonged to Nahsik, as one of my seniors in Nahsik. And when he was a health minister, I approached him. I said that I want postgraduate recognition for my institute. And he was kind enough to help me out at the government level. And in 1998, we got recognized as a PG teaching institute for DORTH, which still continues. Though there are some problems going on with CPS, I think we still have 3 postgraduate students working and learning from our institute. After a few years, I was still not contented, you can say. And I thought we should have DNB recognition. And then I started applying for that, fulfilling all the requirements, all the paperwork, documentation. And in 2006, I got recognized for DNB. And that DNB recognition continued till the national board changed the rules. And they made it from 60 beds to 100-bed hospitals, wherein we lost the recognition. Because in an individual setup, you can't have 100-bed specialty hospital. It's too much for me. So I gave up and I said, no, it's not possible. But during those 6 years, I am very happy to share with you all that the sincerity with which we used to teach our students, and during those days, the DNB results were very bad. One of our students doing DNB, got a gold medal at all India level, and he stood first at all India level, competing with all the students from all over India. And that was a very proud moment for not only me, but all our teaching group of people like Dr. Bharat Kelkar, Dr. Kanojia, Dr. Umesh Kulkarni, and Dr. Avinash Pulate, who was also a part of our hospital for some time. So this interest in teaching has continued even today. And I feel that with every teaching activity that we conduct, we also learn something new. The kind of teachers that we get for the teaching programs, we learn something from each other every time. So I think that's one of the stimulus which really keeps you going in your life. The moment that particular zeal of learning goes away, I think you start becoming stale, and then you start losing interest in your work. One of my classmate, very close friend, Dr. Vilas Jog from Pune, he started a teaching program for postgraduate exam going students. And being very close friends, he requested me that, why don't you join me? And then for last 22, 23 years, we are conducting an annual PG training program for the exam going students, which is very popularly known as joints. It used to be initially in Pune, then after a few years, it was alternate year in Pune and Nahsik. And now for last almost 14, 15 years, because of ill health of Dr. Vilas Jog, I have shifted that program completely to Nahsik, and every year we conduct that particular activity. And more than 200 postgraduates exam going for DNB, MS, they attend this 3 days intensive training program. And we get teachers from all over the country who come to teach for 3 days. And as I get the feedback from the students, they said that this was one of the courses which has really helped us getting through the exams, because especially for DNB, they get a center which is quite far away, and they don't know the concepts and ideas about the orthopedic examination from the examiners of that area. So we still have that program going on every year, and it's again a very interesting activity which keeps us going every year, meeting the PG teachers from all over the country and exchanging our thoughts with each other. During this particular process of my orthopedic practice, my hobbies never allowed me to keep quiet, and my hobby of traveling, seeing the world, not only India, but then different parts of world, and doing photography. After first few years of practice, I made it a rule that every year I have to take 2 breaks and see India as well as different parts of the world. And today I'm very happy that I have covered more than 2/3 of the world's countries, and we have gone and seen a lot of things. I enjoy reading about those places before I go to the country, and after going there, you enjoy seeing those countries' specialty things, some of the natural wonders, some of the man-made wonders, and doing photography of all of them. I have a huge collection of photographs from different parts of world. Like a few years back, while after attending the American Academy meeting, we planned a trip to Hawaii, where we knew that there are some active volcanoes. And then it was a great occasion to see an active volcano, the boiling lava, going on the crater of that particular active volcano and taking photographs of that boiling lava from the helicopter, or seeing the lava falling in the sea and fumes of water coming from there. So these are some of the sites which I don't think it is very easy to see unless you have that itch or that liking to go and see the world. So these international journeys and photographies that I have been doing, they again recharge my batteries after having 15-20 days of break. When you come back, you start working with double energy, and then you feel that there is a lot more that you can do in your life. Now, from this January, we have shifted to a new hospital, as I was telling, and I'm getting more energy to work from this new setup. We have tried to make this new setup as a complete orthopedic and trauma setup, in the sense that not only we have all the orthopedic facilities available, but we have all the diagnostic facilities available. Like we have a CT scan, MRI, which is a artificial intelligence enabled MRI. We have sonography, color Doppler, everything under one roof in a single specialty hospital. So the orthopedic patient who comes into this place, he doesn't have to move out of the hospital for any specialty investigation. He can get his sonography done. He can get his CT scan, MRI, bone density, DEXA scan. Everything can be done under one roof. And that was a dream which I was carrying in my old setup, which was having a lot of constraints because of the space. But in this new setup, we have tried to incorporate everything. And this NM diagnostics, which Mumbai people are quite familiar with, they have been kind enough and they have joined hands with me in establishing this entire diagnostic setup. We have an excellent physiotherapy setup, a 24 hours lab with all the facilities. We have even a blood storage unit in collaboration with one of the leading blood banks of Nahsik. We have given them free space, and they have put up a blood storage unit wherein commonly required all blood group bottles are available for emergency within 5 minutes. Not only for our hospital, but even for the nearby hospitals where I am practicing right now. So I think this is a very fulfilling journey that I am enjoying, and I still have intentions of working for a couple of more years. And I look at some of my very active friends like Sanjay Agarwala, Vikas Agashe, and Ram Prabhu, who are my very close friends from Mumbai. And whenever I meet them, I feel, there are many more people who are enthusiastic of working like me, and that gives me energy to work more and more again. Some of my senior teachers and some of my mentors like Dr. Didi Tanna from Mumbai, Dr. G.S. Kulkarni, Dr. Babulkar from Nagpur, at the age of 85, 86, in their 90s also, these people are still very active and academically still very active, learning, teaching students and the juniors. I think I look at these people as my role models. I happen to go to Delhi for different teaching programs, and there I have met another giant of orthopedics and again a role model to follow, Professor S.M. Tuli, about whom the orthopedic surgeons know that he has written books on skeletal tuberculosis. The man at the age of 92 is so enthusiastic, learning, teaching, working, that after meeting these people, I think I always feel that there is much more to do, much more to work, much more to share with your juniors. And I think that's something which is really a fulfilling journey of my orthopedics in my Nahsik. If I do not mention about a great contribution of my family, I think this journey will be incomplete. In all these years, when I have been most of the times working for almost 16, 17 hours a day, my family has been a very strong support. My wife Nirupa, my daughter who is now settled in Pune, my son-in-law, my son Dr. Vikram, who is also an orthopedic surgeon, my daughter-in-law Utkarsha, who is also an orthopedic surgeon, and they have joined hands with me in the last 8 years. And because of the strong support that the children give, at the age of 73, 74 also, I had the energy to jump for another big project which we have started right now. So I think without this support of family, I don't think this journey would have been so fulfilling and so successful. I think a lot of credit to them, my brothers and my two sweet granddaughters, who have been also a great source of relaxation and inspiration to me. So I'm very happy that on this platform I got this opportunity to share my life journey, and I'll be able to answer any doubts if anyone wants to ask, or any information that anybody wants to know. Thank you Rajeshri for giving this my opportunity, and thanks everyone who is listening to me. Thank you.
The lots these awards and this pay is actually very it's a very emotional time for us, and at the same time, wisdom and excellence, we can see it every year goes to its epitome. Having said that, modesty, magnanimity, and perseverance, these are three things I evidently learned out of your talk today. And when I see that you brought Nahsik on a map of orthopedics, I can recollect that something similar my father did with Thane to bring the healthcare, bring Thane on the healthcare map, sort of. He backed most of the associations here, and also with Maharashtra. You know that he supported the physicians and the orthopedic associations in Maharashtra very, very, very much in the beginning. He made Goa the medical conferences destination. So I can really associate with the way you brought all this together, and Nahsik should actually really thank you for what it is today. And I've been contemplating to move to Nahsik, so at least you've influenced me to be to really take it up seriously.
No, I think you are welcome, and it's a very nice place to settle down, and very close to Mumbai also, so you can do all your activities very conveniently from here.
I don't think the other three KOLs here are going to agree with me. They'll scold me for this, but just like Dr. Lad says, a complete orthopedician. I know he had said that in his lecture when he was given this award, and I think you really exemplify that. Surgeries, upgrading, hospital equipment, teaching, social service, and not to forget the hobbies. So you say complete man, you're a complete orthopedician. That it was wonderful to listen into your journey, and I'm sure you have your friends here. I would like to let them say anything that they want to. Dr. Agarwala is here, Dr. Date, Dr. Taral Nagda is here. So I think we would like to present you the award in their presence. It's such a happy moment for us. If anyone would like to add anything, please feel free. We have the award displayed on the screen.
Vijay, you exemplified all the good things about orthopedic surgeons and your journey. And I think we all need to thank you for having made that effort, and for Nahsik for having given you that opportunity. So I think quite rightly, Rajshri has elected to give you the RSG Wisdom and Excellence Award. Truly well deserved, and I congratulate you.
Thank you, Sanjay. Thank you very much.
So with that, I think
Rajshri, I just want to say something.
Yes, sir.
There are many awards Dr. Kakatkar can win. Of course, he has the award for excellence in orthopedics,
as a human being, excellent. But really, when I was a very young orthopedic surgeon, what really, and when we used to see Dr. Kakatkar in conferences, he was the best dressed man. And now also, if you see every hair strand in place, you see him at 10 at night and he would be as fresh as he was early in the morning. So I want to ask Dr. Kakatkar, what is the secret of your energy? What really draws you to this?
Well, I think everything in moderation, except maybe the sleeping hours, which number of times I think are not to the mark. But I have been a good sportsman all throughout my school and college days, and very fond of doing exercises, which even at the age of 74 today, I regularly do. I do yoga, I do muscle strengthening exercises, and have a very moderate diet. And as I said, 2 breaks in a year, which recharges your batteries, So with these precautions, I think all of us can have that energy to work. Plus, one of the real sources of my energy is actually my passion for the work. I think every time I do something new, I learn something new, I diagnose a difficult condition, or a patient who has already been operated at 2-3 places, and then I am able to do something good for him, that gives me a different kick, and that gives me more energy to do the work, So that passion probably is itself something which recharges me when I'm working. But I think proper exercise, proper diet, I think these 2 things are also very important to keep yourself energetic and active.
So on that note, I really thank all of you to join in. This is of course a felicitation event, but also along with that, we are trying to deliberate on nutrition and nutraceuticals in this panel discussion. So rightly so, as you said, moderation in diet, harnessing the bone muscle joints is also a very important aspect, and a lot of it is already there published, but how much of it really percolates down in practice, and are there any gaps in the way the end consumers or other patients actually accept it, use it, and are these really useful in terms of improving the treatment outcomes when it comes to orthopedic disorders that are on the rise, is what really I want to elicit out of this panel discussion today out here. And I would, if you allow me, I'm just going to go straight off with the first question on this panel to Dr. Agarwala sir. As he's really at the top when it comes to orthopedics and professional services. He heads both of it at the PD Hinduja Hospital in Mumbai. And so you've treated many patients, different walks, 4 decades. And have you really seen osteoporosis progressing? And how have you seen the whole bone health scenario? How is it really changing, or is it getting better? And having said that, what do you think? Are nutraceuticals beneficial in this? Is a medicine plus nutrition approach the right approach? So we would like to.
Actually, there's a lot of questions. Questions. Firstly, are we seeing more of osteoporosis? I think we are more aware. I mean, clearly, if the number of people who we are seeing is increasing, we are more aware that there is a condition of osteoporosis. Things that maybe Vijay and I and Taral and Avinash would have said is just old age. There is a specific entity which is osteoporosis. Osteoporosis, as you now know, is also the same thing as osteomalacia. And WHO, in its wisdom, decided the two were the same. So when you recognize that there is the issue of osteomalacia, less calcium, it is not just calcium which is required by the body, but the bones require other minerals like magnesium, a little bit of zinc, even copper, to keep the bone health integrity. Clearly, you just can't have minerals. You also need the protein matrix. And the protein matrix can only be through the agency of recognizing that genetics plays a part, the male or female, those hormones, the age of the patient, and therefore the hormones that the patient secretes. And clearly, then what is in our hands is our access to proteins. And nutraceuticals, as the very term suggests, part of them being nutrition, are very helpful supplements for those who need more of it and can't get it from their diet. Situations like growing children, we have seen the controversy of the supplements being suggested to them, but I think it made a difference. I grew up on Bournvita, and my parents would put Bournvita in milk, and therefore I would have the milk. Now, I'm not plugging for Bournvita or for any of the others, but I think that inculcated in me the need to take proteins, that being a vegetarian, it's even more important that I take first-class proteins when available. And I recognize that there are controversies. I recognize that whether you need 1 gram of first-class protein or not, those things can always be sorted out, but you do need these supplements. And one great requirement is when a patient is recovering. And that is the time that I think it is very helpful for the patient to be given nutraceuticals, which would help the patient recover faster. So did I answer all your questions? You had so many questions in one. I hope
Yes,
I
yes, and you absolutely answered it bang on. And of course, having the newer guidelines come up, I mean, we will of course have that discussion when Dr. Sesikeran, who's here, will also be talking about it. But I'm sure he's going to agree a lot with what you're saying. And having said that, you did say that uh, how and why and how much, but when we talk about bioavailability and maximizing the effectiveness, does it really matter in what form? For example, if we are taking vitamin D, does it matter if it's injectable, is it oral, or the other vitamin minerals? Do you recommend anything specific to your patients? Because that is another thing patients out there are confused about.
So vitamin D is fat soluble. Yes, Vijay. Go on.
Well, I'd like to add 1 or 2 points. The basic Indian diet, which is most of the times vegetarian, I think is more carbohydrate rich. And that is why deficiency of proteins, I think, is one of the major issues in most of Indian people. And when we work as orthopedic surgeons, especially as Sanjay has rightly pointed out, when the patients are recovering from their diseases related to orthopedics, like they have fractures, they have joint replacements, I think sarcopenia is one of the hindering factors in their recovery. And that can be very well tackled only by giving them nutraceuticals and protein supplements, which definitely has a very positive role in their recovery patterns. So what kind of proteins you take is very individual, but I think that's a very important supportive measure for the recovery of the patients when they come to us. So I think Sanjay and Avinash and Taral, I think you will all agree on this point that our diet is definitely not having adequate proteins. Second point which I have observed over the years is that previously we were thinking that those who eat non-vegetarians, they don't have these deficiency problems. But over the years, what I have been observing is that even patients who are eating, those who are having non-vegetarian food 3 times, 4 times in a week also, we find deficiencies in them, because whether it is chicken or whether it is eggs or whatever non-veg source they're eating, many of these ingredients which previously were thought to be sufficient in them are not there. Because the chicken, a small chick of this size within a month with hormones, grows to 1 kilo. So what they consume, whether they really get what is really necessary or whether they get more of hormones from these non-vegetarian preparations, I think it's a very important question that we have to answer. And that is why even frequent non-vegetarian eaters, they have deficiency of vitamin B12, which was thought to be never there in non-vegetarians. So I think we have to revise our dietic patterns and accordingly, add the nutraceuticals as one of the essential things in the diet that can fulfill the requirements of every individual.
So you rightly pointed out that, in the earlier panel also I mentioned that, the source, the quality, where these, even if you're talking about supplements and nutraceuticals, where they are made, all this really matters along with the composition really. Because that's where, the organic, the hormonal components, all these come into the play. We spoke about other things in the earlier panel as well. However, having said that, I'm sure Dr. Date is going to agree with you completely, because this is something where we have had conversations at length. Dr. Date, if you would like to add anything, and after that, of course, Dr. Taral.
Absolutely. Actually, I must congratulate Dr. Kakatkar first for his great journey throughout his life, and he is still continuing, still enthusiastic. And basically about these things, we keep seeing these patients pre-operatively, post-operatively. Pre-operatively, one of the important factors is their albumin level, because that determines how much they are going to recover, how well they are going to recover. So if it is more than 4, then the recovery is likely to be much better. So proteins, as both of them said, I think is one of the most important factors in determining post-op recovery and over the period, the recovery as a whole. So that is one of the major factors. Vitamin D and calcium, we keep seeing the patients of osteoporosis every now and then. And a few of the misconceptions about osteoporosis I would like to enlighten are: one is calcium. The treatment for osteoporosis is calcium. Obviously, it does nothing to osteoporosis. Osteoporosis is basically reduced bone density, and reduced bone density is basically because of imbalance between osteoblasts, which are the bone forming cells, and osteoclasts, which are the resorbing cells. So basically it is because of that. So unless and until you treat that in a different way, the osteoporosis is not going to improve. So calcium is going to get deposited in the osteoporotic bone as well as in the normal bone. So it will just make it slightly stronger than what it is, but it's not going to reverse osteoporosis. So that is one thing. So vitamin D, calcium, all these things have been well illustrated by Dr. Agarwala and Dr. Kakatkar already. I don't need to talk about it. So I'm here rather more to learn rather than teach. So I would like to learn more about these things.
So one more question on those lines.
Yes.
We're talking about healing, and when it comes to falls and hip fractures, and sure, I mean, I think all of you can opine on this. Does it make sense that when patients are going into surgery, or they get pre-prepared with a good nutrition plan, and a plan which goes even after after they are operated? Does that really help in improving your outcomes?
So, Rajshri, when you have people wanting to build up their muscle mass and they go to their gym, they're told to take protein supplements. Now, that is a very specific requirement. You take protein supplements to build up your muscle. Here, clearly, when you want to get muscles to heal, tissues to heal, the healing is through collagen, whether it is bone or whether it's soft tissue. Again, collagen is protein. So it clearly means that when you want better healing, it makes good sense to take more proteins. Now, if you were to sit down with a chunk of meat and eat it to get your protein, is it easier to get pre-prepared protein? And the pre-prepared protein is these nutraceuticals. It's easier to drink one glass than to sit down and chew when you are in pain and you are worried and you don't have an appetite. You cannot be eating protein the way that a normal individual will, which is what all these new guidelines, etc., suggest. Here we are looking at a very specific subset, patients' recovery. When they can't eat, they're semi-moribund, they're in pain. So one of the easier ways for them to get healing substances is through nutraceuticals and supplements.
It's great that you brought up the role of collagen here because most times collagen is just used or understood for cartilage regeneration, but collagen does have a much larger role. Collagen supplementation and the amino acids coming from it are so much beneficial for the bone and tissue and muscular health as well. So thanks for bringing that up, sir. Dr. Taral, you wanted to add, and I know.
Yeah.
You have a lot of inputs on this as well. Please,
I'm going to talk about this not only as an orthopedic surgeon, but also as a patient. So one needs to be prepared in life. So when there is a planned surgery, so Dr. Agarwala is doing a planned knee replacement, or Dr. Kakatkar is doing a planned deformity correction surgery. You have time in place, and there is a whole new science of prehab or preparatory phase. We prepare the patient by giving good nutrition, good exercises, and good mental buildup. Okay. There is also need to plan for aging. As we age, as Dr. Kakatkar mentioned, not only good diet and good supplements are important, it's also important to tone up your muscles by doing exercises. And more important, it's also important to prepare your mind, the cognitive issue. The problem is we are not prepared for something which comes all of a sudden as a surprise, like an accident or an illness. And it's important that everybody in this world, whether it's a child, a young adult, an adult, or an old person, need to be prepared for an eventuality like this. And hence, it's very important to prepare our body through supplements, through good diet, through exercise, through good sleep, and also making up our mind in a way that whatever difficulties a surgery or an accident or an illness comes, we are prepared for that. And it's a whole combination. It's not just one thing. Thank you.
I think Taral is a living example of the mindset in a patient. The way you have, Taral, recovered from your injury. I think it's an absolute living example for everyone, and that if you are positive in your mindset, it can make tremendous difference in the recovery of any problem.
So I don't know if I should say apologies, but in the excitement of felicitating you, sir, I didn't actually give some initial introduction of each of you. So I really want to start. And when you talked about Dr. Taralnada's journey, I mean, he's of course in MS orthopedics, and also he's done his clinical fellowship in pediatric orthopedics from the US. He currently is, as a living example, also director of the Jupiter Gate Analysis Lab and the consultant at Jupiter and SRCC Hospital. So, having been, of course, the associate professor and lecturer at the GS Medical College, So that really explains how seriously he takes this aspect of mental grit that he has, and he's actually even now helping many patients to take help from him. So that's how. And let me also in that order take the proud privilege to also introduce Dr. Sanjay Agarwala. He of course has uh, he did receive the award, the RSG Wisdom and Excellence Award last year, and it was absolutely a great um, program for us and so much of learning. So having said that, sir is like I mentioned, the Director of Professional Services, Section Head, Orthopedics and Traumatology at the PD Hinduja Hospital. 4 decades that he is there, gold medalist in MBBS and MS, with MCPS in orthopedics, MCH from England, and I mean I can keep talking about him like last year, even this time as well. So I mean, viewers should really understand that we really have these great experts here giving us this advice, and so much of deep insights that they are giving us out of this so much of experience that they have. Also, of course, Dr. Avinash Date. I mean, he's of course also heading the orthopedic scene at the one of the largest hospitals in Mumbai and in India, the Kokilaben Dhirubhai Ambani Hospital. He's also, I would call him a complete orthopedician, because he does, he does do knee replacements, but his active interests are also trauma, fractures, and so much of learning I've had from Dr. Date as well, when we have done so many of these CME programs in the past. And every time we talk, there is so much that we both learn out of each other's experiences. So thanks for joining. But of course, there are a few more questions that I am going to ask, and going back to Dr. Taral, if you're around. I think while we're talking about supplements and nutrition, the pediatric patients, they are the ones where compliance is such a big issue. And I would say compliance with the children is an issue, and then there are other issues with the parents, because the parents are more hypersensitive. So how do you manage through all this, giving them the right guidance? Again, you've been talking about vitamin D confusion. Why is it needed? How much is it needed? All these questions come up, and when they're told nutrition, the kids are finicky. They will not want to eat what they want to have. So your comments on this
So I think,
aspect.
yeah, but the issue is many times parents who are overactive and kids who are underactive. A lot of deformities which we see in children and which are labeled as potential rickets or vitamin D, actually they are not related to nutrition. Like it's common to have a child who is a year old or 1.5 year old with bow legs. It's a physiological varum or bow legs. Similarly, at age of 3 years, a normal child can also have knock knee, where knees are joined together and ankles go apart. So a physiological knock knee can be present in a 3-year-old child. By around 5 to 6 years, all children normally get a good alignment, like an adult alignment. We see very commonly that children who have bow legs and knock knees, which are physiological, they are treated with calcium, vitamin D. And Dr. Kakatkar, Dr. Agarwala, and Dr. Date all would agree that they will go to one doctor many times, have been prescribed one brand of vitamin D. They go to another doctor and there is another brand, and they keep on giving all the different brands, thinking that their child will grow well and top the world if these nutritions are given to them. So first of all, it is important to know when not to give unnecessary supplement. Secondly, at the same time, we realize that in adolescence, they will have knee pains and inability to perform well in sports, or they will have deformity. And these are ignored many times because people feel that these are just part of growing up, and these are the children where we see vitamin D deficiency, protein deficiency, genu valgum or genu varum which comes up, and this if missed can lead to permanent deformity. So it's very important that there is a balanced view where we find out which are the children who are actually suffering from a deficiency. Only those are provided supplements, rather than giving supplements to every child left, right, and center. Thank you.
Sure. So that's really thanks for sharing that. I'm sure people are going to learn, and moms like us are going to learn from that. Having said that, of course, Dr. Date did mention about excess of calcium, consumption, and the calcium also goes apart from the bone, also goes to the arteries. So, a long-term overdosing of calcium is not really good from the calcification standpoint as well. Having said that, all three of you are heading the departments, plus Dr. Kakatkar, you are really running an entire setup. How do you look at comorbidities or other metabolic diseases that are existent with the orthopedic patients that come to you, and then does there also nutrition sort of have relevance? Any of you could take this up.
Well, I think the comorbidities that we see over the years, we have seen that these comorbidities have started coming up quite early in the age. Previously, a number of problems which were thought to be in their 40s and 50s, many of them we see even in the age of 30. We see so many hypertensives, we see young diabetics, and people having ischemic heart. So I think many of these problems are having a genetic background. They have a great impact because of the stressful life that many of us are living, and the changed lifestyle is definitely taking toll on the comorbidities that we see in orthopedic patients. Not only in orthopedic patients, but I think in many other medical branches also. I think these comorbidities are definitely seen at a much earlier age than what we used to see. And unless we are able to control them, the overall recovery from the orthopedic or any other disease is definitely going to be delayed. I'm sure all of us must be seeing this kind of changing scenario in our day-to-day practice. Yes, Sanjay and Avinash, I think you will be able to also add on to this.
So that's
Charan,
exactly.
I don't know what is the
No, but Vijay,
situation.
this is exactly what everyone keeps talking about when they're talking about obesity, they're talking about everything nowadays, holistic medicine. So it's clearly, it is not just the one issue that we are looking at as orthopedic surgeons. I mean, we're looking at the need for hip replacement in a person who's morbidly obese. Will he recover at the same rate as someone who is not morbidly obese? So, like you said, it's not just one thing. There's blood pressure, kidney conditions, etc. And vitamin D is clearly, vitamin D clearly needs both the kidney and it needs the liver. Not only that, it needs to get absorbed from your body when you take it. And if you have absorption issues, then maybe you need a parenteral, to answer Rajshree's question that she'd raised earlier. So I think you need to look at everything holistically nowadays, and only that can give a good net outcome. And we talk about both acha surgery kiya, but if the patient is in pain, he's miserable. Your anesthetist have to be acting to get the pain down. If you do a both acha surgery kiya and you have rubbish physiotherapy, the patient is not going to recover the same rate that you would like it to be done. So like you just said, Vijay, in one hospital, you've set up comprehensively everything, not only the diagnostics, but even the post-surgical care. And Taral can talk about how post-surgical care is so important. Clearly, for any one disease, be it a small disease, you need a holistic look at it, and the recovery likewise has to be holistically managed comprehensively so that the patient can have good net outcome. And one of the things is the nutrition.
Yes.
I think what you just said, sir, right now, that's really the ethos of having this whole event today, the integration and the holistic approach. And it's increasingly becoming important. Um, uh, unless Dr. Nanda and Dr. Date want to add, I have one last question for you. Yeah, go ahead.
So one, previously undernutrition was a problem. Malnutrition, protein energy malnutrition, hypovitaminosis, D, rickets. These were the issues. Currently, the overnutrition is a much more major problem, as Dr. Agarwala mentioned. Obesity is a big issue nowadays. Obesity has come to India. It's here to stay. Thanks to the junk food and availability of ready-to-order food which we are having nowadays. Just dial and you will get the worst of the food possible. It's difficult to get a good nutrition. It's easy to get a bad nutrition nowadays. It's on your fingertips. There are a lot of problems which are associated with obesity. Because vitamin D gets stored in the fat cells, first of all, it causes an indirect vitamin D deficiency and weakens the bone. It increases the load on the body. The muscles cannot handle that load, and that's why you have more falls. Children who are obese, if you see the physics, the distance of the body of these children when they are sitting in a vehicle to a dashboard reduces, and hence they have injuries with greater impact, more velocity, and that's why they get more serious injuries. And of course, because they are obese, it's very difficult to take care of them during the surgery, anesthesia, and post-surgical recovery. So, we want to mention that, as it is important to take care of undernutrition, it's very important to take care of obesity or overnutrition, because that's an, pandemic at present in India. Whether you take smaller towns, rural areas, or cities, we see that. And to have healthy bones, it is important to have a healthy weight or a healthy body also. Thank you.
So, since you said malnutrition has now, changed to overnutrition, I call it malnutrition and maldigestion also, because when we talk about osteoporosis, this is what I do it with my patients. There are a lot of patients with IBS. It's a digestive disorder. So, where mindfulness is a bigger problem. These kind of patients actually eventually develop osteoporosis, osteopenia, so those are the ones we have to even work on what they eat and what they actually assimilate. So that's another critical thing where we will use a lot of enzymes to, counter both the digestion as well as the mindfulness in these kind of patients. So having said that, since all of you, Dr. Date, Dr. Agarwala, and Dr. Kakatkar, you all are into knee, which is such a big thing these days, and knee replacements. And on top, we have so many different supplements over the counter, and so many of those you can see even on e-commerce. This supplement for the prevention, or rather, cure of the knee damage that occurs. Do these really work in your experience? Have you seen any positive effects? What are your suggestions and right recommendations which the audience can actually take home?
Well, I think there are a lot of collagen products which have come up for osteoarthritis, mainly of the knees. And I personally feel that they have a limited role, but they have a role. And in early stages of osteoarthritis, if you give them these collagen supplements along with proper exercises, proper change lifestyle measures, I think they do have some positive impact on the recovery of the patients. I don't know what's the view of yes.
My view on it is, in fact, more than trying to actually replace the cartilage or protect the cartilage. If we can actually these supplements, if we use the right supplements which can bring down the inflammation overall, because we all know there is chronic inflammation. If that can be taken care of, it can help at multiple levels, right? Be it arthritis, autoinflammatory diseases, or even the metabolic diseases that finally affect also the musculoskeletal health. So overall, but having said that, with the right advice is what, with the right doctor or nutrition advice is what people should consume this with, is my take on it. With that, I think we come to the end of this this session, and Dr. Agarwala, I would definitely want you to leave us with, or maybe each of you could leave us with one-line takeaways and before we close this session. And of course, I take a promise from you that this is a small attempt, but we really want to grow it bigger in building an ecosystem of more healthier and happier people around. So that's the attempt.
So all patients need to be treated holistically. I mean, all of us are great surgeons here. That's just part of the treatment protocol. And one of the big things in the management of a patient is the nutrition. That's it.
Great.
Yeah, I think Sanjay has said in one sentence, he has covered everything. I think that holistic approach, it is really important to consider everything. Yeah, not nutraceutical is one part of it, but then I think changing their lifestyle, advising them proper exercises, reduction of weight, everything I think is important for the recovery of the patient.
So with that, I think with such an important point, we have an important personality coming up next, whom we are going to felicitate. I think it's the right time to have him here with us today, and also, of course, he absolutely has a great journey, which we all should actually listen in and learn from. He's influenced me a lot, just as my father. I think he's been one of them. Due to which I'm really active in this field, and I keep doing deeper and deeper work. So all thanks to Dr. Sesikeran, whom we have here, and the second award, which is the RSG Wisdom and Excellence Award, goes to him. And let me share my screen. I call him dynamic because he comes out to be the most modest person around, but he's really dynamic because he brought food and nutrition really on the forefront in his decade of being the director at the NIN, which is under the ICMR. And he spearheaded so many different aspects, guidelines, revisions that we can see. And let me take the privilege to introduce him. He's also a doctor. He's an MBBS from the Stanley Medical College, Chennai, and MD in pathology from the Gandhi Medical College, Hyderabad. Dr. Sesikeran has served as the director of the National Institute of Nutrition under the Indian Council of Medical Research, ICMR, Hyderabad, and has worked with the same for more than 30 years. As the director, he has spearheaded the revision of the recommended dietary allowances for Indians, updated the dietary guidelines. Additionally, he has initiated the food consumption database project. He has also had positions such as the chairman of Food Labeling Committee of the Food Safety and Standards Authority of India, and the chairman of the Review Committee of Genetic Manipulation in the Department of Biotechnology, chairman working group on foods for sports persons, FSSAI, He's developed several important guidelines, including those of GM safety testing, food labeling, probiotics in foods, and similar biologics. He's a prolific researcher, has published over 100 research papers and contributed chapters to 5 books. He served as the president of the Nutrition Society of India until recently. He continued to contribute to the academic community as a visiting professor at the School of Medical Sciences, University of Hyderabad. He's fellow of the National Academy of Medical Sciences, the National Medical Scientists Academy, and the Andhra Pradesh Academy of Sciences. He's also been the chairman, Scientific Advisory Committee of PFNPAI. He's been member scientific panel on nutraceuticals, food supplements, FSD, FSMP, novel foods, FSACI, of course. Until recently, he has been the president of the Nutrition Society of India, as I mentioned, and vice president of the Microbiota and Probiotic Science Foundation of India, vice president of the Probiotic Association of India, member of research advisory committees of CSIR, IITR Lucknow, and chairman program advisory committee and member RC, National Agri Biotechnology Institute, DBT, Government of India. He's been member of the project review committee in the Department of Health Research, Ministry of Health. Member National Committee on Nutrition of the CII, Delhi. I can honestly go on with his introduction, but let me also share the different awards that he has received. So the list there also is really endless. So let's really request him. So it's absolutely a proud privilege. I know about 6 years ago we were at one of the conferences, and I know when we were called up on the stage, and you were the chair, and fortunately I was the chair for the same conference. The next day I'm fitting in. I was no way fitting your shoes, but when we were called on the panel, you were on the right side and Dr. Sanvi was on the left. That moment in my life was completely transforming. The fact that I was sitting in between both of you added more responsibility onto my shoulders. So such is your personality, sir. Whoever meets you, hears you, they're all influenced and influenced to an extent to do great work. Really, this platform is now, all over to you, and we would like to really learn a lot from your journey. I mean, I know modest backgrounds to still being modest, having held so many different positions and having done so much work. Dr. Sesikeran, over to you, sir.
Thank you very much, Rajshri, for a very kind and more than necessary elaborate introduction. Actually, I don't deserve quite a bit of that. And I've never had an opportunity to meet your dad, Dr. Gadgil, but I've had many opportunity to meet you, and then looking at you, I can imagine how your dad must have been. So it is indeed a great honor, and thank you for inviting me and giving me this honor to not only speak, but also receive the honor from your esteemed organization. I would like to actually tell you my great appreciation of the previous panelists. I enjoyed every moment of what they were talking, and I was extremely happy that the medical fraternity in India has now considers nutrition as an important component of their patient care. And this wasn't so during some 20, 30 years ago, when nutrition was only an incidental thing, and then more often the surgeons and others, physicians thought that it is a treatment, and the pharmaceuticals as well as the other ancillaries which are responsible for patients getting better, and nutrition was only an incidental one. I think from there we have come a long way, and that itself is a great satisfaction for some of us. Now, you told me to speak a little bit about my life journey, and it was, I actually nativity, I belong to Andhra Pradesh and Telugu speaking. But I was born and brought up in Chennai, which is in Tamil Nadu. And there I did my medical graduation, MBBS, in a very famous medical college called the Stanley Medical College. And while I was in the final MBBS, I remember one of the subjects which we rarely spent much time on was on community medicine. Okay? And we were more interested in medicine, surgery, and obgyn, and then trying to finish our course, where community medicine was sort of an impediment for us. One day, while I was walking by the side of the corridors of the community medicine and wondering whether I should attend that particular lecture or not, a lot of my classmates were rushing into the lecture hall and asking, "Hey, what's going on? Is it for the lecture?" They said, "No, there is a extempore elocution competition for a nutrition medal from the Stanley Medical College, and those who are interested in final MBBS to go and participate can do so." I said, "What am I supposed to do?" You just go inside, and then 5 minutes before the thing starts, they'll give you a topic. Until then, you don't know what the topic is. Now you see the topic and then give a bhashan for 10-15 minutes. I said, "Okay, let me at least go and watch what's going on." So I went in and watched. I'm just telling how fate takes you to different directions out of serendipity. So went in, and that the topic given was balanced diet. Okay, and I don't remember having done, apart from reading, there used to be a textbook called Park. We all used to read Park, and then for community medicine. And so I gave a small talk on balanced diet. And then I got the medal. Okay, and then I had won only a couple of medals during my MBBS. And okay, so that medal was there. But one day, then after that, I joined MD in pathology in the Madras Medical College. And while I finished 1 year of my MD, there was an ad in the newspaper for a position for a scientist pathologist at the ICMR National Institute of Nutrition, which was a central government job. It was in pathology, and I was already into pathology. So I applied for it. So when I applied for it, one of the factors which helped me get selected for that position was the fact that I had a nutrition medal. You know, something which I did casually ultimately threw me into nutrition. Until that time, I had no concept. And the least had I any concept about research. It took me a couple of years or much more than that to learn what research was and the basic principles of research. And fortunately, by good fortune, I had a very good teacher, my superior one, Dr. Krishnamurthy, who was a brilliant pathologist, a meticulous man, absolutely honest in doing research and generating data. In fact, he used to do research for 3-4 years, but never publish it because he thought the data was not good enough. So that is the level of sincerity that man had, and sort of rubbed off into me. And then I did my MD in pathology all over again from the Gandhi Medical College in Hyderabad because it was a different state. And then on the journey of research started, and the research included mostly animal tissues. I basically trained medical pathologists. I used to yearn to do diagnostic pathology, which I also did. And as a service to the government hospital. You know, those days in Hyderabad and also in many other cities, the corporate hospitals had not taken much into it. And then the pathology services in many of the government hospitals were pretty poor. So our institute had the best of equipment, and very few people who are capable of making 5-micron thick paraffin sections to make a good stain section. And our institute had the facility, and we extended the facility to all the government institutions free of cost. So I was doing diagnostic pathology and also doing research pathology, which was almost entirely on animal tissues. And I joined at the lowest rung of the ladder, which is an assistant research officer. And then over the next 35 years, I finally landed up as the director of the institute, which again is a matter of chance. Okay, I can't say credit that I was the best guy for the position, But it just happens at the time of selection, you're among the group of people and selection committee thought you're good enough. And next 6 years was very, very challenging for me for the simple reason that I was not able to do much research. Once you sit in the chair of a director, you start doing administrative things, which 99% is actually a waste of time. And your research gets affected, but unfortunately somebody has to do that. But then I was able to guide my younger colleagues and help them so that they rise up as good scientists, they rise up in their publications. And I also made it a point that once I became the director, I never had my name as an author in any paper published in NIN by principle, saying that unless I have done my job in the study, my mere presence as a director does not, make me get the right to be an author in a paper of my colleagues. And I hope many other who are future heads of institution would also follow that principle, that merely being the head of institute, you're facilitating others, and that does not give you the right to be an author of a paper. So that's how it went on. And now post-retire, and as Rajshri, you mentioned, I was in various other committees, and even in genetic modification was considered as not a very popular thing in this country, even to this day, except BT cotton. Nothing else has been approved. Unfortunately, it's a wonderful technique. We now have newer techniques also, which is called gene editing. And we hope that the country will adopt the gene editing, as was mentioning that we could now, the future of nutrition could be by biofortified crops. So you could have a banana, which is rich in vitamin A. You could have if you have an apple, which has got more of vitamin D or things like that. It's possible by gene editing, not by genetic modification. You just tweak the genes and then people have the technology. In future, that will actually replace the synthetic or extracted forms of nutraceuticals. You will have people actually be able to eat a food to get a nutrient, and the day is not very far off. And the government has several institutions working on that. And we hope that in future, that will be the new direction for all of us. So this overall is my experience, and I'm still learning. Like today, I learned a lot from the orthopedic team, and really I enjoyed the way they were responding and their way of responding to nutrition. And I also wish to emphasize that the guidelines are actually not to be confused, in the sense that guidelines are meant for healthy people, and which already Dr. Sanjay also mentioned. And that if a patient is undergoing a surgery or is in the orthopedic table or post-operative period, he's apparently not a healthy person at that moment. He could have been a healthy person earlier, so he needs something more, something different, till he comes back on track. It's like that the person went off the track, he has to be then brought back on track with specialized nutrition, and that is the role where nutraceuticals can play. Now, I have a presentation of two parts. One is briefly on nutraceuticals, mostly relating to regulation and definition, so that we actually know what each one means. And also, someone was asking earlier whether the collagen supplements do actually work. And I like the answer of Dr. Vijay said that it has a limited role. He was very diplomatic in what he said. So a limited role is primarily because we don't fully understand that what is present in the nutraceutical actually is getting into the body and actually going into the collagen in the body. So there are a lot of steps in between. And also the quantity which is present in that particular nutraceutical capsule, is that the effective dose? These are several issues which many of the consumers don't fully understand. And we as physicians, sometimes we assume that what the pharmaceutical detailing we got is correct. So I'll just make a brief presentation relevant to that. Okay. Can I share the screen, Rajshri?
Yes, sir, absolutely. Yeah, they're visible.
The slides are visible? Okay.
Yes.
Now, we'll first look at the definitions. Yeah. Now, there are several definitions that the Food Safety and Standards Authority actually came down with nutraceutical regulation somewhere in the year 2012. So what is a health supplement? A health supplement is a category of foods which consists of a concentrated source of nutrients, which could be proteins, minerals, vitamins, amino acid, or any other ingredients with nutritional or physiological effects, either singly or in combination, and whose purpose is to supplement the normal diet. An example which was earlier, Dr. Sanjay mentioned about a particular beverage which you took in his childhood, and many other beverages in this market are therefore come under this category of health supplement. Now, what are the ingredients in these nutraceuticals or health supplements? They could be vitamins, minerals, or they could be botanicals, extracts, probiotics, prebiotics, or isolated molecules, and so on. Any of these, there are a list of approved ingredients in the FSSAI Act. Now, coming to nutraceutical, I will then illustrate with a few examples. A nutraceutical is a category of food which consists of all these and has a physiological benefit and helps to maintain health. Then nutrient, of course, we all know what it means, the vitamins, minerals, amino acids, and so on. Sorry. Then in many of these supplements, there are only some molecules which are actually biologically active. So these we call them as the basic bioactive molecules. It can come from plant, animal, fungi, bacteria, anything. And they have a range of activities like anti-proliferative, they are antioxidants, they could be anti-infective. And as you mentioned, inflammatory load, you want to come down, you need something which has got anti-inflammatory effect. And those which give this benefit are called as bioactive molecules. Now, we'll give a simple definition for all of these. Now, let us assume that I'm having a carrot today. I eat a carrot because I like carrot and enjoy carrot. And then what is it? It is food. But I give carrot pieces to my grandchild because I think he's got vitamin A deficiency. So carrots are good for the child. So make a puree of carrot, and then the same carrot becomes a functional food because it is ultimately supposed to be good for the eyes. Now, if I extract the active form in the carrot, which is beta carotene, which is a precursor of vitamin A, then that becomes a bioactive molecules. Now, if I have a supplement which has got beta carotene, then it is a nutraceutical or food supplement. So you see the range of definitions actually keeps changing depending upon the format in which we consume that particular food. Now, here are some more examples. Now, let us take lutein. On the left, you have lutein. Lutein you get from green vegetables, and ophthalmologists prescribe them for reducing the risk of macular degeneration, particularly age-associated macular degeneration. You have quite expensive supplements available in the market. Lycopene, you can get lycopene from tomato. You can even get lycopene from tomato ketchup. And there are clinical studies to show that high levels of lycopene may actually reduce the risk of prostate cancer. Then we have fiber from wheat bran. We have beta-glucan from oats and psyllium. And they are known to have several kind of health benefits. And then you have catechins in tea, which neutralizes free radicals. Omega-3 from fish and fish oils, which reduces the risk of cardiovascular disease and also in brain function. You have stanol esters, which inhibit cholesterol absorption. Then you have the bacteria like lactobacillus, which improve gut health. Isoflavones in soya like daidzein and genistein, which are known to be good for women, which reduces the risk of breast cancer as well as menopausal symptoms. And proanthocyanidins in cranberries, chocolate, cocoa, which are improve urinary tract health, and so on. You see the whole lot of all things are originating from foods, and therefore these benefits are naturally coming to us through balanced diet. But as was mentioned earlier, In the event the patient is not able to consume balanced diet due to a variety of reasons, that is when the same component should then come from a nutraceutical. Now, India fortunately uses a lot of spices. In fact, the whole history of our country got sort of, I would say, screwed up because we had a lot of spices. Everybody came to this country, invaded it, sort of destroyed it, primarily because we had a lot of spices. And of course, other wealth came later on. Now, every bit of the spices has a biologically active molecule. Black pepper has piperin, cinnamon has cinnamaldehyde, ginger has gingerol. But what we should remember is all gingers won't have the same amount of gingerol, or all red peppers won't have the same amount of capsaicin. Again, depends upon the variety, where it is grown, therefore it would vary. All of them have the function of being either antioxidants or anti-inflammatory, lipid-lowering, anti-cholesterol, and these are all the advantage of use of spices. And since we regularly use spice in our food, we are getting these biological active molecules on a day-to-day basis. Now, when a regulatory body actually approves a nutraceutical, what do they look for? The most important thing is they want to see whether there's a history of safe use. For example, if I were to recommend fenugreek for lowering cholesterol, then there will be people in another country, they will ask, how often have your country used this? The minimum should be 30 years if it is if the nutraceutical is coming from another country. We have quite a lot of Korean stuff like ginseng, etc. At least 30 years they should use in this country. If they use for hundreds of years, that means it is safe. If it's going to be in India, then it should be at least 15 years of use in the Indian population. That is when it's considered as safe. And we should also know what is a safe level of consumption. The level in which we consume through our natural food will be much less than the levels in which when we are eating in concentrated forms. And the next thing, I'll again come back to what Dr. Vijay mentioned about the collagen is a collagen supplement, the collagen component, all the hyaluronic acid, etc. All this information should be available exactly like what when we use a drug. So its bioavailability, its absorption, half-life, which tissue does it accumulate, how is it distributed, how is it metabolized, how is the entire pharmacokinetics of a nutraceutical should be available. Then you also need to know what is the end activity. Is it an antioxidant, an anti-inflammatory? We very often see people claiming some indigenous product as though it can cure cancer, it can cure diabetes, it can cure hypertension. You know, it cures anything under the sun. Such things are to be viewed with suspicion because most biological molecules have very specific targeted function. And above all, we should also know about toxicity. The US FDA, when it approves a supplement, they are most interested in the safety rather than its efficacy. It is the responsibility of the manufacturer about the efficacy, whereas safety is therefore mandatory. So they always make sure that the adverse effect levels, acceptable daily intakes are all properly worked out. And we also need to look at through bioinformatics whether some of these could be allergens. Very often as physicians, we find strange symptoms or strange signs in some of the patients which we are not able to explain. And then you go back into the history, they have taken some weird herbs, etc. So we need to know whether these nutraceuticals, if they are especially proteins, whether they're allergenic. So we can do it looking at the molecular structure in the allergen database. And similarly, also we can know using the toxicity database whether there's any history of a harmful effect. And then if you really want to know whether the nutraceutical consumed by a person actually is there in the blood, you need to have methodology to measure its levels. And whether it is biologically active, then you need to have effect markers, like for example, a stanol consumption, lower serum cholesterol, then we should have data to show whether cholesterol came down. And finally, effect marker is long-term studies to show whether it really brings down the risk of coronary heart disease and so on. Now, the active compounds which are there in the nutraceutical product should be present at a level where it can actually known to give the beneficial effect. Several traditional products, if you look at traditional literature, they would have shown an effect in milligram levels. and the product which is selling that same stuff may have in microgram level. So you know that the level in which it is present, for which the consumer is paying through his nose, actually is not going to benefit him. So we need to know that what is the level at which there is a scientific evidence of effect, and what is the level at which it is present in the product. Then we also need to know the safety and efficacy in terms of the clinical studies done. Usually randomized clinical trials are the best ones. There are some comparative studies. There may be high dose, low dose studies. So several such human evidence is therefore required if a claim is being made. So if the product manufacturer is not making a claim, he can only refer to literature. If he's making a label claim, that is when he has to have a clear-cut clinical study. So in conclusion, I may say that if, for example, if tomorrow somebody wants to market a product, they must first of all have the basic knowledge or information based on which the product was developed. They should have data on the safety and quality and the efficacy through some studies, and the claim and studies done on humans to establish a particular claim. So I've often done this kind of what is called as establishing a particular natural food or extract as a nutraceutical in the US FDA. They give a particular categorization called generally recognized as safe. So when they give that, the dossier should contain all this information. I won't go through it, but you can see the extent to which this kind of data is actually documented before that generally regarded as safe category or GRAS category is provided. So every bit of it, especially toxicity studies, are very, very important, including carcinogenicity, mutagenicity. Otherwise, we may have several nutraceuticals which actually they may not do good, but at least they shouldn't do harm, because since when we prescribe to patients with good intention, we make sure that it doesn't cause any harm. So that's about the nutraceutical part. Now let me go on to the dietary guidelines. The dietary guidelines was released just a couple of months back. So what is the intention of dietary guidelines? Why do you actually develop the dietary guidelines? You realize that every time a dietary guideline has been released, it is preceded a couple of years earlier by another document called Recommended Dietary Allowances. Recommended Dietary Allowance is a technical document. It is primarily meant for professionals and also for regulatory purposes and also for international trade. It actually tells what is the maximum you can take, what's the minimum you need to take in terms of the nutrient quantity. But the common man will not understand that, and therefore this is usually followed by another publication which is called as the dietary guidelines. A dietary guidelines is meant for every healthy, apparently normal individual who can consume food is the target person for these guidelines, and not a person who's a patient. And it's also meant for all levels of the socioeconomic strata. That's one of the reasons why we cannot recommend an expensive supplement as a best way of food. If you see some of the history behind the criticism behind infant formulas, there was a time when a poor mother used to see an advertisement for an infant formula and showing nice roly-poly babies and compare with her own child and assume for herself that the complementary food she is preparing and giving in her home is not going to give the benefit to her child. Her child is not going to grow. So what she does is, out of her limited resources, she gets these the complementary formulas and feeds the child not the full proportion, because she can't afford more than 1 tin a month. She feeds little bit here and there and doesn't feed the regular complementary feed, and actually it made undernutrition worse. So we have to tell people that the dietary guidelines is diet-based approach for everybody, independent of the socioeconomic state, and therefore it is very unlikely that dietary guideline will ever reply for supplement. Now, see, this joke I saw the other day about health, people, how do you find people with no problems? He said, a guy at a furniture store told me the sofa would seat 5 people without any problems. Then it occurred to me, I don't think I know 5 people without any problems. It looks, now we have reached that particular stage that we can't identify 5 people without any health problems. So will this really apply to a larger population? It may not, but at least during the phases when they are normal and healthy, follow the dietary guidelines. If there is a deviation, then follow the professional advice. And there are 2 terms also referring to the reference intakes for EAR, or estimated average requirement, and RDA, which is the recommended daily allowance. Now, what are these 2? See, an RDA value will cover 99%, is adequate for 99% of the population. But there is always almost half or more than half the population for whom it is too much, that level. Therefore, it is found that what is the average level that keeps the people healthy, or the minimum level of a nutrient which is required to keep the population healthy, is the EAR, which is lower than the RDA. Now, if a person, in spite of taking an estimated average level of a nutrient, has deficiency, let's take vitamin D deficiency, in spite of taking average level of a diet-based requirement, then you need to supplement. So an RDA is most often required when a person is not able to, is not getting enough nutrients in spite of taking the estimated average value. So this is the reason is why no supplements. A healthy individual can stay healthy with a balanced diet and may not require the support of supplements. The guidelines do not make recommendation for disease states. And anything that has a claim of treating, preventing, mitigating, or managing a disease is outside the scope of this guideline. So the entire emphasis or the philosophy or the scope of this dietary guideline is in the judicious use of this information to prepare and consume home-cooked food. Just a moment ago, I think Dr. Sanjay mentioned about, another doctor mentioned about food ordering. More often when you order food, you're actually getting unhealthy food. So this guideline encourages you to prepare, consume home food, freshly prepared balanced meals that meet the average requirement. And all the guidelines, right from the cooking methods, how to source the safe food, etc., are provided in this guideline with this intention. And as I said, they may not be applicable for people with any deviation in their health. And all my nutritionist friends who are working in hospital, remember that you are not dealing with healthy people. And therefore, you need to meet the therapeutic needs of that particular patient. And your wisdom, as well as the treating physician's wisdom, will decide what they should take. Now, coming to protein intake, the estimated average requirement of an average sedentary man or woman is 40 grams of protein. RDA is 50 grams of protein. This is based upon the daily nitrogen losses of 48 milligrams per kg based on WHO data. And when you compute that, you find that you need at least 0.66 grams per kg per day. And you can go up to 0.83 grams per kg per day. And now the recommendation doesn't go to 1 gram. 1 gram, 1.2 grams are people who have special requirements where they want to improve their muscle mass. 0.8 grams should be sufficient for everybody. And food-based approach for getting the best quality protein is if you have a diet which has 3 parts of cereal, 1 part of legume or dal, and 2.5 portions of milk, we will be able to get the required protein. Now, based on this, if you see, people talk about protein quality. Good quality protein is coming from animal sources, milk, eggs, meats. Does that mean vegetarians can't get good quality protein? They can, if they combine with cereal and pulses, and they will get that, the amino acid missing in cereal will be there in legumes and vice versa. Now, if you take here, for example, cereals and millets consumed at 250 grams in a day will give us 25 grams of protein. 300 ml of milk will give us 10 grams of protein. About 85 grams of pulses will give us 20 grams. Vegetables around 400 grams will give 10 grams, and nuts, etc., 6 grams. So you will be able to get almost 60 to 70 grams of protein. But of course, you could always ask me the question, how many people can actually afford this kind of a food? That indeed is an issue. So we need to therefore, but those who cannot afford this through food-based also cannot afford supplements. Now, the consumption of supplements over and above the dietary protein does not help muscle building. So this is a published paper in JAMA. It doesn't mean the more protein you take, the more muscle you will have. Okay. And protein powders are also not advised because they have a lot of additives. I would not emphasize too much on additives because additives are within limits of the FSSAI and really of not much concern. But of course, they may have sugars, and even sweeteners are fine as long as the right kind of sweeteners are used. But one has to be aware that when you're taking protein, there are other things also may be coming. In sports nutrition, we've always had this discussion. Is sometimes a sportsman, just before going to the Olympics or Asian Games or any important games, they have to give their urine for a test for certain biological molecules which are prohibited. Very often they take some of the supplements under the misguided influence of their trainers, which has certain unfavorable components in those supplements, and they get disqualified in the last minute, which is a very sad thing for them and the country. Branch chain amino acid like leucine, isoleucine, valine, etc. has found that if you take higher amount, this is in nature.com scientific reports in 2016, that they increase the risk of non-communicable diseases. There's also a suspicion that prolonged protein supplement intake actually may result in bone loss if calcium intakes are not matching up. So there are a lot of cautions are given. We are not against supplements, but we are not against supplements for a normal, healthy individual. Okay. Now the calorie intake, also the energy intake in weight loss regimes. The guideline does not recommend weight loss regime of 1,000 kilocalories and lower, because there are enough papers to show that if you go below 1,200 kilocalories, the BMR gets reset to a lower level, hormonal changes come, stress factors get enhanced, you start having intense hunger, you could have micronutrient deficiencies, and even fatigue, headache, gallstones, and many more are associated, and therefore the recommendation is don't go below 1,000 kilocalories in your weight loss. So I will actually conclude by saying that nothing is absolutely safe or definitely harmful as far as either supplements or in foods. In fact, there was a mention about chicken, that nowadays we recommend chicken, but many of the chicken might have been injected with hormones. You should source chicken from a safe source, and also free-ranging chicken are now popular and they don't use hormones in them. And let us assume even if a hormone is injected in chicken, the hormone is the harmful one. They cannot increase the muscle, but what happens is many of the chicken which are raised like this, the weight, let us say 100 grams of chicken, if you weigh, it doesn't have 100 grams of meat. It has quite a bit of water. And therefore, there are some kind of nefarious activities going on in this industry. But so therefore, buy from a regular source, and chicken is a good meat. Moderation is the key to the whole thing, and that is entirely within us. You always have to weigh the benefits versus risk whenever you take either a food or a supplement. And the guideline is to keep healthy people healthy. Remember that our predecessors lived healthy life without supplements, through natural food and good physical activity and good lifestyle. That is the key to the whole thing. I will conclude by saying, referring to Bhagavad Gita chapter 16. Bhagavad Gita 6:16 says, "O Arjun, those who eat too much or too little, sleep too much or too little, cannot attain success in yoga." Their yoga means a balanced state of mind and body. So that's what Krishna was telling Arjuna on the battlefield. And the next stanza he says, "But those who are temperate in eating and recreation, they are balanced in work and regulated in sleep." See, the importance of sleep was already mentioned in the Bhagavad Gita. Can mitigate all sorrows by practicing yoga. And with thorough discipline, they learn to withdraw the mind from selfish cravings. That's what we are having here for food. And rivet it on the unsurpassable good of self. So you have to give importance to yourself, your health, and get over the craving. Such persons are said to be in yoga, which means a balanced state of mind and body, and free from all yearning of the senses. So you have to have a control over yourself. That's what Krishna is supposed to have said in Bhagavad Gita. So balancing the diet and controlling portion sizes is a very difficult challenge and needs a multi-stakeholder approach. This is where we request industry, do not advertise for liberal use of certain foods, which you know that people get carried away by that and start gorging on food. And that is what leads to problems. And any food, there's nothing like a bad food actually. In fact, I'm not in favor of the word junk food. The junk or no junk depends upon how much you eat and how often you eat. So thank you, Rajshri. I will now stop sharing. I hope I did not take too much of time.
So, sir, I think I would still keep listening to you as to learning so much of learning, and again, authentic information that we're really getting from you. A balanced one from all angles, and that gives us more ideas and more balance in our approach towards a holistic approach towards diseases is what I really think. We are very happy to present you this award. Dr. Kakatkar is still around. Dr. Harshit Joshi is here. I'm sure we have Dr. Ashish Arbat as well. Dr. Bhatkande, ma'am, hope you're here. We would definitely want you to be on the video. These are some of the doctors who really, ma'am, especially you, have really supported, motivated me into doing the right things and have always backed me in doing these awards and these kind of programs, which obviously are for the betterment of the society. So I think, having said that, we have the award on the screen.
Thank you. I'm honored.
Yes, and this is the virtual award, of course, and we will, of course, present you with the award soon, hopefully in person, or we will, of course, send it across to you. So it's a pleasure. If anyone wanted to say anything to sir, but sir, I want to say something that we're fortunate that you went to that competition and which was and the topic turned out to be balanced nutrition, which is why I guess we have you here. So there is so much more from your wisdom and excellence that we need to take forward, and you always keep giving us that opportunity and selfless input so that we can actually propagate nutrition in the right way further. So really happy, and thanks for appreciating the fact that the medical fraternity is here today, because that's really the attempt of having this kind of a program where we can integrate nutrition into the medical or the healthcare practice really. So I think we all are here, and if anyone wants to say anything to sir, please feel free. Yes, Dr. Kakatkar, please.
Yeah, I think it was a great pleasure listening to you, and I think it was a very enlightening talk, very crisp and precise information. I think all the medical branches, I think they need informative talk like this, so that whatever we are practicing, I think we have a much more sound understanding about what we are doing it for our patients. So I think it was a great pleasure, and I thoroughly enjoyed.
I enjoyed your talk too. Thank you, sir.
Thank you. Thank you very much.
Bhatkande ma'am, did you want to say anything? Bhatkande ma'am is, of course, dean at one of the oldest hospitals here in Mumbai. Yes, ma'am.
Sir, thank you so much. It wasn't just guidelines, nutritional guidelines. It was like mentoring all of us here. And in the short space of time, we had a wonderful session. Thank you so much, sir.
Thank you, ma'am.
And it was not just about you teaching us, but you've inspired us. So thank you.
Great, sir. We take a promise from you, and of course, give a promise to you as well that such kind of programs will keep organizing so that there is more propagation about the right type of nutrition. With that, so you can feel free to be with us because we're going to have a couple of more sessions, and the next one which we would want to move on to is, let me quickly share the slides. So the next session really is about the importance of integrative treatment, personalized nutrition and nutraceuticals in digestive disorders. And it is again a privilege to have Dr. Rekha Bhatkande, ma'am. She's consultant gastroenterologist, practicing for more than 40 years, of course. Been the dean of Sushrusha Citizens Cooperative Hospital, which is one of the oldest, multi-specialty hospital started in Mumbai. She's senior member ex officio of the Gastroenterology Research Society. She's patron of Marathi Divas. She does a lot of work in the social welfare area, and even at this age, she really wants to do a lot more for public health, as she's co-founder, president of Dilasa, which is a senior citizens foundation. She's doing a lot of work in multiple sclerosis. So the list is really endless when it comes to her work. We have Dr. Harshad Joshi with us. We also have we're checking if Dr. Mishra has also joined us, but nonetheless, we have Dr. Harshad Joshi with us. It is a pleasure, Dr. Harshad Joshi, to have you on our platform for the first time. And he's MBBS, DNB Internal Medicine, DNB Gastroenterology, and his active interest really is in inflammatory bowel disease, and he also has a fellowship in the same from the University of Alberta, and he's consultant at the Nanavati Max Super Specialty Hospital, and like I said, he specializes in IBD. So I'm sure we're going to learn a lot from him about how with nutrition and how a holistic approach helps in bowel disorders like Crohn's disease, colitis, and pancreatic disorders as well. So it's great to have you. And another favorite, of course, mine is Dr. Niti Desai. She's a consultant nutritionist practicing in South Mumbai for more than 20 years now. She's attached to Kambala Hill Hospital and Heart Institute for 17 years. She's also taken education from the UK as well and has practiced there. So she has a master's degree in nutrition and dietetics from the University of Mumbai, as well as a postgraduate diploma in dietetics from the Leeds Metropolitan University, UK. So it's absolutely a pleasure to have this elite panel here, and without further ado, I'll actually go into some questions for all of you, because we all know, we all talk about gut being referred as the second brain, and it's obviously because of its vast network of neurons and the serotonin that it secretes, that it's one of the most critical organs. And as Hippocrates said, all diseases really begin from the gut. So what we eat becomes most critical, because it can not only affect the digestive health, but also the mental health and the overall wellness. So let's get to learn more about how nutrition and nutraceuticals can be an effective support in different digestive disorders, like the common ones are acid reflux, bloating, IBS. These are so common. Fatty liver disease is getting very common. So having said that, Dr. Bhatkande, and really before actually we get start with this panel, I want to personally share one of these slides. And excuse me for doing this at this point in time, but bear with me. But I would like to actually remember someone whom we lost pretty recently, couple of months ago, and one of the very leading gastroenterologists from Thane, and Dr. Chandrasekhar Kale has actually been my father's student. But more than that, he himself has a lot of students he has mentored, and a very dependable, uh, very jovial, very modest gastroenterologist from Thane. But not just that, he's really supported nutrition as a therapy and has backed me also in my efforts. So we really want to remember him and maybe have a moment of silence for about 30 seconds at least before we start the panel. I'm sure quite a few of you know him, and which is why he mentioned really before this panel. But having said that, Dr. Bhatkande, digestive diseases like IBS, IBD, which can, of course, impact overall health by causing malnutrition, weight loss, fatigue. In your experience, I mean, I really want to know something which I'm passionate about. Do enzymes really play a key role in aiding digestion and assimilation of foods?
Rajeshri, when you talk about enzymes themselves are protein, and they help break down the food that we ingest into acceptable and very easy to digest form of nutritional item. That's what enzymes do. And our body produces so many enzymes, and at very different levels in different places. Starting right from the saliva, we all know about ptyalin, which is actually a salivary amylase. Then to the stomach, wherein the stomach juice secreted into the gastric juice are almost 10 enzymes. Some of them major, some of them minor, but there are 10 enzymes. Then, funnily enough, a reflux from the duodenum into the stomach, also helps in part of the digestion. And then, of course, you have your enzymes that come up in the intestinal secretions, or what they call as succus entericus. There are about 6 main type of enzymes that come up there. And all these enzymes actually help in both digestion and food assimilation. Now, you wanted to know very specifically what happens in conditions like IBS, and do enzymes help there? Now, if you were to ask a patient, they find there is a lot of clinical improvement in their symptoms, like bloating and diarrhea. If you were to look at the evidence, then it is not a very high level recommendation that enzymes be given in irritable bowel syndrome. But patients do well. They obviously don't harm. And ultimately, we do look primarily, if we are not doing harm, primarily at trying to better the quality of life of a patient. But if you were to look at inflammatory bowel disease, now remember, in the small intestine, there's a lot of chemical digestion where enzymes are being used. Your enzymes can be used. In Crohn's disease, where the terminal ileum is involved, may be involved, there may be skip lesions and all the rest of it. Their enzymes may help because the disease itself possibly is. Rajesh, I'm putting my video off because my internet connection is. Okay, so what actually happens in Crohn's, where the terminal ileum is involved, enzymes may help because there is a structural damage to the lining of the intestine. On the other hand, if you were to look at ulcerative colitis, which is purely the colon I'm talking about, in that case, no chemical digestion takes place in the colon, except that which occurs because of the microbiome there. Okay? So I'm not very sure that the existing enzymes or the supplements that we're giving, enzyme supplements, will actually help in ulcerative colitis. On the other hand, 30% of people with ulcerative colitis or inflammatory bowel disease, 30% mind you, have symptoms of irritable bowel syndrome. So they actually do well because of their symptoms. Like I said, quality of life. But I'm very excited because a whole lot of unknown, less known enzymes are being looked into currently, which in fact may help as anti-inflammatory. Their properties, anti-inflammatory properties, their properties to address the microbiome and regulate the gut microbiome, because we've definitely seen that most of our digestive diseases, disorders, a lot of NCDs, that is your non-communicable diseases which are occurring, are linked to what happens in the gut and the microbiome. So I think in that case, maybe we're looking at a future where enzymes are necessary, will be necessary, and are definitely helping patients. That's
that was really an elaborate understanding of the role, basically the understanding of enzymes and their mechanism, and how we could futuristically look at enzymes more evidently. Dr. Joshi, with you also, you majorly look at patients who have IBD. So undigested food can normally cause overall inflammation of the GI tract. And so have you sort of seen use of enzymes in correcting the digestion, and is there overall reduction in the inflammation factor, and how can enzymes sort of help reduce the risk of inflammation, and then the other lifestyle diseases that are attached to it?
Okay. First of all, Rajeshri, it's a privilege being here for the first time, and thank you for giving me the opportunity to be in the presence of giants like Bhatkande madam, who has been teacher at some point in time. Listening to Sir Sesikeran, I mean, you just feel how less you know about the whole nutrition. I mean, that is something, a great opportunity to be in. Without further diverting into it, let me come to the point. So the first question that comes to the mind is, what is inflammatory bowel disease? This is basically where your body's immune system is overactive, and that is what inadvertently affects your gut, be it a small intestine in Crohn's disease or large intestines in ulcerative colitis. So it is basically an unchecked or unregulated inflammatory system which is the pathogenesis behind inflammatory bowel disease. I think the current understanding of scientific knowledge is about cutting down the inflammation. So we know that we have very good anti-inflammatory molecules like 5-aminosalicylic acids or steroids or biologic, etc., which will reduce the inflammation. Now, how much is the real role of enzymes here is something which is questionable. The reason being, we are looking at if you are looking at the treatment part, anti-inflammatory treatment is the only thing that we should be targeting when dealing with these kind of disorders. But like Bhatkande ma'am rightly said, that it is not just IBD that the patient should be coming just to, but there are a lot of like almost about 40 to 50% of their symptoms are IBS type. So gas, bloating, diarrhea, constipation, etc. And even if you give the best anti-inflammatory agent, still the patient's symptom might linger because of this additional IBS symptom, which can definitely be helped with use of certain types of enzymes. Now, again, the enzymes in the form of treatment are studied mainly for pancreatic disorders because most of the digestive enzymes come from pancreas. So, in a normal individual or even in a disease in the patient, if the pancreas is working fine, you expect that the enzyme should be in normal quantity, and there is no real use of adding enzymes for any kind of treatment. Your pancreas is able to take care of that. But yes, yeah, in patients who with pancreatic disorders, we do give supplemental enzymes because they are deficient in it, and that is shown to improve the digestion and absorption of certain nutrients, including fat and proteins. Now, undigested food, whether it really causes inflammation, the I mean, there is no scientific evidence, I would say, to that. But yes, it is very essential. Like ma'am said, 30% of your digestion appears with the salivary amylase. So if you eat well, if you eat properly, then 30% of the digestion starts right from the mouth. So obviously, when the food reaches the stomach or the intestine, the rest of digestion can take place, which will result in adequate nutritional requirements. But if there is any abnormality at that level, so like technically we always tell the patient that hurry, worry, and curry. These are three common things which can cause many of the irritable bowel kind of symptoms. Like patients who are eating very fast can have improper digestion, leading to various digestive issues. Worry. So because gut and brain are connected, so stress does play a role in overall functioning of the bowel and can result into various symptoms, and it also changes the bacteria in the gut, leading to some amount of inflammation occurring in the gut. And curry, so fortunately Indian diet is a very good diet. Like Sesikeran sir mentioned that uh, we are the area of spices. So the you can see, I mean, sir showed very elaborately about how all the spices contain various products which are helpful for the gut. So we are really blessed in that sense. And inflammatory bowel disease, which is more pronounced in Northern America or European countries, is because their diet is predominantly wheat-based or less of vegetable, more of red meat, non-vegetarian. So yes, food does play a big role in uh, mal digestion and resultant inflammatory condition. But per se, there is no role for digestive enzymes if it comes to treatment of inflammatory bowel disease. Nonetheless, irritable bowel syndrome, reflux disorders, etc., do get benefited with use of enzymes. Again, when it comes to recommending something, you have to have good, robust studies comparing nutraceuticals with the placebo or the current standard of care treatment. And I think that is somewhere we need to improvise as our Indian system, because we are aware of the utilities, but we often depend on the Western population to give us guidelines as to how we should treat our condition. So I think that is where we should be doing more research?
That is exactly what we discussed in the morning in the first session, which was on metabolic disorders. And we said, we are the diabetic capital of India. How do we become the diabetic treatment capital of India? So, more the amount of research that can go in. But taken your inputs from both of you gastroenterologists, the third panelist here is second generation of gastroenterologists and also nutritionist. So, we are going to get a both-sided balanced opinion from Neeti out here. And I think, Neeti, it's very important to know this from you because, like we said, uh, like Dr. Joshi mentioned, pancreas, it has an exocrine and an endocrine role. So, there is also an overlap between the digestive disorders and the metabolic issues that are there. So, diabetes, fatty liver, all of these. So, encompassingly, do you see a multifaceted role of enzymes in digestive diseases? And why I'm really pondering more on this because I have seen a lot of improvements in patients that we treat, and like Dr. Joshi rightly said, we need to do more research or rather more clinical trials on this front. So your input is really going to be a lot of value.
Right. A very good afternoon. And on the outset, thank you very much, Rajeshri, for having me on this platform. Listening to Dr. Sesikeran sir, always extremely enlightening, and so glad to be on the panel. So yes, as you did mention, the enzymes do have a role to play when we are talking about pancreatic disorders. As Dr. Joshi said, I mean, pancreas is a powerhouse of enzymes. So whenever, I mean, a case of pancreatitis, a pancreatic surgery, wherever there's exocrine pancreas deficiency, the enzymes do have a role to play, and they work well. In fact, we have to, in most of the cases, use them. Otherwise, there is a lot of weight loss, weakness, the food digestion doesn't happen. Also, another area where enzymes do seem to help is, people say they are lactose intolerant. Earlier, we did not have the enzyme replacement, but now we have it available in the market also, the lactase enzymes. So in a country where we are primarily, majority of us are vegetarians, and even the non-vegetarians are not hardcore non-vegetarians. You might be having non-vegetarian food twice in a week, but you are a non-vegetarian still. So dairy, and as Dr. Sesikeran said that dairy does seem a part of your diet, which contributes to the protein intake. And a lot of people are avoiding dairy for various reasons, one of them being I'm lactose intolerant. So again, here, genuine lactose intolerance is not there as much as it is talked about, but at least we can offer this as an option, that even if you want to have some dairy, try this. Of course, there are lactose-free products available, but even this is an option. So also what we call functional dyspepsia, where the treatment is on, but still there isn't relief. That's where also sometimes the enzymes preparations come into play, because as Dr. Bhatkande ma'am said, that they don't harm as much. So if they are helping alleviate the symptoms, improve the quality of life, yes, they can be used.
Sure. So Dr. Joshi, you mentioned also about using anti-inflammatory medication. Of course, you would be prescribing. Are there any nutrients or nutraceuticals you think can also help in, or rather support in the anti-inflammatory therapy that you're giving to your IBD patients?
Yeah, so there are some good anti-inflammatory agents which are, or rather nutraceuticals which are talked about, because if you strictly look at medications, there are only the listed ones like aminosalicylic acids or steroids or azathioprine or the biologic agents which are targeting at the specific levels of the inflammatory system. But the inflammatory cascade is really a huge cascade. There are various paths like interleukin 1, TNF alpha, or interferon beta, PPAR. So there are various inflammatory pathways which are there. The commonly talked about, or there is some data available as far as the nutraceuticals are concerned, is regarding curcumin. The second thing is about boswellia, or the Indian frankincense, that is talked about. And some people also talk about omega-3 fatty acid. There are many more, but these are some things wherein some data is available in some form of at least small set of studies which are available. And when if you carefully look into how the mechanism of these substances is, they definitely seem to target certain areas. Like for example, how omega-3 fatty acids are thought to work is there was a study wherein they looked at the mice intestines and they found of ulcerative colitis. So they induced ulcerative colitis in mice, and then they looked at the omega-3 fatty acid levels in their intestine were found to be deficient. And by supplementing them with omega-3, there was improvement in the mice intestine. Does that happen in humans? No large data is available, but I think that is something which needs to be definitely looked into, because it is something which is not expensive. These are things which are used often in our day-to-day life, like unsaturated fatty acids, various types of oils. Say, for example, coconut oil is said to be helpful in digestion, etc. So I think it's worth looking at that option. Now, the only caveat to using these particular thing, or let's see, or even the boswellia, the Google. Many of the Ayurvedic physicians do happen to use this particular medication for various chronic inflammatory conditions, be it osteoarthritis, for various aches and pains, even inflammatory bowel disease. Like some of my patients' mom, like she's a Ayurvedic physician, so she does use the prescribed allopathic medication, but in addition, she also uses the Google or curcumin also. And there is definitely good benefit in these usage of these medication in at least that particular patient. There are many such patients. Uh, this is something which I particularly noticed after the COVID era, wherein many people were using curcumin because it was said to be anti-inflammatory, anti-fibrotic, antioxidative. So many people started using curcumin in their day-to-day use for non-IBD purpose, and many of my patients actually showed there was improvement. Now, unless and until you prove the cause and association, it would be very, very difficult to say that yes, this definitely helps. But there is a potential looking at the mechanisms which are involved, and it is worth looking at this particular option. That also means to, like Sir mentioned, we have to look into what is the dosage that should be used. Are there any side effects? Obviously, there are no side effects since we are using most of these molecules for ages or rather centuries together.
Correct.
But what dosage is necessary to have a acceptable limit, and it should also show improvement not in just symptoms but also biochemically. So their inflammatory markers should subside, reduce, or they should have an endoscopic improvement. So I think that particular thing needs to be
Yes.
looked into. But yes, these particular, I mean, there are many nutraceuticals which would need to be looked in with a scientific angle.
And when we are talking about nutrition and nutraceuticals, the crux itself should be that it should make the biochemical change, or rather
Improve.
the actual change. Yeah, otherwise, there are several drugs there for a symptomatic relief. So, having said that, I think I would also like to take Neeti Desai's opinion on how helpful is how helpful are the fiber supplements. Do they need to be taken in isolation, or is food better? Or these days we have protein supplements along with prebiotic fibers. What's really the best sort of a solution when it comes to digestive disorders? And multiple of them look like they benefit out of them, like, IBS, fatty liver, a lot of the places where patients are taking it. What is your actual advice, and what do audience here take away, the right advice to be taken?
Right. So, of course, food is our primary source. We would want our fiber coming from our food. As the name supplement suggests, it's something that supplements your diet. That cannot be your diet. So if you're getting sufficient fiber from your food, and which is, as I said, is the first effort, that is the way to go. But very often we do find that for normal population and of course people with conditions, they're unable to take sufficient fiber, of course, because also of the presence of junk food, highly refined and processed food intake which has gone up. So we are perhaps not meeting the fiber intake, and in case of patients, of course, their intake is compromised, their appetite is poor, they're not able to take sufficient calories to even manage the fiber intake. So in either of the cases, that is where we think about supplements to augment the fiber intake. And the fiber supplements are, obviously, there are soluble fiber supplements, insoluble fiber supplements, and there are few preparations where it's a blend of both. There is soluble and insoluble. Now, as no, insoluble fiber supplements are particularly useful when we are looking at the bowel movements. Okay, in case of constipation, getting regular bowel movements, that's where the insoluble fiber supplements come. And the soluble fibers primarily is also used for bulking. It swells up, but it also brings down your cholesterol levels. It, in fact, I also use it to kind of as a satiety factor. So when we are trying to people to lose weight, in weight loss, again, we will ask them that you have some low calorie fillers, like have a soup, have a salad. And then there are issues where they will say, no, I don't have the help or the time to prepare soup every day. I cannot do it, or I only like tomato soup. I don't like anything else. Others will say, oh, I can't prepare salad every day. I don't have that kind of time. So again, that is where the fiber supplement comes in, where it does, as I tell them, it does 3 jobs. It kind of fills you up, so it helps you control your intake. If you have it before the meals, 15-20 minutes before the meals, it will improve your bowel movements. And number 3, in case of hyperdyslipidemia, it will also help you bring down the cholesterol levels. So fiber supplements work at multiple levels for multiple systems. What is the primary issue that we are trying to address? We would use the fiber supplement accordingly.
Okay, so I think with that, I'll of course want to ask you the question on the protein supplement, because that is something which is, right now taking big rounds in the social media with the new ICMR guidelines that have come about. And, what's your thinking about, using a protein supplement, choosing a right supplement, effectiveness versus safety, what's your take on it? And, my take on it, honestly, is, where there are deficiencies or where patients are critical, they need to be given these kind of supplements. And, they should comprise of different proteins coming from different sources. So amino acid needs are met. Just as Dr. Sesikeran said, protein when eaten, it's going to break down into multiple components. There are going to be multiple steps till it's actually going to get utilized. And it's going to get converted into enzymes, hormones, and more. So that's my take on it. And, it should be sugar-free, sugar-free, substitute-free, should comprise of multivitamins, so that it becomes like a compliant supplement, which is safe at the same time, not just because we think all these proteins that we would put together. So there are these several ideas and confusion going around. Again, your important take on this whole thing will sort of help us understand this more better.
Right. So, the protein. So, first of all, as Sir said, these guidelines are for the healthy population. We are not talking about special populations, which include patients, which include elite athletes. So I've had the opportunity to work with countries' elite athletes, whereas again, as Sir said, they may need protein supplements, but they are so wary about the doping issue that they are the protein supplements are not clean. So even if they need the protein supplement, they are wary unless we get the WADA certified supplements. So that's another topic for discussion. When we're talking about healthy population, again, the protein definitely needs to come from the diet, but we also have seen in practice all the time that majority of the Indians are not meeting the protein requirements, which has now been brought down from 1 to 0.8 to even 0.6. But still, we do see that majority of the Indians are not reaching the requirements. And of course, even some of the very seminal studies have shown, like the START study has shown, that we are a carb-loving nation. Whether you go north to south or east to west, we are from 65 to 70% of our calories are coming from carbs. So the issue is that we do need to step up the protein intake. We are also a sarcopenic population. We are thin-fat Indians. So that adds to the fact that we do need to have we need to meet our protein requirements. So what I do is, of course, I offer them protein-rich food options, how to augment your protein intake through diet. Okay, that is, of course, the first choice. Also, the fact remains that pulses, which are our protein, one of the main sources of protein for most of the vegetarians, also has 65% carbs. So there is a carb load there also. So that also needs to be, I think, talked to with our patients, because very often what happens is they know they have to increase the protein intake. They'll continue eating their 6 chapatis and their katori of rice and then add a katori of dal. Okay, you are adding to the carbs still. So the carbs need to be replaced with protein, not just the protein needs to be added, especially for a vegetarian. Of course, for the non-vegetarian population, it's another story, because it's very easy to increase the protein intake without the carb load. So yes, now, even in the healthy population, there are people who are always on the run, or they don't have the time to cook. They don't have either the help, or they don't have the expertise. So where does the protein come from? Because then they are ordering vada pav and samosa and pav bhaji and biryani. In fact, if you see the Swiggy statistic, biryani is the highest ordered dish since last 4 years in the country. So perhaps in some of the select population, select people, protein supplement can be suggested, but the caveat here is that because protein is good, more is not better. Okay, we need to look at the protein coming from the diet and then titrate if at all the protein supplement needs to come in. Also, there are 2-3 issues here. So the whey protein may have issues when it comes to acne. So there seems to be an association. Of course, this association is also ethnicity specific and sex specific. So again, as Dr. Joshi said, we don't have Indian data. We are at the moment just using the Western guidelines, Western direction. Also, the BCAA supplement, which is very rampantly used in the gym-going population, there is evidence now that leucine seems to work. Leucine is still helpful, is the hero, but isoleucine and valine is not in fact required. It may increase the incidence of NCDs. So this information also needs to be titrated, and we need to tell our clients that do not just guzzle down BCAA supplements, during the workout. Also, a lot of gym-going population, the trainers for different reasons will say that, oh, you have to have at least 2 scoops of protein in a day. Okay, that is where again we need to come in and titrate the dose. Which protein to use? So of course, there is primarily whey, which could again be either hydrolyzed concentrate, isolate different varieties of processing. Each has its own pluses and minuses. For the people who do not want dairy protein because they've turned vegan or this bloats them, then now we have a combination of plant protein where it's primarily a pea protein and rice protein combination. So again, that is something we always need to discuss with our patient and figure out what works. But the primary message is, of course, we need to step up the protein through our diet.
Sure. Absolutely. And so while we come towards the end of... Yes, ma'am, I have a question for you.
Can I just ask you something?
Ma'am, yeah, no.
Oh, sorry.
Okay. You please go ahead. But with that, I have a question for you as well. Related.
Aniti, the 9 essential amino acids, okay? Now, like you were talking about whey protein, and that is giving us the isoleucine, leucine, and things like that.
Yes.
But as far as I know, in the supplements, arginine, glutamine, histidine, theorine, all these have been actually isolated, have been made into supplements. What about the rest? I mean, the 9 essential amino acids not being produced by our body, and yet they are first-class proteins. So how do we? I do know that now the recommendation is a combination. You combine lentils and proteins derived from grains, grain-derived proteins, and you use peas and chickpeas. I think that's right up our street. We wallow in chana, so I think that is something we should be using. But does it really give us all these 9 essential amino acids?
So if we are having first-class protein sources, foods, which basically for a vegetarian is dairy, that could be milk, yogurt, paneer, or it could be soybean. Soybean also gives first-class protein, okay? Then you do not need to worry so much about the combination, but also the point is that how much dairy and how much soybean can you have? So we will end up having a cereal pulse always in our diet. For the non-vegetarians, of course, the eggs and the meat, they are all first-class protein. So it's a slightly smaller challenge in that sense. Affordability, the frequency of eating, all those are other issues. But for vegetarians, it's a daily struggle because again, as I said, if you had in the morning, for example, you have poha or upma, then you had tea and biscuits in your office, then you carried roti sabzi because dal is too messy to carry. Then in the evening, you called for sukha bhel or vada pav. And in the night, you had pulao or biryani or pav bhaji because the kids don't want to have the usual daily stuff. So where is the protein? There is not even an opportunity to combine cereal and pulse. So even if we start from there and we make the beginning of asking them to have poha with sprouts or doing egg, forget the non-vegetarian, even if something like khakra and mung or just usal or idli with sambar, paratha with dahi, that's where we need to start, where we at least start combining cereal and pulse.
Fair enough. What I found in the hospital, Shusha hospital, especially my accounts department, the girls usually have a jar of chana, the smashed chana, so that's spicy as well as tasty, and they're keeping that, and I think that's a good source of protein.
You're absolutely right. That is what I'm saying. So we need to begin there. So in the evening, even if they want to have sukha bhel, we ask them that you add chana to your sukha bhel, add chana to your kurmura. So these are the small changes, small tweaks that we need to make, and we can augment the protein intake through the diet.
Yeah.
That is the whole idea.
Sure. So on that front, I think I would also want to share that the hospital food is another element where a lot of changes can be made there, because when patients actually come there, if we serve them delicious healthy food which is balanced, then they realize that they actually take recipes from us, and then they take them home and they follow them at home. So it's a good way to sort of put them on a good, healthy, and still good tasting diet. So rightly, I mean, having a sprout bill is such a good idea. So I think, ma'am, in fact, Bharkane ma'am, I would like to close this session by asking you that question. In the hospital setup, in the ICU and the recovery, rehab, etc. How do you look at protein, using protein supplements or any other supplements? What has your experience been, and how important is it to have a holistic approach at things?
Yes, I think it's an extremely important thing. In fact, if you were to look at the proteins themselves, what are the proteins in our body? What are they doing? We have such important, I would say, what the proteins do. I mean, we have almost about 7 types of proteins in our body. Like our antibodies. I mean, every person in the hospital, whether they've come with an infection or possibly it could develop an infection, antibodies is such a big thing, which Harshad has already alluded to, the immune system. Then you have, your proteins can be your contractile proteins, your structural proteins. I mean, that has been alluded to by the orthopedic surgeon. So your structural proteins, then your enzymes themselves, the hormones, then the storage proteins, COVID taught us one thing. Everybody wanted to know what your serum ferritin level was. I mean, what were you looking for? You're looking for how much of your storage proteins are there, like ferritin. Okay? And of course, your transport proteins, which are so important, transmembrane proteins. Now, all these proteins are going to be affected in any critical disease or disorder. So, in a patient who comes to the ICU, where he is, then his metabolism is more likely to be catabolism, more likely to be in the negative balance rather than in the positive balance. And so we do need to give additional proteins. It's all about how do we give them. And along with the proteins, we also need to give multivitamins, the vitamins, the metals, the micronutrients. All this has to be addressed. I remember when we were being taught by a very nice, I would say, a technician about ventilator support. Then, this whole R factor and all came in. And then you realize that if every is carbohydrate, then how do you expect a person on a ventilator to really regain the power to get off, to be weaned off the ventilator? Because we do know that high carbohydrate diets are going to cause havoc in the metabolism of the lung. So I think it's so important. And this also brings me to your personalized, nutrition. A dietitian in the hospital invariably goes along the usual guidelines.
So I think that's really what, from this session, we did gather that, the personalized approach and the potential role of nutrients and nutraceuticals and the herbals that's there. But, we need to conduct trials, and so that can actually showcase the real effect and the mechanism of action, just as Dr. Joshi mentioned in his inputs as well. And great inputs from all 3 of you. And I think time is really short for this discussion because there's so much to be added. Dr. Bharkane ma'am, due to paucity of time, we will have to wrap up. But this is one
And
one
it's a never
major session
ending,
again.
ending story.
One major
Yeah.
session for discussion again. And on that,
And
I would like to thank all.
Rajesh, before you end, I must say something. This is the
Yes.
78th birthday anniversary of your father.
Yes. Yes.
I must acknowledge that he was one of the pharmaceutical persons who was a great, influence on my practice, because I met him when I just started my gastroenterology practice at Joy Hospital. And the conversations we had, because I had just started, conversations we had were tremendous. He actually guided me. So thank you very much for that, for letting me be a part of your father's celebration of your father's anniversary.
And I think that's what we have in you now. So I think Dr. Joshi also mentioned about it. So, you are the mentors and you are the ones who are real inspiration for us. But thank you so much, Niti Desai, Dr. Harshit Joshi, and Bhatkande ma'am for joining us on this session. You all can feel free to listen into the next, but we'll quickly move on to the next session as well, with the promise that we will do more such programs so that we can actually deliberate and bring out better outcomes in our patients with an holistic approach and integrating all the different treatment and therapeutic regimens. The next session, of course, is
You're muted. You're muted.
Thank you so much. We have Dr. Ashish Harbatkar. He's MS Ortho from the coveted KM Hospital, MCH Ortho from the Royal College of Surgeons, UK. He's the first 3D AI-based robotic surgeon from the Western region. Currently, he's working on a new surgical methodology, which is SuperPath hip replacement surgery, and as very much innovative that he is in his approach, he's high tech. He also believes in the integrated approach, as well as nutraceuticals being supportive in these therapies. He has fellowships from the US, UK, Japan, and then we also have Dr. Prashant Sarvi with us, who's a metabolic and bariatric surgeon. He's been treating many obese patients, and he's MS general surgery, FMAS, FAIS, FMBS. Again, many fellowships. In his experience, like I mentioned, 2,000 bariatric surgery cases, a significant number, and he also believes in a comprehensive obesity care. So we're very happy to have them as the panelists. And thirdly, last but not the least, Dr. Deepak Aivale, who's a neurologist. He's MBBS, MD Medicine, and DM Neurology. He's chairman and consultant neurologist at the Solaris Hospital and Center of Excellence for Neurosciences. Consultant at Jupiter Hospital, Bethany Hospital, Kaushal Hospital. So he's doing extensive work. He's also teaching, and he has stroke fellowships and doing a lot of work in Parkinson's and believes again in an integrated, also an evidence-based approach. So it's a pleasure to have three of you here today, and thanks for taking out the time, because all three of you I know, despite being a Sunday, have taken out the time, family time, as well as I know Dr. Sarvi has a case happening around. Dr. Aiwale is running around, and Dr. Albert is also in between conferences. So, and apart from the work that you're doing, but it's a pleasure to have you all here. And I would call this a very vibrant panel, and which is why your support in these kind of therapies is evident and also very much essential. We had Dr. Sesikeran giving us a lot of insights today on nutrition, but I will, without further ado, sort of bombard you with a lot of questions. And my first question will be, of course, to Dr. Albert, because I keep taking a lot of inputs from him, and we keep deliberating on a lot of aspects. So, do you really think, and can you sort of share with the audience here as to how to optimize? Is it important to optimize nutritional status in your patients when before they go into a surgery, and then how elaborate how your team actually uses these nutraceuticals, and how do you sort of get your patients to convince them or make them understand the importance? A lot of questions. Yes.
Am I audible?
Yes.
So first of all, hi Rajeshri, hi Deepak, and hi Prashant. Prashant, I'm very proud of you. I've seen you as an intern.
Yes, sir. I was your student at some point of time.
Yeah.
And I'm glad that I'm
very
here
proud
today.
of you, Prashant, and God bless
Thank you so much, sir.
your endeavors. And Deepak, all the best for your future endeavors as well. And Rajeshri, remembering your dad.
Thanks.
So I like to play the big brother, so Prashant knows it. That's how it begins.
Yes.
Yes, Rajeshri, we are doing high volume joints and a lot of hips and around. And there is a study going on, Prashant and Deepak and the audience, that we are doing a study on post-operative ultrasound guided measurements of the sartorius and the VMO around the knee. We are near about around 150 to 300 patients we have selected. And what we have found out is as the age progresses, there's a lot of collagen that goes. A lot of our female population especially is sarcopenic. Doing a good surgery. So when I was in the US, I asked Professor Ranawat, are we going to, sir, what do you give as a master advice when we go back? He says, are you going to give a good X-ray or a good knee on a good hip? So joint replacement, Rajeshri, essentially is a soft tissue surgery. You are using a lot of robos and this and that, but essentially it remains a soft tissue surgery. And nutrition plays a massive role in our the rehab and post-operative period, and all the surgeons would agree here what I'm saying. Sarcopenia is one serious stuff that we need to address. What we found in the study is compared to the general population, the male population, the females have huge muscle loss, which is in inches. The fat layer I have seen, Prashant, is in the hips. For some, we are doing a lot of hips now. 6 inches thickness of the fat. And where are you going to get the glutes? Where are you going to get the hams there? And what result are you expecting with all these modern robos? And we are the only people using robotic for the hip again. But is it not a bony process for the rehab? So we are doing a lot of muscle sparing super path technique. We have started doing something called a super path, which is percutaneously assisted hip replacements. But nevertheless, the red muscle, whenever is good, the results, it's a day one result. And you'll be experiencing in your bariatric and even in the neuro cases where sarcopenia is one thing which we really are not addressing. So Rajeshri, coming to your question, is definitely nutrition in terms of the muscle health, especially in the post-45 age group, where you start losing the collagen, has to be addressed with two things, I guess. One is resistant training. Is exactly reverse is happening in India, where after 45 you go for more of cardio and that kind of stuff. Resistant is one thing I tell doctors, I tell my colleagues is initial period you do your endurance and then shift to mild resistance, because without resistance your muscles are not going to get developed, and without the muscles, whatever prehab, whatever rehab you do, because I'm seeing patients, international patients, they have good muscle mass. The recovery is phenomenal. I have 3 kabaddi teams under me, which are playing in the kabaddi league, big players. Hardly any time required for rehab. But nevertheless, when I see postmenopausal women, and we do a lot of knee, so there is an international consensus that 24% of patients are unhappy worldwide. And it's a consensus from the Europe, the US, and the Australian subcontinent, where 24% is a huge thing. And what is that unhappiness is the muscle. So we do, we have made a lot of programs online, datas and this and that, and a lot of nutritional advice that we give. We'll discuss that. And nutrition is a huge part in our, especially recovery period, because doing a good X-ray doesn't mean anything to the patient. For the patient, he needs or she needs good activities, good lifestyle. Nutrition is one thing which we really need to emphasize, and such kind of talks should reach the public, and we are doing that on our, we have an online academy, and we keep on talking about a lot of nutritional this thing, and there is a lot of counseling pre and post about the nutrition, and I think we'll discuss that in the coming forum.
So evidently from your talk and the earlier discussions also that we had, sarcopenia was definitely highlighted. So, in terms of consumption of protein and what protein, there are a lot of question marks in terms of patients who are, suffering from some diseases, going through surgeries. So there needs to be a lot of deep work, and we are glad that you already doing trials and, working on patients' observations, plus taking a lot of effort in taking their inputs. This needs to be extensively done across so that we can really improve the outcomes. Sarcopenia is such a huge issue, and most doctors in the panels today did say that. But the recommended protein intake is not as much. So even if we are eating the protein, does it really get assimilated? Becomes really the question, and we'll come to it. But while we have Dr. Aibale here today, also we would like to understand that mindfulness is something which we talk, and neurology. There are so many disease conditions in neurology where, due to all those conditions, and the ones which especially we see in the elderly, there is so much requirement for nutrition, different type of nutrients. So what's your experience, and if you could bring light as to which are the conditions where nutrition can really help.
Yeah, so as Dr. Albert began this talk with regards to sarcopenia, we deal with most of the geriatric patients where we have cognitive decline, there are balance disorders, and they have their baseline muscle mass is, as usual, they have sarcopenia baseline. So these are the patients where it is very difficult to have this good unisurgical results in case they sustain falls and have hip surgeries. They have to undergo hip surgeries, or most of the times they even get spine vertebral collapses. And for these are like chronic cases, and most of the acute cases where we deal with head injuries. And now again, head injuries, most of the head injuries are accidental, but now with increase in geriatric population, Parkinsonian patients, cognitive decline, your home accidents and trivial falls lead to head injuries. And these patients usually come to us in neurologic ICUs. So there also we have to deal with their baseline nutritional status, and that affects our post what you can say, early phases of ICU care, we have to think of enteral nutrition. If there is cognitive decline, they cannot feed themselves by themselves. We have to go on to the enteral nutrition nasogastric feeding tube, and this has to be started early. And we usually have these acute what you can say neurologic injuries are more so in more hypercatabolic states and pro-inflammatory states. So in both ways, their energy requirement is going to increase during the hospital stay. So baseline nutrition is suboptimal, and in the hospital, if your requirement for recommended energy expenditure is increased because of the hypercatabolic and pro-inflammatory stress, then you have to have thinking about good enteral nutrition. And there comes the role of I think nutrition, where we have to judiciously gradually maintain the baseline nutrition and then gradually increase the nutritional support in terms of protein intake. And sometimes, if it is a severe head injury, this can be so severe that your requirement actually doubles for this protein intake, and the glucose requirement also increases. But as compared to other systemic illnesses where you have mechanisms like glycogenolysis, gluconeogenesis, and here in brain cannot utilize, it doesn't have stores, glucose stores, or cannot means it cannot be produced either. It is totally dependent on other substrates then, like you have to have other substrates for ATP generation like ketones, glycerol, lactate, and amino acids. So it is the neurologic injuries are quite separate as compared to the systemic illnesses, where you have a chance of increased glucose production and then go into negative nitrogen balance. But here we have to think of the neurologic injuries separately. So we have to consider systemic illness as well as the brain myeloid.
The risk-benefit trade-off very nicely addressed by you, Dr. Aiwale. I mean, many aspects that you actually covered in this short answer, I would say, and because very critical to know that. And having said that, Dr. Salvi, is it also the similar kind of case when it comes to bariatric surgeries? Because most thing what people are worried about is of course the surgery, but the post-surgical consequences, and how are you going to maintain nutrition? And for you also, it's one thing of worry, right? Because the right nutrients have to be given and have to be assimilated. So how do you address this this whole thing with your patients?
Good evening, first of all, everyone. Dr. I think it is actually my pleasure to see you, and I'm definitely going to give you a call after the session. It's been long that we haven't chatted over the phone.
I am going to do a conference call with you.
Yes, 100%. So, talking about bariatric surgery, one thing, I mean, everybody would agree to the same, that as Indians, if you see the patients what we cater to, none of the patients are serious about the nutritional aspects. They never believe that the nutrition should be adequate enough. Commonest example, if you talk about B12 and D3 also, you see how many patients they voluntarily go and do their B12 and D3. No one. First, the cost of B12 and D3 is pretty expensive. This is what I usually hear too. But also there's a myth that patient who eats non-vegetarian food, they feel there are sufficient stores of B12. But that is not the case. That's not the case. Because after analyzing so many patients, I realized that nutrition is one aspect where nobody is even taking good care of. What I do for all my patients who come to the OPD, I get their body fat analysis done before they see me. So they have a printed copy in their hand wherein they know what is their skeletal muscle mass, they know how much is their visceral fat, they also know how much is the fat percentage. That is what the patient gets taken up when everything is printed on paper. How much ever we talk, how much ever we tell them that, yeah, you need to do this, you need to do that, they never believe to that. So the analysis report gives an entire detailed analysis of the entire skeletal muscle mass. And I've seen that irrespective of the patient being vegetarian, non-vegetarian, the skeletal, like what Dr. Sir was also talking about, sarcopenia. skeletal muscle mass, irrespective of vegetarian status or non-vegetarian status, the protein deficiencies will definitely be there until and unless you are taking at least 1 kg per body weight of your protein, which is pretty high as compared to Indians, what we are never used to taking that much of protein. Now, for patients specifically for bariatric surgery, when we talk about, if we start good, the end results are always good. If the patient is deficient, highly deficient before the surgery, the post-op protocol will always be very disastrous. So what I do is I give at least 2 weeks time for any patient to be optimized before I take up for the surgery. 2 weeks before we plan it, and it's not an emergency surgery, it's always a planned surgery. So 2 weeks before I get all the blood investigation done, get all the workup done, I understand how much proteins they are taking. My dietitian is always with me whenever I see a patient in the OPD, so that all the aspects are taken care of. We start them on a very good diet pre-operatively also, and we make sure that that much of nutrients these patients are going to take, because if they are used to taking this multivitamins or some kind of nutrients before the surgery, it's easy for them to continue post-surgery also. So for that matter, if a patient is undergoing a bypass, it becomes mandatory that these patients are going to be needing supplement for a long period of time as compared to only a sleeve gastrectomy. So 100% it plays a vital role. I have even had patients, so what I see is more than 80% of the patients are deficient in their B12 and D3, the basic thing. Talking rest to the next level, but these basic things are also deficient. So I see that these patients are given a shot of B12, they are on D3, preoperatively we optimize them and then we take up for surgery. And yes, we definitely have better results if the patients are nutritionally completely, at least started on some good supplements. Yes, it makes a difference for sure.
So one immediate question right after that is, which is something which I believe in, and of course, firstly I'll ask Dr. Prashant and then of course Dr. Albert also to opine. But the fact that you said proteins have to be given, so is it a good idea to sort of combine a good protein with decent fiber content, which is more prebiotic, having it to be sugar free and having the good vitamins and minerals that are essential ones, at least the 25, 26 which are needed to be combined together, so that the compliance sort of improves in this patients, and also if it's done under guided advice, and if we also try to make sure that the digestion is proper, because like you said, as we give high protein and then if we combine it with enzymes or so that is that a good idea to have a comprehensive approach in giving a protein supplement?
No, 100% it is a good advice, because see what happens is when a patient undergoes any kind of bariatric procedure, maybe any kind of weight loss procedure also, so there's always a 2% chance that these patients are going to lose their mass along as and when they start losing their weight. It is mandatory that these patients are going to be losing muscle mass. Now, to avoid that sarcopenia state, or maybe to avoid that kind of muscle mass loss, we need to give them good amount of protein. Now, proteins, when I say there are n number of proteins which are available in the market, I don't usually advise these patients to go and buy proteins on their own. I recommend specific protein, and that proteins are on a guided basis also. We also get their periodic creatinine level done, so that we don't overboard them with the protein, because the body is not used to taking that much of protein. But yes, we need to give them good amount of protein. Plus, we have to also monitor them. Now, when we talk about proteins, fiber, yes, plays a vital role, because post the bypasses, especially one anastomosis gastric bypass or a Roux-en-Y gastric bypass, these patients can land up having constipation because the size of the stomach is too small. So hydration itself is an issue, a challenge when we start them on the diet on the first day itself. So what about 1 liter, or they not even able to take 30 or 40 ml on the first day? So we make sure that when they take their liquids properly, we also make sure that proteins are to be taken. You would be surprised when I say to patients that you can skip your other meals, but you take your proteins, and that is more than enough. So water and protein, these are the only 2 things you take, and I'll be more than happy. So yes, makes a lot of difference. Good amount of protein with fiber, sugar free. Yes, it's very, very, very important.
Yes. So Dr. Ashish has also been using a lot of this in his patients, so to in fact improve the post-surgical outcomes. Dr. Albert, what are your suggestions and recommendations for us?
I would put it at most of the surgeons would agree that there is a common dictum that protein khayega to vajan badh jayega. This is the commonest thing that patients tell us. And I have to really convince them that it is not that, it's your carbs and your, so in my post-op protocol, as Rajeshri knows, we completely get off the patients from these irritants in the abdomen. I tell them, see, most of the patients that we deal are somewhere seropositive or seronegatively rheumatoid. Most of them have inflammatory issues in the joints, and that's the reason they come for these arthritic elements. So I get them off wheat first. I always prefer some natural raw proteins. Might be that is my individual opinion. I supplement them with raw eggs because I've read a lot of papers in the West that raw eggs definitely have a lot of amino acids. Normally, commercially available branch and amino acids are only 2, but egg gives you 9. Proteins also are absorbed well. So these patients do well if they absorb it well. Second thing, it has to be supplemented. Only taking proteins won't help the muscle to grow the sarcopenia. So you have to give them resistance training. So we start them on something called as closed chain exercises. Might be from the first week. Utilization of the proteins also is important along with the absorption. If you don't utilize them, it's going to have creatine issues and that stuff. Secondly, I also sell Rajeshri's products. We also give them collagen 1 and the collagen 2. If you don't supplement that, and only proteins are not going to build up muscles because they need collagen also. So luckily, your product, the Flexi Food, has the collagen 2. It also has this anti-inflammatory agents with the omega-3, and I have a lot of belief in curcumin because a lot of my rheumatoid patients have definitely benefited with it. So that is one thing I add to. There are certain patients whom we ask the history about lactose. As I've read, and Prashant must be knowing more, I guess 40 to 50% of Asian and sub-Asian subcontinent people are lactose intolerant. And I've seen a lot of people getting benefited when I stop direct milk. I ask them to take lactose-free milk. Definitely, lactose goes off when milk products are concerned, but milk and wheat is one thing which I really avoid, because that is one thing when the gut is normal, their muscle, the arthritis in the muscles and the joint inflammation always comes down. That is one thing I'm very, very particular, and I add supplements of collagen and definitely resistance exercises. You can't just rely on proteins to make the man or woman fit, because it is going to go waste in your stools. Enzymes, you guys are more, Prashant, and you guys are more into it. What enzymes work, fiber, definitely. But utilization of proteins is one thing as orthopedics we would advise for the sports people. And more to it, add collagen. That is one thing which should be added, because collagen is one thing very few products. Most of them give collagen 1. That doesn't help. We want collagen 1 and 2. We really don't know what is the absorption, how much it works, but definitely we are seeing results when these kind of integrated and collective supplements are given.
So, to me, enzymes are very underutilized, but this is an area where a lot of clinical trials need to be done. So, to prove the outcomes that I am actually seeing in many of my patients, I see them in post-surgical patients very evidently when they're looking at recovery. We are looking at neurological patients, frail elderly patients, where they're eating, but their digestion and assimilation is not good. Then there are constipation issues majorly. All of these sort of get addressed very well. In the earlier gastro panel also, we discussed about this. But Dr. Aiwale, you own such a fabulous setup at the Solaris Hospital, which is of course a neurosurgery, neurology setup, and many other streams. So one concern which we see is in the ICU management of the patients, because it's difficult to sort of give them the right foods, and all of them are, they're not going to get used to the kind of hospital food they're eating, soft diets, etc. What is the is there a role for nutraceuticals here? And secondly, also there's a lot of inflammation that is seen in the elderly patients. Is there anything that you prefer in terms of nutrients or nutraceuticals that you use?
Yeah. So, as I said, that systemic inflammation and neurologic injury, obviously they are somehow related because of your hypothalamic pituitary axis, vagus now, and then the gut microbiome. So I think that way, gut microbiome is a very important part to have the mucosal barrier, cell defense mechanisms, prevent bacterial translocations in these morbid states. In our neurologic ailments per se, many of the degenerative illnesses or the encephalitic illnesses, they have this involvement of HPA axis through vagus and gut microbiome. So I think this use of probiotics with probiotic fiber, I think that helps in our most of the acute neurologic injuries like serious encephalitic illnesses, autoimmune encephalitis, where we often get affection of these things, along with obviously the protein requirement. And just to mention why neurologic states are very different, because brain is just 2 to 3% of your body weight, but it consumes 25% of the glucose in the body. So that is the disproportionate energy expenditure required by brain. And when in your hypercatabolic state or pro-inflammatory state, this increases almost 200%. So most of the stroke, which were large strokes, you have subarachnoid hemorrhages. There we require to focus on the protein requirement, which can be doubled from, it has to be gradually doubled. Initial few days, the requirement is a baseline, but it has to be gradually doubled over a period of week. Or if not done appropriately, along with this probiotic support, micronutrient we talked about in our subarachnoid hemorrhage, magnesium does well. Vitamin C helps in our perilesional edemas. So this have to be gradually imbibed in our formulas. And because these patients stay for prolonged periods, like supposedly a traumatic brain injury, even if the acute insult has been managed, they are in a hypercatabolic state for more than a month or so. And by then you can have both muscle mass loss, your cellular immune mechanism also gets affected. So definitely a proper combination of proteins, probiotics, and micronutrients. Yes, that is required in such cases.
So Rashi, are you muted?
Muted, Rajeshri.
Muted.
I'm so sorry about it. So, so I think what I was trying to ask is also then is a personalized approach, necessary in guiding these patients with their nutrition plans, and that way, and what nutraceuticals sort of should be given to these patients. What is your view, Dr. Ayapalli?
So basically, the requirements are different. The patient personas, demographics are different. You have various, as I said, young patients respond differently. Geriatric patients with decreased muscle mass respond differently. You have to give sedation. You are paralyzing the patients when on ventilator, and sometimes antibiotics. So these things are taken into consideration. Supposedly, you have to have a patient is in shock. You have to give vasopressors. There can be a possibility where there is gut slowing, GI transit is slow, and in that case, you have to think of what you can say, hold the feeding, and there could be an overfeeding. So again, there is as we were talking, that Indian mentality where you have more intake is good. So I think even giving excessive proteins or in excess requirement of calories during hypercatabolic states will also be what you can say, impairing the mitochondrial function, and that can lead to you can have what you can say, the inflammatory cascade worsens because of that, and inflammatory injury worsens. So it has to be balanced. that it should not be an overfeeding, and neither it should be. So it has to be frequently monitored because the stage is different. The first day is different, seventh day is different, and 4 weeks later, the situation is different.
So before we actually, so this is again a lot of inputs, Dr. Aivale, for us, and I think the nutrition fraternity and the industry also really needs to gain and understand all these deeper aspects. Before we go on to the fitness aspects with Dr. Albert, I quickly, on the same note of personalization, I would like to ask Dr. Salvi, how important is it, right? Because you're not only focusing on bariatric surgeries, but also obesity management. Every patient doesn't have to go undergo bariatric surgery, and there are other procedures that you do. So how important is it, to personalize the approach in terms of your medical treatment, surgical treatment, at the same time, giving nutrition equal amount of, weightage and integrating all of it?
Yeah, so I rightly said by you, 10% of my patients who come to my OPD require, most of them, they do not require surgery.
Your voice is breaking.
I think it's your internet is.
Yeah, his internet is a bit.
We couldn't hear you. Internet issue.
Yeah. We can, but your voice is still breaking. Maybe you can re-log in, I think. So,
Hello?
yeah, you're better. Yeah, you're definitely.
Yeah, so I rightly said what I was saying is the 10% of the patients who come to my OPD require surgery. Rest of the patients do not require surgery. And for these patients, yes, an integrated approach is very well important. It's not just about surgery. When we even put a balloon or we give them some dietary counseling, the active role is played by the number of micronutrients or the micro and the macronutrients which we tell them to take into consideration. Because these patients can end up having thiamine deficiencies, that is B1. They can have copper, zinc deficiencies also, magnesium deficiencies also. So, taken into consideration everything, we have to be very, very selective, and we have to be very, very open about telling these patients to abide by the nutrition, what we tell them to take. And with the help of that, we will be able to manage a lot of deficiencies which would be put forward. When we decrease the diet, or maybe because of surgery or without surgery, it's time to decrease the diet, the amount of deficiencies will increase, because our diet is that way not very rich in all the supplements what a normal healthy diet it should be. We never have that kind of diet. I mean, I hardly see some patient talking about a proper healthy food, proteins, fibers, vegetables, and even fats in the diet, which is not there. It is not seen. So when we see these kind of patients, we make really a great effort of understanding how much protein they are taking, how much carbs, how much fiber they are taking, and how much is the fat in the diet. Based on that, we give them supplements also. Based on that, we tell them to increase their fiber. But at the end of the day, how much of a protein, like Dr. Ashish Sarvas sir also said, that activity we really stress upon. Post surgery also, it is not just the surgery that makes the difference. The patient has to go on a routine exercise pattern. A minimum of 45 minutes walk every day is also more than enough. By the good. That's how.
Your voice is breaking again.
Oh, sorry.
No problem. So, no, still breaking. So, meanwhile, till he corrects his connection, I think, Dr. Albert, here there are 2-3 major questions, and in the morning also we had an orthopedic panel which was more on a preventive front. The idea, I mean, of course, obese patients land up with you. They go through these surgeries, critical ones, and then post-surgically also they need to manage. So this whole scenario, because ultimately that is what patients look at, right? They get operated with you and they have to be happy thereafter. It's not just like then and there, but thereafter. So how important it is for you to, you and your team to sort of follow up with them, and when patients come for follow up, what is the sort of guidance you give them, and this, and of course, in terms of, because you're yourself very fit and you guide a lot of us to how to stay fit. So what do you actually do with these patients? How do you guide?
We always believed in a teamwork, and we always have an integrated approach to the pre and the post operative and peri-operative time, because for us, and even to Dr. Deepak, and even I think Prashant, the patient is there for life, because once you get an orthopedic patient, unless like a trauma or fine, but most of these replacement patients are there for your life. So the question that you ask is follow-up. Follow-up is till we are working, we have to follow up the patient, at least for the first year. So we definitely, in the peri-operative area, peri-operative zone, in the pre-operative phase, we have an array of investigations, where we also definitely check the BMI. We have now this robotic softwares and all, where we check the quality of the bones, and a lot of stuff where we see the muscles, the sarcopenia and that and stuff. Definitely, we also ask the patient to get his BMI and all done in the OPD, where in obese patients, what we have seen is point one, healing issues, because there is something called as fat necrosis that they get in and around the joints and the suture lines. And secondly is they have a lot of varicose veins, obesity related issues like sleep apnea syndrome. Obesity itself is a disease, and how do you define obesity becomes a big question, because that I'll ask Prashant, that how do you define obesity? So for example, I hope Prashant is back and you're hearing me. So Prashant, I had a question. I keep on asking. Dr. Todkar works with me, and your couple of colleagues are there in Jangir, and they work with us. And I keep on asking, sir, like it's a guy like Arnold or John Ibrahim comes, and the BMI is very high. Akshay Kumar is weighing 120 kilos. Do you label him as obese? And or there is some new definition that you have got, that is a fat content in the body or visceral fat. How do you define an obesity? Is it just the BMI? So I think
No, this connection is very bad today.
We were going for this thing again, the rehab. What we are doing, Rajashri, is we are giving intra OPD something known as adductor canal blocks under sonography. And in that, what we do is we give blocks for relieving the pain. Out of 10, 8 patients are obese females. There are hardly patients who are good muscular who need this kind of post-operative blocks for pain management, the pain management overall, the medicine requirements, skin healing issues, mostly are there in our obese patients. Definitely, we have started something called as a prehab now, where we give these obese patients some, if it is a knee problem, we give them some prehab for a week or something, and then we get them for the OR. Again, I have seen is these kind of patients end up in a lot of skin related issues in coming time, and definitely they lag behind the regular muscular patient by 6 to 8 weeks in terms of being that happy, getting the full benefit of the good surgery. So that 2 to 3 months of at least 2 months of their extra efforts is because of they have not taken care of their body mass and that muscle this thing, and we have to add a lot of post-operative efforts for these kind of patients, because they end up in what happens is their glutes are very weak, so walking becomes an issue. They have issues during the physiotherapy sessions, and skin is one thing which we have seen almost 60% of the patients might need a suture here or there, because almost all the patients nowadays we are doing we are using skin sutures and all. But in obese patients, I have to take skin sutures or staplers Although regular, we are using glues and no stitch removals and all, but in obese patients, we can't take that chance. So I was asking one question to Prashant is obesity. In at least what we know is you define with the body mass and this and that, but a mesomorph comes to you and a huge guy, so he's MMF or he's some John Ibrahim kind of person. So do you still call these kind of patients obese in your terms? So how do you define obesity?
So if you see, so it is definitely
something wrong with the mic. I think something wrong with your mic, probably.
Directly use the computer.
Yeah, I think use a laptop.
I feel it's an.
Yeah,
so that is
yeah, perfect now. Yeah.
Because in this panel discussion, if we two things which even I could like, how much, like say, there's a hypercatabolic phase, and how much protein, who decides how much to give, and what is enough for the patient and not? Does this create levels tell us that? I don't think so. There are no parameters. See, what happens is you nutritional guys tell us to give nutrition, but say like we have parameters in the path that this is the parameter. There is no parameter for nutrition. So there's a lot of work need to be done, and because surgeons are dependent on the post-operative results, you are as good as your skin, you are as good as your pain. So nutrition has to work as an industry also to tell us how much is enough, what formulas to be given.
Yes. So there is this major trade-off. What you're saying is right, absolute. On one end, we complain that nutrition is not used, and on the other hand, we have to work hand in glove with you all to actually give the right amount and
right amount. Example for our kind of situation, 60,000 international units, a paper comes per month. Then other paper comes down is you give 60,000 international units vitamin D per week. Then no, somebody comes and tells us 6,000 international units per day. So there is no consensus as to the overall nutritional zone, what is optimal.
Yes.
Because everything is a range, like thyroid is a range. So clinically, if the patient is, at least we have a range. There is no range, how much proteins to give, how to define a body mass, because these are all indexes. Because how to rely on that becomes. Prashant, are you?
Yeah,
are
I
you,
mean, am I audible?
I asked, do you define Arnold with 180 pounds or say 280 pounds obese person?
So what I was talking about is the BMI. If the patient's BMI, as World Health Organization has defined BMI as 18 to 25, and as your BMI increases, as one goes above 30, then you are above overweight category, and there are different classes of obesity: class 1, class 2, class 3, and above 50, it is super obese category. So also we take into consideration the waist circumference, which is also very important for these patients. If so on the body fat analysis, we have weight, the skeletal muscle mass, and the fat in kgs. If those three lines, if make an eye, like everything is in the same point, then it is healthy. If you see that the muscle mass is gone down and the bar is making a C form, kind of a C form, then it is not that healthy, because the fat is going up, the weight is going up. If the patient's muscle mass is more and the fat percentage or the fat in kgs is less and even the weight is less, that it forms a D, that's a healthy patient. Now, if the patient's weight is also more than 100, but the muscle mass is quite better as compared to his fat in kgs, yes, it's an healthy person. And which I very rarely see. I mean, that can be seen only when patients who go to gym every day or they have a very well-built patients, and so those patients don't come to me because.
So I'm just asking the theoretical aspect, because a lot of your cases depend on the BMI, because these guys are going to have a huge BMI. Huge. Not only big, huge. Because we are seeing this
63 BMI, we have done patients for 60 and 63 BMI as well.
So unfortunately, I will have to cut you guys because, but I want to promise from both of you, and I'm promising you all that, very valid point which Dr. Albert has raised is in terms of how much is right and how much is going to be effective. These are very, very gray areas and gray zones, even in terms of the question that you asked about the BMI and rather how do you determine if a patient is obese, overweight, or if he's healthy?
And
Even
no,
that,
Rajesh,
all these
he's
parameters.
that I am in Central Pune, he is in Thane.
Yes.
Patients come and ask, doc, see this paper. I'm taking vitamin D every week. Okay, the second
Yes.
patient, all corporate. My 98% practice is corporate clients, and I'm in those institutes, but
Yes.
I have no answers.
So with
All
that,
there on
we,
Google, and then I have no
we
answer, because you have to tell us this, because this forum has to give us.
we will sort of
all
end this panel with this point, and with making a promise that we will to come together again.
How much?
And I think, Dr. Sardi, we need your inputs. Dr. Aivala,
Yes.
your inputs are very important as well. I think we all need to come together and start making observations, utilizing, working as a team to determine sort of what is the right approach, what is the right quantity. And it is going to be a great amount of trial and error, and also doing a lot of evidence building along this side, instead of just trying to use the data which is there in the Western papers. So I think, Dr. Albert, you are really leaving us on a very evident point. So point taken, and which is, I think, one more very important thing that came out of today's whole event. This whole event itself, the objective is this: to how do we bring about the integration, and how do we integrate nutrition instead of deliberating what is right, wrong. We all start working towards the right. So I'm sorry I have to cut you, but time was really short today, and with three of you, I'm sure we are going to do a next session just explicitly with three of you.
We have a
I
separate
promise
session.
that to you. I promise
I'm
you
so
that.
sorry.
Definitely.
So sorry for my technical glitches why I'm having today.
So nice,
Yes.
Rajeshri, all the best.
Sorry about
And
that. Yeah.
see you soon.
Thank you so much for joining in, and Dr.
When I
Albert.
come down, I'll see
Thank
you
you
there.
so much for
Right.
always supporting Dr. Albert, and Dr. Aivala and Dr. Sarvi. Thank you very much for joining in.
Thank you. Thank you. Have a nice day.
I will have to move on to the next very important session again, and I hope Dr. Albert and Dr. Sarvi and can stick around, because this is a session which is, I would say, another father after Dr. Sesikeran that I know in this industry, and he talking about nutraceuticals is something I take it sort of a gospel truth, or inspiration to take our thinking forward. And the topic, of course, is nutraceuticals product success vis-a-vis the regulatory considerations, research, clinical trials, and more. Really, the science behind the product success and what all one has to go through. Who other but Dr. R.K. Sanghi can actually throw light and enlighten us about what really needs to be understood from nutraceutical as a science itself, and how we can use it as medicine. So Dr. Sanghi is a senior consulting physician himself, with more than 4 decades of practice himself with patients, having worked with the pharmaceutical industry for 40 years, assisted over 100 such companies in medical marketing, technical, legal, training, product information dissemination, regulatory, OTC, so many aspects that he has dealt with when it comes to health, nutrition, nutraceuticals, closely involved in nutraceutical segment since 35 years, pioneered the same in India, absolutely. And I associate with him and my dad as the as both partners in crime when it comes to bringing nutraceuticals and bringing them to light and bringing them to use to the end consumer and benefiting them. So it is absolute pleasure to have him here. He has spoken at nearly tons of CMEs actually that he has done, that we know. He has addressed doctors across countries. He's been evidently, and which is where he played a great role, being the chairman of the medical committee of the Indian Drug Manufacturers Association, IDMA. He started the nutraceutical committee itself in the IDMA, headed it, helped the industry, helped the FSSAI, and build that ecosystem really where nutraceuticals could get the importance and thrive. And it is an absolute responsibility to sort of take his work forward when it comes to it. And all that is done, he's going to really share that with us today. And Dr. Sagvi, it is always a pleasure to talk to you, to listen to you. This program couldn't have, I can't say it cannot complete without you having you here. And it's our first online conference that, or rather summit that we've really started. And your blessings and your inputs will really take it forward. So the stage is over to you, sir.
Thanks, Rajesh.
You'll just have to one device. You'll have to just put your volume off. The phone volume off. Is it better now? Yeah, I think it is better. Have you logged in through 2 devices, sir? If the second device is in the same room, you've logged in from 2 devices? So you have another phone that you're logged in from? Just mute that.
I haven't.
So try unmuting yourself and now speaking.
No.
Yes, now it's
Yeah?
perfect.
Okay.
Yeah.
So sorry for the glitch.
No worries. Go ahead.
I think it's really nice to talk on the platform of Energia because Mr. Gadgil and we started off in the nutraceutical committee. When we first formed it, he was one of the person who was there with us always. He, Mr. Kamath, and we were always there. And that's how the whole nutraceutical environment in the country had changed after that. We had a lot of initial hiccups and all that in the regulatory issues. But because of the backing of whatever Mr. Gadgil informed us, and we had a very strong nutraceutical committee, so we were able to do a lot of mileage into this segment. And that's how you see so many products available, so many startups there. And the nutraceutical is itself a very, very important segment as far as healthcare is concerned. Now, can I just share my slides if it's okay?
Yes, absolutely.
Or can I email the slides to you and you can help me share it?
Sure. Is the share button not working, sir?
I don't know. It's not.
Okay.
Okay. I'll do one thing. I'll email the slides to you.
Yes, sure.
So I've been listening to all these speakers over the last 1 hour or so. I already sent the slides to you, and whatever I have been listening, basically, what has happened with the medical profession and the dietitians, we are more focused on nutrition. We are focused on vitamins, minerals, and maybe amino acids, etc.
Yes.
Nutraceutical is a different ballgame altogether. We have an issue as far as nutraceutical understanding is concerned because there is no such, what do you call, a course, or we don't have all these products in the pharmacology whenever we have, done our basic medical graduation. So the understanding of nutraceuticals is definitely bound to be very, very less or minuscule as far as the medical profession is concerned. Now, being in this line,
So I'm glad you say that, because I think that is the whole crux of having this kind of a summit, and that's the reason why we had to have you here to very very vocally say this, and because you've lived through it, so who other than you can actually opine on it?
I had given.
Go ahead, sir.
I had given
I'm trying to download your slides.
To 200, 250 lectures to all the specialists in various cities, maybe cardiologists, diabetologists, psychiatrists, dermatologists, I mean, you name it. And 50, 100 doctors, including professor, head of departments. So when you talk to them, they are not aware of all these options available in their particular armamentarium. And what happens is, because we are not aware of the basic nitty-gritties and the basic pathophysiology and the biochemistry as doctors, because that becomes a secondary issue for us. We are more in the clinical. So we are not able to understand how these products are so good and how they could help the patients in so many problems where allopathy has no answers. Say, for example, if you can just put up the slides. So the word nutraceutical.
Waiting for the slides. Yeah, I haven't received them yet.
I've sent it. You got it? You must have got it.
No.
So the first thing I can tell you is the word nutraceutical.
Yeah.
The first product which came was a cod liver oil, which came in the year 1855. And this word, actually, nutraceutical, was coined in 1989 by Dr. Stephen. He is a person who is supposed to be the father of nutraceuticals. And actually, it was in 1989 that the nutraceutical products started being launched in our country, in India. Fortunately for me, and that was the year I joined one of the companies where we focus only on nutraceutical products. That is the Seven Seas Cod Liver Oil marketing company. And that is how we were able to, launch an array of nutraceuticals, and I was fortunate to be associated with them. You got it?
No. So, sir, can I help you for a minute, and can you share the slides from your computer?
Yeah.
Are you on a Mac or a
Mac?
Do you see a share button at the bottom?
Yeah, I do.
Green color.
Yeah.
Just click on it. And
I click on it.
can you see windows where your PowerPoint is open? Just double click on that PowerPoint.
I know, I'm not able to see that. That's the problem. That's what I'm wondering.
Is your PowerPoint open?
My PowerPoint is open.
Then try sharing the screen and then go to the PowerPoint. What do you see when you share screen?
I just see all blank, whatever you call it, I'm not able to see that. That's the issue. Your email ID is the same thing, no? I have sent you already.
Okay, let me.
You have received it. You have received it.
I confirm it there.
I just Gmail.
Yes, I'm just sending you a test. Please send me the thing there.
Yeah.
Just sending you a test. Right?
Where is it?
I received the slides. I've just got them.
Got them?
I
Okay,
download them. Yes. Perfect. I download them. Yeah.
okay.
You can
So what
continue speaking, sir.
So what I was saying is the word nutraceutical, which is there, actually is a word which comes from two places, nutrition plus pharmaceutical. So this is a particular segment where we know about all these ingredients in a similar way like we know in pharmaceuticals. We know the mechanism of action, we know the kinetics, that is the blood levels, we know what are the quantities that should be given. We also know the side effects and etc. They are all documented, and we are also aware about clinical trials being done with them. Now, all the panelists and a lot of doctors, when we interact with nutraceutical, they want a clinical trial. Let us understand one thing, nutraceutical, we cannot get outcomes on clinical trial. So whatever clinical trials you are seeing, and there is debatable results being shown, is because you are doing a trial on two nutraceuticals evolve over a period of time. It's an epidemiological study-based science, just like you have in Ayurveda. Now, Ayurveda is 5,000 years old. Nutraceutical is approximately 85 years old. So you have this particular data evolved, like say omega-3 fatty acids. The story came from Eskimos. They studied the diet pattern of Eskimos and found they had no problem of heart, no problem of diabetes, no problem of inflammatory skin diseases, no problem of epilepsy. And when the same Eskimos went and stayed in Canada or in US, they were as much prone to all these NCDs as any other citizen of that country. So the diet was then responsible for the protection. And that's how the omega-3 fatty acids were discovered. And the mechanisms today are also there. So this is how the whole particular science has evolved. Now we also have, as alternative, being Indians, we are exposed to Ayurveda, we are exposed to Unani, we are exposed to Siddha and homeopathy. So we have so many alternatives available to us. But according to what I think is because being a medical doctor, being an allopathic doctor, whatever we have seen, the data available is much more for nutraceutical as compared to any of other alternative medicines. Yeah. You can go to the next slide. Yeah, the next slide. So this is what I was saying. The launch of the products in India was in the same year when this particular word was coined, that is nutraceuticals. Next slide. So nutraceutical is nutrition plus pharmaceuticals. Next slide. So compared to all these particular alternatives available, nutraceutical are the best documented in terms of scientific data. And that is why when I could give a lecture, maybe 250 lectures to so many specialists and head of departments, I could answer each and every query of 50, 100 doctors sitting across. And it was not very difficult to tackle things on how they were, clinical issues, etc. The one thing which is very important as far as nutraceutical is concerned is this is meant for those problems where allopathy has no answers. I would never write a nutraceutical for reducing lipids or cholesterol because being an allopathic doctor, we have statins. So there are a lot of issues where we have nothing to offer. And these are the areas where we could look into nutraceutical as one sort of an option to try and get some maximum benefit for our patients. I'm also a practicing doctor, so we do a lot of things, and we also know that there are problems as far as diabetic neuropathy is concerned. There are problems as far as osteoarthritis is concerned. So we only have symptomatic approaches. So we could look into all these alternatives available. Next one. You can have a nutraceutical for most of the systems of the body. And we have so many problems in every system of the body where we put our hands up. We, by and large, give symptomatic or we do not know much what to do. So let's take system-wise, and I'll just give you glaringly some few examples to make you understand how these products have a massive, massive scope in our day-to-day practice. Yeah. Next slide. Yeah, next slide. So for diarrhea, now you know that everybody has got ORS which puts zinc into it nowadays, because zinc has got antiviral effect. The problem is that you have zinc sulfate in 99% of these products. Now to get antiviral effect, if you put zinc sulfate, the antiviral efficacy is 0. Zinc acetate, suppose there is an index called ZIA, zinc ionic activity. This is 100 for zinc acetate, 30 to 70 for gluconate, and 0 for sulfate. So we do not know all these basics, and all the companies also, a lot of problems are there, and doctors cannot question them because these basics have not been known to us. Next one. So for constipation, we have fiber, so that everybody knows. I don't want to go into detail of fiber. Next one. Liver. The most important thing is that for hepatitis, we give so many Ayurvedic products and we are happy with so many Ayurvedic products. The reason behind this is that most of the hepatitis which are viral are type A, and 95% of type A hepatitis are going to be all right whether we give anything or not. So the product, whether it is brand A or brand B or brand C or brand D in Ayurveda, it doesn't matter, because patients are going to be all right. And that 5% whoever have a chronic complication or unfortunately they pass away, we say maybe they are severe and maybe God willing, whatever it is. You know, we are all God-fearing people and all that. That is how we put it across. But if you look at phospholipids, these are the ones which are the best for hepatitis, because these are the ones which will truly give you results in chronic hepatitis. So let all those Ayurvedic products be tried and tested in chronic hepatitis and see the parameters going back to normal or not. But the phospholipids are the best as far as hepatitis is concerned. Next one, and also the far as cirrhosis is concerned. I had a patient who had cirrhosis and referred the patient to a gastroenterologist. The gastroenterologist told me that let this patient, cirrhosis, alcoholic guy from the age of 13, 65-year-old male. So the patient was said that better you go to your village and, whatever, have the rest of your life, enjoy it. And then the wife was crying, and then I gave her the phospholipids, full dose, 2 grams of essential phospholipids. And surprisingly, there was 10 capsule dose per day. And I told them, you better take 10 capsules, because that time the concentration per capsule was very less, which was marketed. Surprisingly, the patient lived. The parameters became better. It was nearly 1.5 years the patient lived. So this is how it works. Next slide. As far as heart is concerned, in heart, the heart failure, when you look at the 2D echo, 67% being the normal ejection fraction. As far as aging is concerned, the fraction goes down to 60% or maybe a little less, close to 55%. And when we go with a 2D echo report to any doctor, and by and large they say, no, it's as per aging, this is going to go down. Why should it go down? The muscles are not doing proper work. You have mostly a diastolic dysfunction. And coenzyme Q10 is one of the best possible support for the heart muscles. And we have a lot of articles on this. We have 233, now today we have about 900 articles on this and 300 studies on this particular product. This was done long back, about 12 years back I've done this. Yeah, next one. We all know the power of omega-3 fatty acids. They're one of the best as far as any part of the body is concerned, wherever there is inflammation. So today, atherosclerosis is supposed to be an inflammatory disease. The beginning of atherosclerosis is the damage to the internal lining of the arteries. So the tunica intima, it is damaged because of free radicals or because of nicotine or because of pressure or because of viscosity or because of stress, adrenaline. And that is the beginning of atherosclerosis. So the beginning of atherosclerosis, if you want to curb the process itself, omega-3 fatty acids are the best to prevent. And they say that if you give omega-3 fatty acids in a child who can start swallowing the capsules, when the child reaches the age of 40 or 45, the arteries will be as clean as a football ground. That's how omega-3 will work. Next slide. We have no actually much hope for patients who have eczema, psoriasis, and by and large, what is resorted to are maybe immunosuppressants for psoriasis and steroids in early stages of both the problems. Omega-3 fatty acids can do miracles for this, especially in eczema. So I had a patient who had this particular eczema, and that son was having this eczema, and the mother is saying the son doesn't like to go to the school, because everybody is, the teacher, etc., said it looks ugly. So they used to avoid, being close to him. And when I saw this patient and then I started giving this particular omega-3, complete clearance of that child. And today he's a big man owning a cafe and etc. and is doing very well for himself. Skin wrinkles, antioxidants. Today, free radicals are the ones which are responsible for 80% of the aging-related problems in our lives. Whether it's osteoarthritis or it is skin wrinkles, or whether it is atherosclerosis, or whether it is memory, or whether it is little deafness, it is all because of free radicals. Free radicals, if we want to counter them, we should start countering them right from the age of 25 with antioxidants. The age 25 to 30 is a time when our aging process starts. We may not see the effects of aging process at that particular period, but this is the time when the process starts and we start seeing the problems by the time we reach 40, 45, 50, 60, depending on individual to individual. And if we want that we don't have the aging-related issues which everybody normally has, antioxidants are one of the best to start with at that age. There is no point in people who are doing pretty okay in life, who are not economically having a problem as far as below poverty line, etc. You don't require vitamins and minerals for yourself. You require antioxidants. And God has given us antioxidants in our body. There are 3 enzymes and 3 vitamins, vitamin C, carotenes, and vitamin E. And enzymes are 3, for which you require 4 minerals. You require selenium, we require copper, we require manganese, and we require zinc. So these 7 antioxidants in the right quantities, once we take, we are able to tackle free radicals and the damaging effect, and we'll see that we'll have much healthier living when we start touching 50s and 60s and 70s. Next slide. As far as hair is concerned, we have zinc, saw palmetto. I won't go into that little detail. There are articles for that. Premature graying, pantothenic acid is very important, and I am surprised that as some formula I've seen for premature graying and for baldness where the pantothenic acid itself is missing. But this is also surprising. So we need to look into what are the products content which are there before trying to take that product for a particular problem. Yeah. Next slide. Now, diabetes is one of the biggest things. As we know, we are the capital as far as diabetes is concerned. We are the diabetes capital of the world. And this diabetes is because of insulin resistance. What happens is the insulin, once we eat carbohydrates, the pancreas, when we eat food, the carbohydrates enter the blood. Pancreas get the message there are carbohydrates in blood. So normally a person's blood sugar is approximately less than 110. the blood sugar shoots up. So the insulin comes out by pancreas. Insulin is going to take the carbohydrates to two parts of the body where we require energy. One is the muscle and then the brain. And there are receptors to receive insulin. Now, what is receptors? So we have a key and we put a key in a keyhole. Only when we put the key in the keyhole, that particular lock will open. So this particular insulin will go and sit in a receptor in the muscles and tell the muscles, I've come with glucose, take it for energy. Then the muscle opens the gate and the glucose enters inside. So what is the problem in diabetes? The problem is that this insulin doesn't work properly. It is not sitting in the receptor adequately. It doesn't go inside the receptor and bind inside the receptor. And that is the reason the message doesn't go to the muscle to take up the glucose. So glucose lies in the blood, levels become higher, and we enter into the phase of diabetes. It is very surprising that people start avoiding sugar to prevent diabetes. Sugar eating has nothing to do with diabetes. People avoid eating ice creams at parties, including doctors. They said, I don't want to eat ice cream. I said, why? No, I want to prevent diabetes. I said, why? What's the problem? Diabetes is not because of eating sugar. The person who already has diabetes, which is borderline, who is not getting drugs because he's borderline, he wants to manage it with a lifestyle, he should be away from carbohydrates. Otherwise, diabetes is not caused by sugar. It is caused by insulin resistance. So if you take chromium, chromium is the best product for insulin resistance. It will make that insulin go into the receptor and bind strongly with the receptor. So this particular insulin can convey the message and the glucose can go in. It's like the postman who comes to our house. We do not know he's come to our house unless he rings the bell. If he just comes to the house and goes away, we don't get the message. So he rings the bell, we open the door and receive the post. That is how insulin works. And omega-3 fatty acids are also important because whatever the receptors are there to receive the insulin should be there present at the surface of the cell. So omega-3 fatty acids ensure that. The biggest challenge today is obesity. So it is a global problem. They call it globesity. Why does people become overweight? In fact, even I'm also overweight. Why do you become overweight and why is it difficult to lose weight? Because when we start looking into the obesity, one center is supposed to be called the appetite center, one is a hunger center, and one is a satiety center. Now, when we feel like eating, so we can say, okay, no, I'm on diet and I will not eat so and so. But that appetite center, you can control. But once the hunger center takes over, then you said, hell with everything, whatever is there, you start eating. So now you start eating more. So what is the way that you could have something where you feel full and you don't take in calories? The best is not all those, those mixes that they give you, all this, a lot of people give you those protein mix and those mix and all, obesity mixes that you get. The best is to take soluble fiber. So when you take soluble fiber, it's not that you take the fiber as a routine in a day. You take it when you feel hungry. So once a day you take soluble fiber around 11 o'clock is the time you feel little hungry after your breakfast. Take it. Or in the evening is the time when you want to snack. Take soluble fiber. 0 calories gives you a sense of fullness. So you have no appetite. Your hunger center never takes over. So this is how soluble fiber is one of the best way to take care of obesity. And if you do it, I can assure you that tomorrow, suppose you are eating, say, 2 chapatis every day. You take soluble fiber, you will have space only for 1 chapati. You will not feel like taking the second chapati because you are full. But that is how you slowly reduce your weight. Acai berry is another very fantastic ingredient, not available in our country. but this is the one which increases the metabolism. And that is how, when you take a combination of soluble fiber acai berry, you decrease the intake of calorie and you burn the whatever is the fats that are available. So there is a Brazilian sports, jiu-jitsu. That is the warriors who are taking acai berry over there. And that's how this acai berry originated. Next one. Now, male infertility, coenzyme Q10. So a lot of people are not able to have children because there is a problem with the male factor. Coenzyme Q10 and DHA is very important. Yeah, next one. Next one. For another sexual problem, you have arginine, which is very good. The point is that there are a lot of arginine products and there are a lot of capsules available which are absolutely useless because they put only 100 milligram arginine or 50 milligram arginine. What we require is 3 to 5 grams of arginine to work. And if you don't take that quantity, it is just a placebo. It is just psychological. Safed muesli also, unless you take 3 grams, that is 3000 milligram, you can never put it in a capsule. It has to be in a sachet form. This is one of the best combination to take arginine with safed muesli as far as people who have sexual problem in diabetes, etc. is concerned. Next one. Another thing which we know, menopause is inevitable in females. Now, if you look at menopause, we all know the menopause is because the females have undergoing depletion of estrogens. They were having estrogens right from puberty till around 40, 45. And that time, all the estrogen production starts becoming less and less. And this is the reason why females enter into a lot of complications. One of the complications is, of course, the mood swings. But what is important is when they start getting menopause, at the age of 60 onwards, females get very, very prone to fractures, heart problems, urinary tract infections repeatedly. And this is all preventable. Estrogens are gone. You give natural estrogens, isoflavones. They are available. They are phytoestrogens. And people don't supplement this. This is the right time to supplement in a female around is 35, 40. You start supplementing before the menopause takes over because estrogens levels have started declining. And that is the time you give the natural estrogen. In fact, if somebody takes isoflavones, some female takes isoflavones, she will continue to maintain the skin and the beauty also. Because all the beauty that a female has is because of the estrogens. So once you lose the estrogens, you will start looking old. So for the female herself, if she wants to look as pretty as before, it's better to take. And husband also, if you want the wives to look similar, better to start isoflavones. It is one of the best things to do. Take it lifelong. It is very good. PCOS is a big problem today, and mahoinositol and chiroinositol are the best natural alternatives for them. There are people who are giving various other options, but these are very, very important ways to tackle it. Next one. For repeated urinary tract infection, there are a lot of people who come repeatedly, especially females after the menopause. One of the best things to do is to give cranberry. This cranberry juice can be taken or the cranberry pills can be taken. They are the most important because what happens is whenever the bacteria are present in the female in the urinary tract, this particular bacteria can only cause infection if they go closer to the wall of the ureter and invade. When you take cranberry, this particular bacteria is not allowed to go closer to the wall and they are not allowed to invade the lining of the ureter. So the infection is prevented. For prostate, we have saw palmetto. Good option alternative, but we have so many other drugs available. So I don't normally prescribe saw palmetto. Another important thing which is happening is everybody knows this is a problem mostly in females, that is nocturnal muscle cramp. You get a lot of cramps in the night time. And females are more prone as compared to males. And this particular thing is nocturnal muscle cramp or NMC. The best thing to do is take magnesium regularly. Today, magnesium is going to be a big product. Even to prevent heart problems, today magnesium is required because magnesium is very important to keep the muscles relaxed. Unfortunately, in India, we don't have the magnesium sprays, but if you go overseas, you can buy one of the magnesium sprays and keep it next to your bed so that whenever you get a particular attack of cramp in the night, you can spray that magnesium. All the people who go to the gym for bodybuilding, they actually want a muscle mass. And they take whey protein. And they also take a lot of proteins where whey protein component may be less. They take soya protein or milk protein. Now, whey protein is very expensive. So a lot of powders which are available, they say whey protein mixed with soya protein, but the whey protein component may be only 10%. So you get a little bit, you don't know actually what the quantum of whey protein that you take. But the bottom line is that when you want to build muscles, it is very important to take branch chain amino acid containing protein powders. If you don't take branch chain amino acid, there are 3 amino acids, leucine, lysine, and isoleucine. If you don't take valine, if you don't take these, you will never get the muscle mass. So many cancer patients, because of cancer, you see, they have become very, very thin. They have lost all the muscles. If you want to build the muscles, this is the best thing to do. Give them branch chain amino acids. There are some products which are available, which are highly concentrated, but there are very few of these products available. Next slide. Everybody takes calcium. Calcium is like known to every Tom, Dick, and Harry in the country. Anybody and everybody would be taking calcium. Females especially are being prescribed calcium and everybody takes calcium. But the most important part, which is not known, is the calcium cannot work unless there is vitamin K27 present. What happens is when we take calcium, the calcium enters the blood. The blood takes the calcium to the bone, but the bone has to take up the calcium from the blood. Now, if we are going to have food and somebody is going to put in front of us the thali or some dish, that food cannot enter unless we pick up the food from that dish plate and put it into our mouth. So vitamin K27 is something like gives hands to the bone so they can pick up the calcium from the blood, and that is how you are able to get this. So vitamin K27 is most important. Next one. Cissus quadrangular is also very good for fractures. Yeah. For joints, we all know glucosamine chondroitin, and there is something called type 2 collagen available. Everybody should understand there is type 2 collagen which is required. For rheumatoid arthritis, these are the Boswellia, etc. are known. So I won't go into that. Yeah. For brain, dyslexia. Dyslexia is an issue. It is not uncommon. And DHA is very important. DHA means docosahexaenoic acid. It is a type of omega-3 fatty acids. Today, DHA has become very important for pregnancy. The problem is that most of the powders or all the powders, like brands which are available, they put DHA, but they don't put the right quantum. The most quantum I've seen per day is 80 milligram, and WHO says you require 200 milligram. Most of the products are giving 8 milligram, 10 milligram, 12 milligram, 18 milligram, 28 milligram. And if you don't take 200 milligram, you don't get the right quantity. Why DHA is required in pregnancy? If you want your child to have a higher IQ and a very sharp eyesight, it is good to take DHA in the 3rd trimester of pregnancy and for the first 6 months after delivery. Yeah. Next slide. Another very important thing, neuropathy in diabetes is the first complication people suffer. People are not controlled. The blood sugar is not controlled very well in 90-95% of patients. And the first sign of complication is neuropathy. Now, everybody for neuropathy, they write all vitamins. They write B12, they write your folic acid, they write your B6, but that is not going to reverse the problem. What happens is inside the nerve, there is a blood vessel. So nerve itself is such a small thing. Inside the nerve, there is a blood vessel. And that blood vessel has to be kept open. And to keep the blood vessel open so the blood can flow and nourishment go to the nerve, to keep that blood vessel open, you require evening primrose oil. This is the only ingredient which gives you one particular prostaglandin, PGE1, which can maintain, and it is there in our normal human beings. PGE1 is the normal human being prostaglandin inside the blood vessel of the nerves. That is the vasa nervorum medically. So this evening primrose oil, if we don't give, we will never be able to help the patient tackle the neuropathy. You can also do the nerve conduction velocity testing before and after 1 year of starting this particular ingredient, and you can see the difference. It really works wonders. And you can give it as a preventive. You can prevent the neuropathy in all the diabetic patients too, depending on how much control you have done for the blood sugar. Yeah. Next one. Next one. St. John's wort is for mood changes. I won't go into that details. Okay. For immune system, we all know there is something called colostrum. Colostrum is the first milk, of the mother. But now colostrum is available as a tablet. And these tablets are one of the best tablets to be taken for immunity. If you take colostrum in a person who has repeated infection, or you give immunity, better immunity to the children, give colostrum, it's like drinking the immune system. This is one of the best thing to do. Next one. This is one of the dengue, everybody knows carica papaya. So the next one. This is one thing which is very, very interesting. Everybody has a will to live longer. It is not easy that you would like to just stop your living. So everybody wants to live longer. And what has God given us? God has told us that as a human being, you can live for 130 to 150 years. That is the lifespan God has given us. We have different lifespan for the dog and for the monkey and for the elephant and for everybody, for the bird. So human beings have a lifespan of 130 to 150 years. That is possible if the chromosomes inside our cell, you can see the diagram of the chromosomes, they multiply 52 times. Now, when you start age of 25 to 30, 90% of the chromosomes become dormant. They don't die. They are there, but they become dormant. And that is the reason why the aging-related changes occur in us. So if we want to live longer, we need to keep the chromosome multiplying that maximum possible 52 times. Now, when this chromosome start multiplying, the end of the chromosome, it is like, rubber. When we have a rubber and we write with the pencil and we take the rubber to rub it out, the rubber becomes smaller and smaller. So when the chromosome multiply, the telomeres, which are on the top of the chromosomes, they become smaller and smaller. Resveratrol protects them. Resveratrol is the best thing if you want to start in somebody around 25 to make sure the person can live longest possible. And when I say 130, it doesn't mean you're going to live a crippled life at 130. You will live as healthy as anybody who is around 40 or 30 or 45. That would be the life sort of quality of life around 130 also. In fact, there are two individuals who have betted at 130 and 150. They betted billions of dollars in US, and they have said on a stamp paper that man can live and it will be possible tomorrow because they have unveiled the secret of aging, and that is the chromosomes. And resveratrol is the best thing. Now, resveratrol comes from red wine, but you can't take it from red wine because you require 250 milligram of resveratrol. For that, you have to drink 117 glasses of red wine, which is not possible. And people don't give resveratrol as 250 milligram, they give 20 milligram, 5 milligram, which will never work. So we should know that we should take the right quantum, which is very important. And you can Google all this, whatever I've said. It is all on Google. It is all available. Resveratrol and aging, resveratrol and chromosome replication. It's all there. Next slide.
So, unfortunately, we'll have to wind up. We'll take
No,
lot of time because
slide.
there are two more.
Last slide after this is the last slide.
Because I myself don't feel like telling you to stop because all this is
No,
pure,
the last. This is the last slide.
pure gold what you are sharing.
Yeah.
This one?
So there are 2 or 3 things you have to be careful. One is what are the contents of the product. One is what are the choice of the form of ingredient. One is the strength of the ingredients. One more slide is there. Thank you.
So all that you've shared is, like I said, it's pure gold. I mean, I know what you've been talking about for years together, and the number of papers, the number of trials you had specified under every ingredient, and you know it in and out, not just out of paper, but having tried it yourself in your patients, having studied it with n number of KOLs and studied n number of evidences. So thank you very much for sharing this, actually, because if people really want to know what nutraceuticals are about and are they safe, are they not safe, how effective they are, this presentation itself can be a very good ready reckoner. We don't need to Google stuff because Google won't be as reliable as you. So thank you so much for coming up. But you have to make a promise to me, sir, and I am making a promise to you rather. The wisdom, sir, that you're carrying with you, I think it is time that we should do more number of sessions. We will, of course, invite more people to sort of deliberate, comment, ask questions, and feel free to utilize our platform to disseminate whatever information you want. And if there is anything we could substantially take forward, that would really be the justice that we could do to your work that you have been doing up until now. You're still not eligible for the RSG Nutrition and RSG Wisdom and Excellence Award because you both have been partner in crime, and you have a very long way to go. So we're going to wait out on it, and I promise you that we'll do more sessions this year itself as per your convenience, so that we can bring out more and more information on these lines.
Thank you.
Okay.
All the best to you. All the best to you. And remembering again, Mr. Gadgil.
Yes.
As we always
so much,
yeah.
Yeah.
All the best.
Oh, sure. Unless anyone in the audience really had any pressing questions to sir, but otherwise we can move forward. Okay, sir, and I would request you to try to be around if you can, because the next one coming up is the award, and this award, again, something extremely close to my heart. I could always say that, whilst I was in the US, my dad was left back in India, but I would not feel the vacuum because I had another one there in New York City itself. So, and why? You will come to know when he comes and talks to you, and he's not only inspired me, but he has inspired many Indians and many Americans to with his achievements. And his achievements are from that era when people would not dream to go to the West. They would never think that we could go to the West. These were the times when Mahesh Naithani sir actually went to the US and has been one of the first successful US-based serial entrepreneurs, someone of Indian origin, and that too since 1980s. He pioneered analytics in clinical and marketing intelligence across countries, and he has worked with world's top pharma companies and healthcare companies. He's been CEO of multiple and founder of multiple organizations. He did his MBA back then um, uh, in marketing and MIS from the University of Minnesota, and he's completed his MA in international politics. That was, of course, in Allahabad in India. Having said that, I take the proud privilege to introduce him further. That his first job really was with the New York Times in medical publishing. This was again way back in late or early 1980s, really. So this was a time where we would never have dreamt of even going to the US, but he was working with the New York Times. He headed the research arm at Miller and Fink, and he was, which was a leader in medical publications. Having worked there, he founded the Patient Care International, which did business in 18 countries, and he finally sold it off to Thomson Group, which is a well-known group in the US. He then became the founder of. He became a founder by acquiring HCL and HCI. So you can imagine, in those days, he acquired a company which was into Medcom Analytics, and then sold it to VNU, which is now part of the Kantar Media WPP, which people who are in this industry would know is one of the very big companies there. He was then the founder of Pharma Spectra, which has built world's largest scientific KOL database with 18 of the top 25 pharma companies worldwide, now part of IQVIA. Again, a very well-known name. From 1982 to 1997, Sir was chairman of HCI and PERC HCI, which are among his achievements. He developed the first measurements of publication readership and publication exposure. He was recognized he was recognized in 2019 as a top amongst the top 40 healthcare transformers by MM&M. Again, a recognized body there in the US. He's been the board member of Princeton Township Ethics Committee, Princeton University, International Cultural Center, New Jersey, Red Cross, South Asian Pharmaceutical Council. He's contributor to the Indus Valley HIV Clinic, Tamil Nadu, India, job training of widows, and contributor for permanent sustainable capital for professional training for disabled children. AT&T Technical Park and Institute for the Disabled in Gujarat. These are few of his social commitments as well. But having said all that, he still continues to work across the globe, and is absolutely inspirational. So, good morning, sir, for you. Early morning. I know we are a bit delayed with our presentations, but I guess the program has been successful, which is why we took a little longer. I am impatient to hear from you, and we really want to learn more from your life journey. And feel free to share whatever you can, so because it's a lot of perseverance, courage, so many, and still being so modest. So these are the qualities I learned from you. You've been a father figure to me, at least. I'm sure after this talk, more are going to feel inspired. Over to you, sir.
Thank you, Rajeshri. Thank Mahesh Darade for coordinating this. Actually, this award, in my own estimation, should go to Rajeshri. She is the Wisdom and Excellence Award person. I have grown with her. I have enjoyed always her smile. I have always enjoyed that she was always contributing while we were in New York. And not a single day I have seen any problem in her face. I'm sure we all go through a lot of problems in life, but not in her case. So, very courageous lady. My journey, entrepreneurial journey, actually started at Allahabad, which is now called Prayagraj. And at the age of 17 to 20, I was doing musical concerts, plays and all that. And the reason I was doing, because I liked it. There was no rhyme and reason. There was no guidance. I just liked it. I thought I could make my living out of it. And it really never worked that way. So, but it was a good start in my life, because I realized that this is, you cannot do the business just because you like it. And even though I made a little bit of money here and there for pocket money, it really didn't take me any place. Then came another period in my life, which is a period at the age of 21 to 23, where I thought, for me, going this way will not work. So I should get a job. And for that reason, I went spent time in Calcutta. I spent time in Delhi and Mumbai, going from one industrial house to other. But as the luck may be, that I didn't get any interviews or nobody really interested, because I had no network and all that. So that was a good lesson for me, that if you don't know people, you don't have a value. And then if you like it, that doesn't create enough reason to do things. So at the age of 22 or so, I left India. And being one of the youngest of the 9 brothers and sisters, my father was retired. He was a professor at University of Allahabad, but he was retired. So I had no guts to ask him to fund my future education or future. So I went to Bombay, and then at that point in time, to leave the country, they were giving £1 worth of foreign exchange. So I took that, and there was a ship called SS Dwarka, which was a cargo ship. And you could just jump in that cargo ship and can go and move forward. And I had to go that way because that was the cheapest way of moving forward. To make the long story short, it took 11 days to reach Khurram Shahar, which is in Persia. And there realized that I am now with no money, no nothing. So I had a watch, which I sold it and got some money for that. And that was good enough for about 2-3 weeks. And after that, I had no money. And then I had to sell one of my jeans. And these things were passed on to me from my brother at that time, who was in Merchant Navy, and he was traveling. So I used to get clothes from him and watch and all that. So I sold that and moved forward. So after that, what I thought, that it's not good enough to like something. You have to work hard at it. So I start picking up labor jobs while hitchhiking at various countries. But mostly I did it in England for three months. And that was my second lesson in life, that liking and hard work is not the only answer. You have to know more than that. So I then moved to US and joined the MBA and finished the MBA. And then I did the internship with New York Times, worked with them, worked with Patient Care International, worked with Booz and Allen, worked with FDA, Food and Drug Administration, and all that. So I had good experience. So by the time I had spent about 10 years of my life. I thought that now is the time for me to start something, but I was very lucky. I had a mentor. His name is Dr. August Fink. I must say that my journey would have been either incomplete or partial or not at all successful without him. And I realized then that we all need a mentor or a coach or a way to learn, because learning is sequential. And if you don't have a good boss, then you don't learn. And so even though I'm in my 70s, I still learn from people like Rajeshri and other young people who I meet. Because one thing, being the youngest in the family, I learned is to be quiet, listen carefully. And that habit did help me later in life, because I still pay attention to everybody who is speaking to me, because I think there is some knowledge. They all have to part some knowledge, and I always learn. So I'm still learning. And I don't know, as Dr. Sangvi said, one could live at 130 and 150. I don't know whether that is a possibility for me, but I enjoyed his knowledge and his wisdom. But after working with Dr. Fink, I worked with FDA and all that. And what I realized that doing things which you like, working hard, and being knowledgeable and having experience is what can make you a successful person. So it's not the liking, it's not the disliking, it's not the hard work alone. It is about experience and knowledge. And some experience and knowledge you can get from books. But knowledge is sequential. So books are not enough. Colleagues, mentor, and other people are very, very important in life, because learning is daily, gradual, and that's how you grow with it. Then, basically, at the age of 33, I started my first company, which is Patient Care International, and did in 18 countries. And I was borrowing the content at that point in time, medical content, from 18 different medical publications to create this product called Patient Care International, and selling to 18 different countries. But Thomson, which at that point in time started owning a lot of publication, and out of 18 publications, 11 of them were owned by them. And they came to me and said, listen, I have to stop this, or I have to sell my company. And I said, no, and I've just started, it's only 3 years and this and that. And they said that, listen, we won't give you any content anymore. So you can go ahead and do whatever you want to do. And I realized that now it's not about me, it's about my product. And so I had to sell it, and then started another company, which is called HCI. HCI is a very interesting thing. My Dr. Fink, who was my mentor in my company at Miller Fink, and for mentor in Patient Care International, one day called me and said, listen, there is a company which is going under, and please go and evaluate. And at that time, I was in Washington, D.C. I went to Philadelphia to see that company, came back. Next day, there was only landlines those days. He called me. He said, how did it go? I said, it's interesting. There is a good potential. He said, why don't you do it? I said, Dr. Fink, I don't have that kind of money to do it. So he said, okay, why don't you come over? And I went next day to Connecticut to his office. And Dr. Fink talked to me, and he said, okay, tell me how much money you will need to do this. And I did the back of the envelope calculation. I said, this was 1982. I said, it will be about $150,000 because I can pay the vendors slowly and can start this. So he opened his drawer, opened his checkbook, wrote a check of $150,000 to me. And that's how I started my next journey for the company called HCI. Now, unfortunately, 2 years later, he died. His wife and his 3 daughters didn't know that he gave me the money. But when I went for the wake, I declared that to his wife and 4 daughters, and and promised to pay them the money back. Now, there is a saying among my friends and among my wife and my kids that the reason Dr. Fink became my mentor was because he had 4 daughters and I was the only son possible for him. And that may have some merit in it, but at the end of the day, he was very, very important in my life to move forward. While I was doing HCI, or this company, 4 years later, I met another mentor. His name was Dennis Turner. And he was a very, very smart businessman. He is also not alive now, but he and I remained friends till he died about 3 years ago. And in his case also, he has 2 daughters, and he treated me like his son. But I learned a lot from him how to do business. So there is a couple of very important saying in my life. And one of the saying is, you don't know what you don't know. And even though we all think that we know what we know, and we know a lot, but at the end of the day, we don't know what we don't know. And that's a very, very important lesson in my life. And that's why I said earlier that I still listen to everybody, no matter how young or old they are, because that's the only way life moves and life's learning goes that way. So when I basically did this HCI, then the company was again 3-4 companies came to buy that, and then I sold it to the competitor, which was Focus and a Perk. And the reason I sold, because I had 80% of market share, they had 20%, and they wanted to remain in this field. So it was a good time for me, and I became the chairman. And then, the rest is history. 27 years ago, the guy who bought the company, he and I are good friends. We are doing business together. His name is Chuck Leonard. He and I are doing business together. So that's interesting that old friendship could have a value and new friendship has the value of learning. After that, I started a company called Pharma Spectrum. Now, in my journey, it has always been very, very important that I must do something which is unique or is a niche in the marketplace. I really don't do anything which is already existing, and most of my work has been through biomedical database, but I don't do anything which is existing. I have to create something which is new, and it's a pain point for pharmaceutical industry. It means they need it, and I must do it, and I must do it so that I have uniqueness and differentiation. And so that's my first takeaway on this, all these entrepreneurial things. Second is, basically, if you dedicate more and more time in your thing, you learn a lot. And which means it is important to be more and more knowledgeable, because when you go to a client, you want client to welcome you because he thinks that at least, if nothing else, whether he buys anything from me or not, he thinks that he will get something, some knowledge out of me. And that has been my gift in life, that I could go and meet anybody And at this point in time, I have about 25,000 people in my network with whom I can talk one way or other in my 50 years of journey in pharmaceutical industry. So that's important. The third important takeaway in my life is whenever you get up in the morning, it should be always there that today is going to be my best day ever. And if it is not, then you know that you are not interested in that work. And I think that's a very, very important lesson for me, that today is going to be my best day ever. And with that, so when I go to bed, I don't think about work. When I get up, I always ready to do something which I think could create either the value or impact in individual's life or in the life of institution. So at this point in time, whatever I'm doing is a global biomedical database. I'm the only one who is doing this. This is the biggest database globally available in the marketplace. And I'm selling it to pharma companies and I'm selling to the institution. But slowly, I want the impact of this data to the HCPs, which is healthcare professionals, as well as to individuals, individuals like anybody, so that they know what is going on. As Dr. Sangvi mentioned a lot of things, I think all that knowledge should be in the fingertips of everybody, whether they are the healthcare professional or whether they are basically individuals, because that is the only way knowledge will go further, and then knowledge becomes the sequential, and knowledge becomes the impact in the life of the people. So these are important lessons. So Rajeshri mentioned when I started in the industry, which was 1982. Actually, I started in 1979 doing part-time to create this content company. But 1982, when I started in the pharma industry, I was the first Indian or non-American to start a company. And while when I was planning to start, I started talking to some senior people who used to respect me and my work. And most of the time, they all told me that, you should have a American as a partner who should be your face, and you should be the technical person, do the work. And this message was conveyed to me basically day in, day out basis for about 9 months. But then I realized myself that this is my knowledge and it is my experience. And I must do it my way, because that's the way I was used to from the age of 17. So I started the company, and it took me about a year or so before people start paying attention, because in 1982, there was no digital media, there was word to mouth. And as I start talking to people, they start getting the value of what I was telling them, or it was helping them to improve their own product or improve their own journey. And because of that, I was allowed inside there. And that's the reason I have a very large network, because people enjoyed. And I still, at this age, enjoy meeting people. And I suppose that will continue, whether I live 130, 150 years or not. But whatever time I live, I think I will always enjoy meeting and learning from people. And that is my mission, basically, to learn and grow with it, but also part my knowledge and my work to all the 8 billion people in some form or other. I don't have the answers yet, but I'm working to see how to provide the information, what I have gathered globally, to all the 8 billion human beings. Whatever the mechanism I use, whether it could be an institution mechanism, whether it could be hospital as a mechanism, whether it's HCPs as a mechanism, or whether individual, I'm working on that because there are, at this point in time, 10,000 rare diseases in the marketplace for which there is no answers. And it is important for us to understand that more and more rare diseases are growing. And since there are not enough patients in the marketplace, pharma companies will not do the research or create a product for that because the audience is very small. So knowing that knowledge becomes very, very important. And that's why I'm putting this knowledge in a way so that each professional to each individuals, or each institution to each individual, everybody could benefit. And that will be my mission at the end of my this journey, which I'm doing in the present science. And this is all I have to say. I'm very thankful for Rajeshri to give me the opportunity, but I admire her courage. I admire her hard work. I admire her knowledge because Rajeshri has a lot to contribute in the marketplace, and she is on the top of her game. And I'm very, very thankful that I met such an individual who could be at that level of success fairly quickly, because she was a shy individual, but she was in the industry were mostly run by the men at that point in time. And she was one of the very few female who were mixing with men and conveying her knowledge and her persistence to convey her presence in the marketplace. And I'm very, very thankful for my relationship or my friendship with Rajeshri. And with that, I will end, Rajeshri, and thank you to you and your staff to putting this together.
Sir, I know you've been, now I know where the father figure comes from, which I always knew where it comes from. However, seeing that you have vision just for Prism now, and you have further vision, and you want to learn, you want to still create, it absolutely inspires and amazes me. I can still remember small incidences where you've been a strong support while I was in New York. So just encouraging someone to or giving the person the confidence that you're doing the right thing, you're in the right place, itself really I think that's contributed hugely to my journey in the US and later. So you continue to be a mentor to me, and like it said that as you grow, like it has happened with you, teachers, mentors, it's difficult to find them, but I've actually been lucky. So having said that, you said you did say that you took a cargo ship.
Yes.
Cargo ship from India to the US. So that is something which today's generation should realize.
Cargo ship, because I had no money, didn't wanted to borrow money, or didn't wanted to take money from my parents. My dad by that time was retired professor, and I was one of the youngest of the 9. So I didn't have courage to take money. So the idea was from the age of 17 how to survive myself for my own pocket money and all that. So that's how my journey, my entrepreneurial journey started at the age of 17. And by the time I was basically age of 33, I learned hard work, knowledge, experience, all that. You have to put it together to succeed. You can't just succeed because you like something.
I am just trying to recap, saying a cargo ship, then to hard work, you said being a laborer. So, and this was all when you were already MA in political science.
Yes.
And born to an academician, it wasn't like you had all the respect around. You still chose to take all these hardships and mentor, coach, teacher. I just want to bring, I'm going to request my team to sort of bring Dr. Mathur on the screen right now, because when you talk about teacher, mentor, he's one more person. The medical fraternity respects him, but I know what Dr. Mathur is. I mean, he's as a teacher, as a doctor, and I had promised him and you, and I'd mentioned to both of you that I want you. He of course lives in India, but right now is in your earlier place in New York. So, Dr. Mathur, you're on the screen here with Mahesh Naitani sir. So these are the mentors I think people should learn from. They are talking about their teachers. Dr. Mathur also has received the RSG Wisdom and Excellence Award long ago. I mean, 5 years ago. So, in the initial ones. And it is such a happy time to have you both on the screen in the same screen. So people really, this program is about bringing these people together. And I don't know, I've already started thinking on ideas how we all could work together. And I will, of course, share some of those insights with both of you after the program. So having said all that, Mathur sir, would you like to say anything? Because sir has also been an extreme spine support to me. He's treated my father in his end days, and ever since that, he's absolutely been there to guide me, and his presence itself has been great. So would you welcome a very, very good morning to you too, or is it already afternoon in New York?
It's still morning.
Yes.
Okay. Rashmi, thank you for giving this opportunity to be part of your program. I enjoyed it thoroughly. Dr. Sangvi's lecture was very, very informative. Okay. I'm sure that everybody would have liked to listen, and I've noted down some of the points which may be helpful to even for myself.
Yes.
Okay. Now, coming to Mr. Mahesh's journey, it's very fascinating to listen to your whole journey. It shows what you've shown is it's a dreams and determination. Two things you had. You had a dream, become big, and you had determination to reach that, to achieve that dream. And that's what it started with when you said that you boarded a cargo ship and did the labor work and ultimately ended up in the top entrepreneur in US. It's a very, very fascinating, and I'm sure it is very inspiring to a lot of youngsters today. Okay, not everybody goes through such a hardship to reach to the top. Okay, so it's a very, very fascinating journey. I enjoyed your whole talk. Someday, I'm sure that we will be able to meet in person and
sure.
Interact someday. So thank you once again to make me part of this.
While we present the award to you, sir, I want to say I think integrity, values, these are the things that I learned from both of you and even Dr. Sangvi. These are the values which it's not only the dream and the determination, but these strong values that you have in you, the integrity that you have in you, makes you what you are, and motivates us and keeps telling young people like us and even the next generation that keep going and keep doing good work. I think that's what is most important to us. Sir, we have the award on the screen. I'm hoping you will be here soon and I can give it to you in person. Else I will have to make a trip to the US. But it's pleasure that digital mediums are allowing us to do this from miles apart. Thank you so much for accepting this award.
Yeah, thank you very much, Rajeshri. And of course, when I am in Mumbai, which I will be there in few short months, I will definitely come and visit you, and we'll have some lunch or dinner together and enjoy our old talk.
Sure. Yes.
Yeah.
Great. Thank you so much, Dr. Sanghvi, also for coming and giving such an great presentation to all of us. And I will have to move on with the last part of the program, which is actually a panel discussion with with and about women. So a discussion which without which this program cannot absolutely be complete. And the topic is empowering women, which we have two great empowered women here today for empowering women health and reproductive well-being with nutrition and nutraceuticals. And of course, there are these different health issues and health fitness that we're going to talk about today. I take the proud privilege to introduce two great speakers, Dr. Sandhya Saran. She's a consultant obstetrician and gynecologist since 28 years with areas of special interest being PCOS, infertility and high-risk pregnancy. She's consultant at the Jupiter Hospital, Hiranandani Hospital, Kaushal Hospital, Cure Hospitals in Thane. Apart from a gynec accomplishment, she's a great performer when it comes to singing, drama, and she's been very active Rotarian and past president of the Thane Obstetrics and Gynecological Society. She does a lot of work and is associated with several other societies, PCOS Society. She does a lot of work with the Menopause Society. She'll tell us about it. She was at their annual conference today itself. And right after that, she's joined us here. And another dynamic lady, Dr. Rajlakshmi Valavalkar. She is a senior gynecologist and highly skilled IVF specialist at Cocoon Fertility, one of India's leading chains of IVF centers catering to infertility and related conditions. Rajlakshmi has actually she has a lot of experience, and she's also done a lot of work in UK. Her career of academic distinction spans over 21 years, out of which she has taken training in India and UK as well, MRCOG and the consultant certification of training CCT from the Royal College of Obstetricians and Gynecologists, London, founder chair of the RCOG India license group of RCOG UK. I can sit and read her CV out here at length because I can tell you so many good things about these two women and the amount of hard work they have been doing in this area is just amazing. And so rightly so that we have them both here today and to educate us today at this first Integrative Nutrition and Health Summit 2024 that we've organized. Welcome to both of you. Rajlakshmi, we can't see your video.
Yeah, my sincere apologies. Something just gone wrong with my
Why don't you log in?
Should I try and log in from the phone?
Yeah, please.
Okay, give me just a minute. I'm going to try that.
Sure.
And if I'm able to do that, then I'll basically set this off.
Sure.
I've been struggling with it for the last 20 minutes, and
no, you can join from the phone.
camera just wouldn't come on.
Yeah. Meanwhile, I think of course, I would like to shoot a lot of questions at Dr. Saran here. So, I mean, I think Dr. Saran, you've been actively working, in PCOS and menopause. Both of these segments, you've been doing a lot of work, a lot of conferences, talks, and initiatives that you've been conducting in this field, and so has Rajlakshmi. So, addressing really PCOS, how much do you see a lot of relevance when it it comes to integrating nutraceuticals with your medical treatments while treating these patients, because such patients we normally see have challenges, lifestyle challenges really, and nutrition has, at least I've observed that in my practice, that it really adds a lot of value. So what are your views on it?
Rajeshri, first of all, at the outset, let me thank you so much. I mean, I'm absolutely amazed at the talks which I had the privilege to attend. Such inspiring talks, and especially such a lucid presentation by Dr. Sanghvi and then Dr. Mahesh. I mean, I learned so much, and I feel such a small figure when you were just enumerating our CVs. I felt we're just nothing. We have to learn so much from you all. So coming to PCOS, yes, we had the international conference of PCOS. It just got over at 6 p.m. at the Leela today, so I was there. And we have a lot of discussion on how the scenario has changed over the period of years. Initially, now I am 30 plus years into practice. So initially, when I was in the beginning, I would see barely maybe a couple of patients in a month. There wasn't so much of awareness, and neither were we really pursuing it so much. But now I see almost 2 or 3 in a day. So we have seen the prevalence also increasing. We are seeing there is a lot of change in the kind of social dynamics of our country and all over the world. And adolescent PCOS is something which, we are seeing is on the rise thanks to our wrong eating habits, the social media, sedentary lifestyle, and eating outside. So there are a lot of things that are happening. All this contributes to nutritional deficiencies. As we all know, a PCOS is basically more of insulin resistance and hyperinsulinemia. So we need to correct that. It is a multifactorial disease. It is got a genetic predisposition. Mothers who have PCOS, or if somebody in the family having type 2 diabetes, it does predispose the offspring also to PCOS. But there is a lot to do with the environment and how you are, what kind of food you eat, the way, what kind of exercises you do, and what is the mental frame, and what is your socio-economic status. So there are too many factors, and we as healthcare providers need to sensitize everybody as to the implications, because what happens is these people tend to develop more diseases later on in life. It's a known fact that PCOS leads to type 2 diabetes later on. There are metabolic syndrome. There is cardiovascular risk. There is also a propensity to develop certain kinds of cancers in the women. So, and also infertility. That is, Dr. Rajalakshmi will be able to tell you the kind of problems we face in PCOS women, especially when they come in the reproductive age group, when they are unable to conceive. So it is a multifactorial disease, and it is becoming very, very rampant.
I'm glad you're raising this voice all across regarding PCOS, because it's not only alarming for the current generation, but it's going to get it's like going to get forwarded to the next generation. Like we got some of it from the generation before. So it's essentially very important to understand from women's standpoint that it's not only their health, but it's also their offspring. Yeah, and like you rightly said, Dr. Rajalakshmi can really add on, because Dr. Rajalakshmi, you're actively doing work in IVF, and we know that the success rates there. So and this kind of infertility and PCOS, how do you sort of deal with this, and do you really find using nutrition or nutraceuticals can that actually aid? Because what I've observed is that inflammation, hormonal imbalance, these things can sort of be supported by using the right kind of nutrition and nutraceuticals.
Okay, so basically, okay, so let us start at the very beginning. Okay, let us try and set the algorithm state first. Okay, Sandhya very, very nicely put forward 2 or 3 very important points: the lifestyle and the genetic factors. We do know that if you have a mother or a sister that has PCO, you're more likely to have PCO. Okay, so there is a genetic factor there. On top of that, the lifestyle has really gone, haywire. People eat a lot of junk food. There is a lot of sugar-rich diet. There is a lot of protein-deficient diet, and all these things end up adding to the genetic predisposition. On top of that, the quality of food that we end up getting is not good. So if we used to get a correctly prepared organic food, sourced food some years ago, but the food that we now have is going to be very high in, endocrine disrupting chemicals. So you have a lot of phthalates and you have a lot of BP and all those things. And that has really got the quality of food down. Stress is also a factor that increases, and we all know that once your cortisol pathway is kicked off, that sort of becomes one more wheel in your clock that is like going haywire now. To add to all of that we end up having obesity, and this obesity comes along with it. It brings two important things. It brings a chronic inflammation state, and it brings a state of insulin resistance. And both these become a positive feedback into your cycle. This not only affects the generation. So now if we take a look at it, our dietary patterns have worsened. They have from our great grandmothers to our grandmothers to our mothers to us, our quality of food and the way and our lifestyle is worsening. So there is an epigenetic factor that comes into play, and this is where and this is what we are faced with at this minute. So if you have to answer this, in my opinion, you need to have a multi-pronged approach. You need to take care of your macronutrients, you need to take care of your micronutrients, and you need to take care of your vitaminics and other things. Because at the end of the day, right, we are talking about life processes. And we know that for life processes to work correctly, we do need our vitamin Ds, we do need our antioxidants, we do need our proteins, we need our omega-3s, we need our zinc, we need our B complexes, we need all of that. And our diet today and the way that we are cooking it has also changed. And therefore, we are not getting as much nutritional value from our diet as we would. So very typically, I think, we need to start with making sure that we have our supplements in place, that which your food is not going to give you. So that becomes my first step of approach when I see these girls. It does mean that I jump into active treatments a little slower than what other people would. But then to grow a tree, you need a good soil, you need a good foundation. And if you're not going to give a good soil, you're not going to get a good tree and you're not going to get good fruits. And by that logic, I do firmly believe that a lot of work. So, you talked about role of nutraceutical in not only disease prevention, but in continuum of health. That is where I think, we have to hit at.
Yeah. So to add my 2 cents to it, what I really take as an approach is, of course, you up the proteins. But while we give the proteins, we try to substitute the proteins with vitamins, giving them a good prebiotic fiber so that, there's a good gut microbiome also. And at the same time, working on anti-inflammatory supplements. This is something, there's anti-inflammatory supplements, plethora of them in orthopedics. But there aren't many which have been utilized or even tried in infertility. So I do a lot of that, and what we see the results are, IVF, the success rate definitely goes up, and working simple things like working on digestion, because working on the food digestion itself can bring down inflammation. When we are talking about Dr. Saran very rightly said that what we eat and how we eat, when we eat, and then at the end of the day, the adolescent girls are not going to stop. So, how do we sort of at least complement it with good foods and secure their selves by doing these kind of things is another thing which you have to look at. So, the current ICMR guidelines will say that for normal individuals, certain things are not needed. But however, having said, the reality is different. Teenagers.
I absolutely second that. You've picked up a very, very topical point out there. Let's talk gut for a minute, right? It is now a well-established fact with multiple research papers to support it that the gut microbiome has got a small group of microbiota which are now called as estrobolome. Okay, and now estrobolome are completely concentrated on managing your estrogen metabolism, and a part of this also happens in your gut. The minute your estrogen metabolism goes out of sync, you have irregular types of, and we know that estrogen is of 3 types, right? E1, E2, E3. Even when the concentrations or the percentage of that gets disturbed, you will end up having high estrogen states, and there comes in your PCO, there come in your fibroids, there come in your endometriosis, and then everything that goes with it. Secondly, we also have a confirmed entity now called as a leaky gut syndrome. Now, leaky gut, what does your leaky gut do? Your leaky gut is causing is like a sequel of complete dysbiosis. With dysbiosis, the gut becomes leaky, your immune system is getting kicked off, and the immune system kicking off is giving you your chronic inflammation. And your chronic inflammation is feeding into your PCO, is feeding into your obesity. So one of the reasons people will not lose their weight, despite you doing everything else, and women will lose a little bit and then they'll hit that plateau and they'll not go beyond that, it's because the inflammation there is not getting controlled. So anything that helps you plug your leaky gut is going to help. And finally, to get pregnant, so from like a fertility person's point of view, to get pregnant, I need good nutrition because I need a good quality of egg cell. If my egg cell is not good, it's not giving me a good embryo. If it's a bad embryo, it's not going to survive. So my patient's not going to get pregnant. She may be forming eggs, she may be forming embryos, but they're not good. They don't stick to the endometrium. They're not robust enough to continue. I will get an early miscarriage. I will get people who just don't implant. And the entire thing feeds in,
So,
yeah, exactly.
Exactly. Today we had a lot of discussion on the leaky gut, and Rajeshri, we had a lot of discussion on prebiotics, probiotics, and symbiotics. So that is what. So what happens is, but the base, if we start from the base, like she said, we always traditionally had something called sattvic food, rajasic food, and we had tamasic food. That is how it was. And the traditional, we never used to eat out. Maybe in the generation before us, eating out was definitely not the norm. So in every household, the food was cooked based on the culture, the tradition, and in a sort of scientific manner. So everything stems from what you are. So when you're eating healthy, when you're eating at home, you're exercising. So everything is balanced. So when there is an imbalance, that is where all these things start coming in. Now, when we have all these dysbiosis, we had all the gut problems, then we start having not only reproductive, but other diseases also. If you go to see, the inflammation is basically the marker where all kinds of diseases set in, be it lifestyle diseases, be it hypertension, be it diabetes, anything. And even later on, even cancers. If you go to see, everything it starts off with inflammation. So we have to set the wheel right. So in order to do that, what happens is, now where are nutraceuticals? When do you need them? Either when you're not getting enough from what you are already taking in, or they have been prescribed to you. And some people take it as a fashion because others are taking it. Some people do it to look good and to feel good. Because nowadays a woman is wearing so many caps, okay? A reproductive age group woman, she's balancing home, career, she's balancing the stresses of daily life. She has so many things, and even the pressure. Like we also as gynecologists, if we have to be on the top, it is not easy. We have to keep reinventing ourselves. We have to keep abreast. We have to keep working hard. Everybody has to work hard. Like Maheshji just enumerated the struggles which everybody has gone through. Everything comes at a price. So what happens? Most of the times the women, the health takes a backseat. So there is where, we need to supplement when we need something in order to cope up with all this. So that is where it comes in. So there are many ways where people look upon it, whether it is something as a supplement, or it is something to energize themselves, or to boost the immunity, or to prevent illness.
So
You rightly touched upon the topic of immunity, and immunity and inflammation are really the balancing acts there. Both are our internal mechanisms for security. So one goes into a doldrum, the other is going to just add to it. So you're absolutely right. And I would like to quickly add to your point, which you also said on the dysbiosis. And so when and the pre and probiotics, which both of you spoke about, I try to use a lot of enzymes and prebiotics, and I'll tell you why. Because probiotics sort of take a little longer in the curve to build up the good microbiome to build up. So if we start prebiotics early, the existing microbiome sort of the good gut bacteria start growing quicker while you're taking the probiotics along. And the third thing is I try to address the digestion with enzymes, so that what happens is SIBO, which can get aggravated, which is small intestinal bacterial overage, which can get further aggravated because of indigestion. That gets addressed. So this three-pronged approach sort of helps bringing down the overall inflammation, and I think all this really affects the hormonal production and modulation in our body. This is my general observation in terms of food to say so, and I think. You did really hit the nail, because the next question I was really going to ask you was related to pregnancy, because you take care of a lot of high risk pregnancies there. So, hypertension, diabetes, fatty liver, all these conditions are going to be there. So, how do you sort of how do you help your patients manage their lifestyle? Do you pre-prep them, tell them that, before going into a pregnancy so that they don't land up into high risk ones? And if they are into that high risk, then what are your recommendations for them?
So, Rajeshri, if we go to see, predominantly we have a lot of iron deficiency in our country. It is not only prevalent in the low socioeconomic group, it is also widely prevalent in the higher socioeconomic group. Thanks to the other kinds of things, I said, like the not eating the right kind of food. Now, how many people incorporate leafy vegetables in their daily diet, or iron rich containing foods? And there are so many deficiencies that we are seeing nowadays. So that is one biggest challenge. That is, we had this Anemia Mukt Bharat Abhiyan. So that is what our society, the Federation of Gynecologists, took it upon ourselves to tackle this. That is one of the things. Nutritional deficiencies. In spite of there being so much sunlight, we are a tropical country, but still we are seeing massive vitamin D deficiency. Calcium deficiency, of course, we all know that there is calcium deficiency, multivitamins. So there are so many deficiencies that we have. So first of all, I always tell my patients, if you are calling a guest at home, then please set your house in order. You can't serve someone a meal unless you have the ingredients. Similarly, if you are planning a pregnancy, if your body is not, in the optimal shape, regards the weight, regards everything, your parameters, then definitely you are going to land up with problems during the pregnancy. So it's very important we emphasize on, iron supplements, folic acid supplements, all kinds of things. And then preconceptional counseling is something which we lay a lot of emphasis on. This is for the normal pregnancies. Of course, infertility is a totally different issue altogether. But even for every pregnancy, I feel that there should be some preparation. Even mental preparation is very important.
Earlier in one of our panels in the orthopedic, rather the surgical, post-surgical panel that we had, there was a good point which Dr. Ashish Albert brought about. He said, we keep talking about nutrition, we keep talking about nutraceuticals, but how much is right? And how do we give it, and when do we give it? If we are able to sort of set better protocols in terms of that, he has found a lot of them very beneficial. So I think we in our practice are also seeing that. So do you think sort of integrating together and trying to make more observations and trying to build more data, because instead of just trying to see what's published in the West, we trying to do more such clinical trials that are at our level would help, because even Dr. Sesikeran and Dr. Sangvi spoke about many such nutraceuticals, and Dr. Sesikeran evidently mentioned that we need to gather more data, and that's how we could validate these therapies and use them for better outcomes.
Definitely, in fact, today we raised this point at our conference, at the PCOS conference. I mean, apart from the iron and calcium and all, we do have a little bit of data. But if we see, our studies are always comparing. See, the body weight, the body composition of our population is very different from where the data comes from. In the West, the requirements, the kind of habits are totally different from our country. So we definitely need data which basically caters to our population. In PCOS also, she just pointed out a faculty from the US. She says, why are we showing slides only with women in the, we hardly show any Indian woman on the slide. So that is the problem. All our data, we say European journal, American journal, Australian journal, but very few coming from Indian journals. Whereas, we have such a huge population and we have so many teaching centers. So I think this is something which we need to relook, and what happens is there may be data in many centers, but they don't compile it, they don't do the statistical analysis, and they don't publish it. Our problem is we do work, but we don't publish it. So then how does it go around?
So I think this is one point which has come out of our discussions, and we three take a effort towards it. And Dr. Rajlakshmi, do add to what you want to say.
You started by saying about how much and for how long. I will because you covered 2 or 3 things in that statement of yours. How much and for how long becomes sort of like an easy thing for me in my fertility thing, right? The reason being my egg cycle of egg development or the sperm cycle both tend to be about 90 to 120 days. So as long as I'm giving for a minimum of 90 to 120 days prior to when they're planning for a pregnancy, or prior to when I'm planning an IVF cycle, I do sort of get good quality eggs. Okay, and good quality sperm, and therefore the embryo quality tends to be better. And we do have data available on this. So the quality improvement is basically the patient pre and post, right? So if you can document an increased number of mitochondria, and you can document better health of mitochondria, then you have the benefit, and that is going to be same for the human race. So yes, we do need. So coming to the second part, taking this example, we definitely need Indian studies. Okay, and the reason we need Indian studies is that the mitochondria of a 42-year-old Caucasian woman is still a lot more robust than the mitochondria of a 36-year-old Indian woman. And we know this for a fact that Indians lose their fertility or lose their ovarian potential at an average 5 to 7 years earlier as compared to the Caucasian this thing. So when you have a Caucasian data and you try and extrapolate it directly, my Indian women are not going to be giving as good a response as I want, because I should have started earlier.
Yeah.
So that brings me back to part 1 of your statement again. For how long? If an Asian woman is going to plan a pregnancy in her 30s, I would rather say she starts taking at least, maybe not a daily supplement, because she doesn't really need to be on those heightened levels, but at least twice a week, at least something to be supplied to her cells, especially as antioxidants. At least make sure that she's not anemic. At least get rid of the anemia, maybe like a year or 2 years before she actually is going to start trying for a pregnancy. So we do need to look into it very, very urgently. And we do need data, but before we start collecting data and churning out clinical papers, we need a benchmarking for the Asian population. We need to know our deficits, age, and the that it has. So we also need basic research for our population, which is so.
So some amount of observe. Yeah, go ahead.
Further to what Rajalakshmi said, see, infertility, it is, something which they can monitor the patient, because patient comes regularly and they are like very compliant. But if it goes to the general population, if you're giving supplements or something to, sometimes what happens is they come to you, they take a prescription, or they take the guidance, and they don't revert back. And I know people who are taking it for 10 years on their own without coming back to you. And then afterwards they come and say, okay, I took calcium for 10 years, I took vitamin D, and you see their levels are so high.
Right.
I mean, there has to be some kind of a follow-up. So that is
Right.
very important when you know that. That is why I think we don't give it for very long periods of time. We always tell them, take it for 6 months, but do come and visit us again.
Right. I think you hit the nail. I was just going to ask you the question that how do you educate your patients, as to what is the importance of nutrition and lifestyle, and what is your take on also integrating nutrition regimen into and regular follow-ups again out there for any of these. For example, menopause, not just infertility but also menopause. We didn't speak much about menopause, so. I mean, menopause is one issue where losing weight is extremely difficult for women. So, what strategies would you suggest, Dr. Saran? Because this is something which you're working a lot on.
Yes. See, there are many factors during menopause. It is a huge transition. So it is not just that some women gain weight, some people lose weight, but they definitely lose a lot of hair and they lose a lot of sleep. Because I think menopause, it is apart from the hormonal transition, there is a lot of mental baggage also. Women are going through a lot of transition. There are issues regarding body image. There are too many things that they're coping up with. So it is a sort of an upheaval in the life. Coming to terms with the cessation of periods is one thing. Coming to terms with the children growing up and, the dynamics of the family changing. There is definitely less strength and energy. During menopause, we all know it's a process of aging after all. So that is why we say you need supplements, you need something to go through this phase. So that is very important. We need to educate them on that. And I think menopause, definitely we see a lot of, orthopedic problems in women because they do have a lot of calcium loss. They do have a lot of, we are seeing increasing number of osteopenia, leading to osteoporosis also. So I think education is one thing, and sensitizing them to come after the age of 40, 45. I think yearly checkups are very important. Women feel that now we've had children, now the periods have stopped, so what's the need to go and get a checkup? It's not only the reproductive health. Overall, we are seeing such a high incidence of cardiac illnesses,
right,
or all kinds of illnesses rising after menopause. And even reproductive, you need to get a scan done every year. You need to get the breast examination done. As we all know, cervical cancers, breast cancers are on the rise. So all this needs to be evaluated. It's not that you stop having periods so you may not have any malignancy. Ovarian malignancies are something which don't come with any symptomatology. So I think menopausal period is a very important phase. And nowadays, again, we are looking at, we call it hormone therapy. It is not exactly like HRT, what we used to call before. But it has become like something which you need to tailor-made to each one and see what suits you. Dietary, of course, we need to really revamp their diet. They need to have more of isoflavones, more of, antioxidants, omega-3 fatty acids, calcium supplements. Just now, Dr. Sangvi mentioned that calcium, vitamin D cannot be in isolation. Vitamin 2K has to be there. So how many people know about all these things? And they say, I'll go and stand in the sun for 20 minutes. So, you have to give them all kinds of things, how to take care of your skin, your hair, your bones, your cardiac status, everything.
So do you also think that just as this initiative of integrative nutrition and health that we have taken up today, can it help as if we could start even doing some programs with your gynecological societies to sort of share more data, and which is where, just as Dr. Rajlakshmi said, that, we could at least have a starting point where, we start, and like it was said earlier in today's talks, that if it doesn't harm, then why don't we try with smaller doses going up? And if there is evidence that is already there, start collecting more data on that front.
Definitely, it is like we go to see these myoinositones, and there are so many curcumin, there is berberine, so many extracts which are being looked at very closely nowadays. So there is a lot of work going on, and there is a huge study going on these factors also, because it is a known fact that all these supplements or whatever herbs, they definitely to some extent they do help. Otherwise, why would people be taking them for so long, especially with menstrual irregularities and ovulation issues and so many other things? If you can reduce the oxidative stress, anything that can reduce the stress works very well. During the COVID era, we have seen how many people, everybody was having all those immune boosters and everything, So definitely we need to study, we need to look at this closely, and there is no harm, especially we have the Indian Menopause Society, we have so many societies, the PCO Society, we are also doing a lot of work on these issues. So I think we should join hands and work collectively, because it is, after all, it is the patient's health and the population at large which we are basically catering to. So it becomes a sort of a responsibility. So definitely, and I am all for it. Our society also, as far as we have different arms of different societies. So we do encourage a lot of research, and I think every institution is also taking this seriously.
So, all in all, I want to thank you. Even after a very long day and a long weekend, you made time and attended this session, which is, of course, the concluding session of today's program. We had a very, and I would like to thank Dr. Rajlakshmi as well for joining in. It's almost been an 8-hour program since morning, felicitating three guests. One, of course, one an Orthopaedician, and then followed by one person from the industry, one, of course, Dr. Sesikeran from the, he's really a guiding light for all of us. So, it was an amazing experience today, having to listen from them, their life lessons. And also having this Integrative Nutrition and Health Summit, we tried to cover most of the topics, right from orthopedics to gastrointestinal issues, issues of nutrition and intensive care, surgical care, and then culminating with gynecological issues and women health. Having said that, this was a very satisfying experience, and I think a stepping stone for us to do a lot of initiatives. A lot of us shared, in fact, a lot, and I think we will sort of put it into a document and share it with everyone, so we can all ideate and do a lot of work integratively. Integration was something which evidently came out, and more information about nutrition was something which also evidently came about through this program. So thank you very much.
I would like to congratulate you, because I saw the faculty and most of them are friends. So I can imagine that you managed to rope in all like-minded people, and hats off to you. Yeah. Only you have the stamina to conduct an 8-hour program, which is so intensive and involving so many, and bring them under a common roof. So I'm really in debt to you. Thank you for having me on this platform.
I loved you saying like-minded and intensive. I think that's the crux of, if this too comes along, we have lots more to achieve. Yes. And I will definitely come back to you with a lot of inputs. Thank you very much, everyone, audience, for joining us. And we would conclude the session with a short video of the sponsors in support.